moderation policies. And, they also had a direct line. I tweeted, I posted one of the emails, but there are many other emails of these weekly disinformation reports that the biopharmaceuticals contractor, PGP, that they were just sending on to Twitter saying, hey, could you verify these accounts? Can you take down these accounts? Here's another kind of trend of misinformation you should be monitoring. They've got a direct line that normal people did not. They were directly shaping the policies, directly contacting the content moderators, directly contacting Twitter's lobbyists. So there's, again, just a power differential. And you're most likely, if you're a normal person or someone who's maybe seen as a dissident, you might not have your voice heard. But if you're this contractor Stronger who's working for the biopharmaceutical industry, you've got a direct line. So there's just a difference there.
Hey, Lee, I'm just curious, and this is also kind of takes the form of a standard lobbying campaign. Having worked on Capitol Hill for 8 years, it's kind of the standard approach, except it's on steroids because now you've got compliance with a platform that has had a fairly broad reach. But I'm just curious if you also happened to notice, maybe not related to this specifically, but any other indications in what you've gotten to look at, if there is any conjunction to this with anybody in the government and what they were expecting or anticipating Twitter to do.
For the particular emails and dynamics that I reported today, I'm not sure. I know that there were kind of vaccine misinformation roundtable discussions with lots of different stakeholders. Of course, I've reported and others Twitter created a special portal, and there were monthly calls with DHS and CDC on some of this misinformation stuff, and that included a lot of contractors. Sussing out, whether it's nonprofit, for-profit, government is sometimes hard to do because, again, if you look at the dynamic with Stronger, this is purportedly just an independent nonprofit, but this campaign was 100% funded by the vaccine makers. So, is that private? Is that nonprofit?
Would you say it got support from the German government?
Well, the German government contacted Twitter in December in 2020 to warn about the serious consequences of these activists pushing for a generic vaccine. I don't know the exact dynamic there. The German government did not respond to a request for comment, but it might be kind of fair to assume that there was some interaction between BioNTech and the German government. We see just from the German media, a lot of German newspapers have reported that BioNTech, the very first week or two of the pandemic, like a lot of the world, they were saying, hey, this is an unprecedented crisis. It calls for unprecedented solutions. We're open to anything. And then, after a month or two into the crisis, or, after the lockdowns, they were seeing the potential for unprecedented profit. So BioNTech started lobbying the Angela Merkel government, lobbying different arms of the coalition in power in Germany at the time, to say, hey, look, we can't allow any of this patent sharing, any of this IP sharing. We can't. Don't support this at the WTO, WHO. Don't do any of this. And the German government was very dutiful in following BioNTech's commands. I mean, that's not my reporting. German press has been on this for a while, and so in the Twitter files today, you see the German government also making this demand. So, I think it's safe to assume that that's because of BioNTech's lobbying, but, that's not very clear yet.
Right. Well, could you just quickly... I'm sorry.
Real quick, Brian. On that email that you referred to in your drop today, you had the BSI apparently contacting BioNTech. Is that the only connective tissue between those two entities that you saw there? We'll go to Brian right after, but that you saw in the stuff you pulled up, is that all we've got, and therefore you put something out to the German government and they haven't responded? Does that kind of sum it up?
Lee, you're muted because somebody clicked the mute everyone button.
You got to unmute.
Sorry about that. This is not even close to an exhaustive search. I was only on Twitter a few days, did a few searches. I'm still making sense of the emails in there. I wish I could see, more of the interaction. What happened on every single one of these accounts? What happened with some of the individual correspondents, especially of those Twitter German lobbyists and spokespeople who are clearly interacting on a more regular basis with BioNTech and the German government. I just don't see it, so I can't say. I'm only reporting what I know definitively.
Would you say that because the lobbying firm that emailed Twitter, right, that contacted Twitter these initial requests, because they had the support of the BSI from the German government, would you say that Twitter felt perhaps compelled to act because this wasn't just a lobbying group, it was the German government basically saying do this thing that they're asking you to do?
I think that's fair to say. I mean, it certainly adds more heft if it's a powerful government agency, especially Germany, with pretty strict speech-related laws. But that's true for any country. If the FBI forwards on just a request, even if it's not a subpoena, that just carries more heft, more weight. Twitter.
And Lee, just for clarity, what exactly? Just so I know they did stuff. What exactly did Twitter do in response to it? Because pharma's horrible. We all know that. Big corporations terrible. Government's terrible. What did Twitter actually do? So just so I'm aware.
On this particular BioNTech request, it's completely unclear. They might have taken no action. They certainly monitored accounts. I see some follow-up Twitter threads where the moderation team from around the world started looking at individual tweets. Is this spam? Is this something we could flag? Could we call this harassment? Could we call this fake accounts? They weren't sure. They were debating it. So I'm not sure if any action was taken, but it certainly shows the motivation of the vaccine makers and potentially the German government. But
of course. What Twitter does is probably supremely important, right?
On this particular issue, it might be, but on the other, there's kind of two stories melded into one today. One, this singular BioNTech request, and the second, this larger campaign by the vaccine makers through this group Stronger, where there were, weekly requests for takedowns. It looks like a lot of those tweets were taken down, were labeled. So it's a little bit of both. Here we can see it's not on the BioNTech request. It's not clear if there's any action taken, potentially not at all. On the Stronger campaign, where there's this weekly misinformation report, it looks like Twitter did take action on a lot of those. So, it's not like every single request was fulfilled by Twitter. It's more of an interaction. So it's a regular lobbying effort.
And we probably need to go to Brian next, but there's a Five Eyes potential connection there. By the way, when you consider the BSI getting involved there, and nothing is established obviously in that regard, but you just wonder where the Five Eyes connection is to BSI in this. Go ahead, Brian.
Yeah. Thanks, Jim. So I just had a question about the Twitter files in general. It's kind of a two-part question. Number one, are you guys as journalists given access to the entire database? Are you able to just search for whatever you want? And given that answer, do you know if there's other companies? I'm assuming there's other organizations, other lobbyists, other efforts by others to influence Twitter's moderating decisions, whether it's Mothers Against Drunk Driving or whoever.
On the first question, I can only speak from my own experience. I think other reporters had different experiences. Barry Weiss and Matt Taibbi were in there earlier than I was. But basically I make kind of search string requests to a Twitter representative, and a Twitter attorney carries out those requests. And those requests can be done to emails and attachments, and also this database that some of you might have heard of since you're following this so closely, this JIRA database that kind of shows the back end of each account, action taken on each account. So I had a few days to make some of these requests.
Did he drop out, or is it me?
I can't say anything beyond that. I believe they use some kind of litigation tool that most big corporations have to do these types of email and document searches within a company. I believe they're using a software solution like that. I don't know. And then I'm sorry, could you remind me of your second question?
Yeah. It was just so. I mean, I would assume that it's not uncommon for lobbyists, political organizations, even just groups like Mothers Against Drunk Driving to ask Twitter to consider moderating certain content. Do you know, based on any of your searches, if that's the case?
Yeah, I saw a little bit of that. I don't want to get ahead of myself. I hope to do a few more stories. But yes, certainly other interest groups were pushing, other government agencies, political parties, candidates. I think there's probably a lot there. There's so many other interesting stories I'd like to report. But yeah, that's definitely the dynamic. I gotta jump right now.
Lee,
This is my very first Twitter space, so thank you for
all
inviting
good,
me.
Lee.
All good,
This is a lot of fun. Thank you for this. I appreciate it, and I'm happy to take.
Thank you, Lee.
Just
Yeah,
PM me,
pleasure to have you, man.
I can try to get to that later, but send me a question over Twitter.
Sounds good.
Yeah, sure. And just whenever you want to join back, just DM me as well if you get more time later on. But otherwise, thanks for coming in and answering the questions.
Thank you.
Thank you for the invite.
Thank you very much.
Thanks, Lee. Thanks, man.
Take care, man. I just want to go over what Lee said. I
was gonna ask you because I did tune out for about 30% of it. I had to deal with something.
Sure.
So I'd love to get like a quick overview of what he said. I heard Brian, you had a great question, by the way.
He did.
I like that. He touched on a few interesting, and it's a valid question as well. But go through. Just give us a quick overview, Ian, and other panelists. If we missed anything, do let us know.
Okay, so going over what Lee said, I mean, it's basically an overview of the Twitter files. Essentially, you had an industry lobbying group at first. So it's like two stories wrapped in one. The first is it shows motive, right? It shows motive, and it shows that BioNTech and Pfizer used the German government, what's it called, the BSI, which is Germany's, the German government's science division, basically, right, to lobby Twitter to suppress and censor any activists who are calling for the patents for the IP for the vaccines to be released to the public, to be made free or to be made very, very cheap, right? Like that was the first call of censorship. So that proves the motive that this is very profit oriented organization. This is not them doing things out of the goodness of their own hearts. That's the first part of it. The second. And it's unclear if Twitter actually acted in suppressing those accounts that were flagged by this organization, right, to censor them. It's unclear if they did any of that because the emails are a bit spotty due to the fact that a lot of this stuff is handled in Germany by different organization from Twitter, right? Like basically it acts as a go-between Twitter and the local organizations there, whether it's a government or whatever, right? But they would forward their recommendations over to Twitter, and Twitter did, to my knowledge, act on at least some of it. They monitored these accounts. This is proven in the files that they monitored these accounts that were flagged to them by the industry, right? By the biopharmaceutical industry. So that's the first part of the story. The second part of the story is that BioNTech, Pfizer, and Moderna, and basically all the biopharmaceutical companies created or funded this supposed nonprofit organization that was fully funded by them to shape discourse and censorship and moderation policies on social media platforms, whether it's Facebook, Twitter, YouTube, etc. And these guys were responsible for sending weekly reports to the social media companies to ask them to take down content that was critical of the biopharmaceutical industry. It was a very one-way thing. They did not make any requests to take down disinformation published by, say, Albert Bourla, the CEO of Pfizer, or any pro-pharmaceutical Twitter accounts that were putting out false information, like outright false information. They were not asked to be taken down at all. It was only directed towards anyone who was critical of the biopharmaceutical industry, meaning, the vaccines, or whether it was the lockdowns or mandates, anything that affected their bottom line. So this was well beyond the scope of simple misinformation. So if a person said that, Bill Gates is putting a microchip in the vaccine, that was flagged as misinformation, and obviously it is because it's nonsense. But the scope was not limited to just those kinds of posts. It was actually so far reaching that it was going after people who spoke out against vaccine passports, against lockdowns, against vaccine mandates, like the OSHA mandate. People who tweeted about these things were flagged for censorship, right? That is shown here in the drop. And I think a lot of people here know someone, or at least are personally affected, like I was personally affected by speaking out against vaccine mandates and speaking out against lockdowns. That was considered disinformation or misinformation, or however it is Twitter likes to flag these things. So they were going after accounts that were critical of the industry. And more on that note, because it's not clear if Twitter acted on every single request. However, requests were being made weekly, and the emails are shown in Lee Fang's article, and he posted one of them in the drop, showing that this is a weekly thing. So this was an ongoing partnership between the lobbying group that was funded by it's called a PGP, and they ran a campaign called Stronger, and they were actively working with the social media companies to crowdsource their censorship. They were sending in weekly requests to give verification to specific individual accounts. So if you were friendly to the industry, or if you worked in the industry, you had the ability to make these censorship requests. Basically, it was a very one-sided thing. So if you were a critic of the industry, there's fat chance that you could report anything, right? Like, it wouldn't really go through. But if you were a certified doctor, for instance, that was certified with this group that had a verification tool, you had, in a way, in many ways, whether psychologically or through algorithmic systems, you were able to, have a larger reach, a louder voice, because before, Twitter was giving out, $8 verification signs. The only people who had these verification checkmarks were individuals that were either journalists or people that were selected by Twitter to have those accounts. And this group successfully got a whole bunch of people verified, and so their voices arguably were louder than most other people's because they were experts. And so the censorship works both ways, right? It's both positive censorship and negative censorship. Negative in the way that it's actively suppressing people's voices, whether through suppression or through banning or through shadow banning or whatever, and positive censorship through the elevation of certain accounts, certain voices, for them to shape the discourse. And that was actively happening. That is shown in today's Twitter Files drop. So that is where we are at so far.
And by the way,
so you cut out, Jim?
Jim, you're muted, bro.
Oh, sorry, it muted for some reason. Sorry. Anyway, so number 10 of this drop, just to talk about that algorithmic thing that was working to censor these items. They had also developed, and it sounded to me like Bio had given money to Twitter to do it, to put in a system where people could purposefully go in and tag misinformation. That number 10 had that one flyer that had been put together by Stronger. And, that's a significant thing, too, because that gives activists the opportunity to go, crowdsource the dropping of information as well. So there you go.
Yeah, I wouldn't say that Twitter got money from them necessarily. I would say that they had basically set up a very simple system for all the people that they had crowdsourced to perform censorship. That was what was being funded. So just so we're clear, it wasn't Twitter that got the money. It was more like Twitter helped to facilitate that. Twitter enabled them to have an easy access system for all these verified accounts that had special access to special reporting tools, which were like baked into Twitter itself to be able to do that. This is actually a press release that was put out by Twitter itself. When all this was going on, they said that certain accounts, expert accounts, would have the ability to flag vaccine misinformation. And from what we now know is that they were not simply flagging tweets that were, outright misinformation, outright bullshit, if you will, like 5G or microchips or whatever. They were actually suppressing any sort of conversation revolving around vaccine hesitancy, vaccine mandates, vaccine passports, lockdowns, etc.
Ian, here's the good news.
Before you go to Fidget, hold on.
Just 2 seconds.
Hold on, bro. Hold on. Before you go, just wanna anyone requesting to speak, do DM me so we can see it, because we're not seeing requests. Also, Tracy, welcome to the panel. Before going to Fidgeto and Joanna, because Fidgeto, Joanna, and Nelson also want to give them the mic, and Barbara have been waiting for a while, so I'll give them the mic right after you, Fidgeto. Quick question, Tracy, did you see the latest file drop? Because I saw you just joined now.
Yes, I read through it. I was in the middle of the Intercept article. Man, oh man, do I have a bunch to say about that. I shall wait my turn.
Okay, we'll give you the mic in a bit.
It's good to have you here, Tracy. It's good to have you here.
Mario,
what's up, Bernard?
Li Fang was actually listening just now, but left the room. So if there's any way you could get him back on here, that'll be great.
No,
he said he's already spoke. He spoke here already. So.
Yeah. So he was just listening in to see what we're talking about. Yeah, that's fine. And he can join us anytime he wants.
Go ahead, Fidger. You were saying something before Nelson and Joanna could take the mic. And
all I was going to say is that we are all in the same concept today that we have to agree that no mainstream media is going to cover any of this, right? This is how do you cover this?
100%.
100%. I would love to jump in here because I think,
Yeah, of course. Go ahead.
Yeah, Mario, and hi, I just want to introduce myself as the first time I'm speaking on your stage. I'm Barbara Majeski, and I'm a television personality. I go on Fox and Friends, the Today Show, Hoda and Jenna, and it's great to be here. I'm good friends with Nelson and Gran and a bunch of other mods here in Twitter Spaces. But I have to say, Mario, I agree with you that this could be the most nefarious drop so far. And it's going to be very hard to play devil's advocate in this space and really understand the justification here. Because, first of all, what they identify as misinformation or disinformation is completely subjective. And obviously, now that more information is being disclosed, it was them with the misinformation, the disinformation, and they did dismantle our voice. I do think we need to make a dissemination, though, between Twitter after Elon and Twitter before Elon. I think there's a big discrepancy between those two platforms. I almost feel the need to call it like Twitter BE before Elon. I'm one of those accounts, by the way, that is shut down. This is my third account. My original accounts were shut down because I have a vaccine injured son. So I have been advocating for informed consent for 17 years. My son now has vaccine induced epilepsy. There's actually a YouTube on it. I did it, 15 years ago. I filed through VARs. Like, I've done all the things. What a crime scene. So my account was always like flagged for quote unquote misinformation. But Faisal just said something that I find most disturbing in all of this is, number one, we are here talking on Twitter Spaces about this information that clearly is probably one of the most disturbing news topics of all time. And the mainstream media, it's all paid for news, mainstream media, which is what I am in, will barely make a blip about this. I have so much to say about the news that you're getting from MSNBC, CNN, even Fox News Network. I could go on and on, but I think there's a lot of nefarious things at play. I think that this is clearly the most disturbing Twitter drop, and it'll be very hard for people to play devil's advocate in this space. This is disturbing beyond metrics.
Yeah, so I want to, Joanna, can you help me? And you and Nelson, Nelson will not be able to help me on this one. Before going to Tracy to get an overview, Joanna, how can we play devil's advocate? Like, how can we say this made sense? Like, maybe we could say,
I don't think you can, Mario. I don't think it's
now, how about this one? How about this one? Which company? Well, hold on. Which company? So did Twitter act on the censorship for anyone requesting for the tech to be open?
It is unclear. That is unclear thus far.
Okay.
Yeah, we don't have the back and forth.
Okay, so then maybe an argument, but then maybe an argument will be like, hey, which private company doesn't want to, try to imagine getting social media to kind of censor my competitors? That's any business's, any capitalist dream.
And then
if Twitter
that is exactly what they were doing. They were trying to censor their competitors or any calls to have any sort of industry competition because it's not in the interest of the biopharmaceutical biopharmaceutical industry to have competition. They have a monopoly.
Just say fuck my ass.
Yeah, yes.
Go ahead, Joanna. Go ahead, Jen.
But wait, can I just ask Jim? Ask Ian one. I just want to ask Ian one question, and that cracks me up. But, you had talked about the 5G, people talking about 5G causing, COVID or, Bill Gates planting microchips in us, what have you. What I find interesting about that dialogue, Ian, is that, what who are we to decide what is information and what is disinformation? And you made that delineation, and I'm sitting here going, why don't we get back to critical thinking? Let's get back to critical thinking. Allow people to say it's 5G. Let it go for it. You want to think like, the Middle East crisis is caused by COVID-19. Go ahead and have the freedom to state your case. But I want to be part of a movement that's like, you can believe what you want to believe, but I'm going to be part of the movement that asks for receipts, asks for full authenticity, clarification. I want all receipts on the table, and I want full transparency. So, Ian, I found that interesting. I'll land it there. Thank you.
Let's
think about this.
Agreement with you. I do believe that everyone should have the ability to believe whatever whatever it is they believe, right? And they should not be suppressed for it, because the more you try to suppress this information or these thoughts, the more people will start asking questions. It'll be like, well, why are they trying to silence me? And so it actually creates a negative feedback loop where the more you try to censor people, the more they try to say it, right? And so I'm in complete agreement with you there. But the reason I made the delineation is because supposedly, and again, we can argue about the ethics of censoring anybody at all, which I disagree with. I don't agree with like censoring people for saying stuff like that or thinking stuff like that. Is that they went well beyond the scope of simply censoring those accounts and went into political arguments where people were criticizing vaccine mandates and vaccine passports and lockdowns and vaccine hesitancy or the political implications of the OSHA mandate, for instance. They were censoring those as well, and that's where this becomes more than just, we care about the public health, therefore we want to prevent people from getting false information. You could argue, I think they would make the argument that it should be okay to censor certain kinds of information if they deem it to be, in the interest of the public good, right? Like that's why the organization itself is called PGP, Public Good Project. And yet it went well beyond that, and they were censoring anyone who seemingly had any sort of negative impact on the bottom line of Pfizer, right? So if you criticize vaccine mandates, or if you said that the vaccines were too expensive, things like that got you censored. And so this was very clearly a very profit-driven
the price one is insane. Joanna,
exactly.
I want to give you and Nelson the mic. You and Nelson the mic before going to Tracy and Tara. That's insane. Like to have I don't know if we have the ability. We can't say they have the ability because we don't have any proof. And I'm sure if they had proof that Twitter acted, either it will be in the next drop, or they would have shared it.
Even just the mandates, because when we talk about mandates, there's the political aspect of it. Obviously, like how much freedoms are you willing to restrict and so on, and people should be able to have that conversation. And if pharmaceutical companies are stepping in and saying, no, you're not allowed to have this conversation, the question is, why do they care about the vaccine mandates? I mean, how does this affect them? Well, obviously it affects them because they stand to benefit from vaccine mandates, because it means that their products get sold.
See, we've got very serious conflict of interest. Joanna?
Yeah, no, I think that Ian is just hitting the nail on the head. And this, I just want to say, is a really powerful and important drop as we understand this moment in history. And I want to thank Lee. I don't know if he's still listening or not. Just, the fact that this may suggest censorship on behalf of private business is really a new, interesting, and important topic that we need to delve into, because amidst the tumult and fear, we've talked about safety and efficacy a lot leading up to this point, but now we really have the merger of government, private business through the form of big pharma, and media. And I think that taking a step back, we can see through the creation of these disinformation governance boards that, the capacity to which we don't really understand exactly how that had impact on Twitter, but the fact that they existed may belie motivating factors that need to be explored. And I've listened to some of your other spaces, Mario, and I think that the relationship now between private business and government manifesting through groups like BIO, which is the lobbying group for Pfizer, for the listeners right now, how that
we've crossed the final line, in my opinion, Joanna.
Yeah.
We've crossed now the final line where financial motives and censorship
Can I add a little bit more
become
to this?
one.
Well, let me.
Just
Do you mind if I throw something in here?
a tiny bit, and I'll let you go next, Jim. I just want to add to what Joanna is saying, is that one thing that we need to take in mind here is that it's not just Twitter that they were lobbying. They were lobbying other social media companies as well. And as we all know, Facebook actually took direct action to limit anyone who was criticizing mandates and lockdowns. And those policies are still in place.
I want to see, I want to see if they did act. I'm really curious if they did act on the anyone requesting for the vaccine to be open, not the vaccine being open.
You can't talk about lockdowns on these platforms. You will get censored for it. Like, try it. Just literally go try it. And also, I just want to add one more thing.
Yeah, quickly, because I want Nelson, Tracy, and Tara to jump in. Go ahead, man.
Hey, give me a chance there too, Mario.
Okay. All right, guys.
I'll go first, and then Jim goes, and then we can have Nelson. Yeah. So the point I wanted to make is that these lobbying groups are not simply restricted to social media as well. They were also lobbying media companies, so meaning television, newspapers, and so on. And this explains why all these newspapers, all these publications were very pro-lockdown. They're very pro-lockdown, very pro-mandate, and now we understand that there's this financial motive to basically push the vaccines, not because they're trying to brainwash us or anything like that. It's more like they were trying to do everything in their power to protect the bottom line of these companies, and certainly in the interest of groups like Bio, right, and they represent the biopharmaceutical industry. To speak out against anyone or silence anyone who wants to end the lockdowns, who wants to end the mandates, because that would actually impact the bottom line. So this was a broad sweeping effort, and Twitter was simply a part of it. It was one of the targeted organizations to shape the discourse around lockdowns, around mandates, and around things like this, to promote all of this stuff that was beneficial to the pharmaceutical companies. That was that, and that's the bottom line there. And so I would like Jim to go next.
Yeah, so there's something important to realize here. This is the amazing aspect of this. Like, we didn't see any direct connection with government other than the brief reference to the German government organization. But what's really critical to understand here, like Big Pharma and all them, they obviously want advertising advantages that they can get anywhere with anybody, and I guess that's maybe free and fair in a sense. But what's happening here is under the umbrella of a government imprimatur about getting a vaccine out quickly because we got to save everybody, and then we're going to fund the development and help it along, and blah, 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 blah. All that stuff, they're coming to Twitter and Facebook. By the way, don't underestimate the fact that Facebook was huge into it, because we saw it in number 10 of Lee's thing today. But this is what's really critical. They are leveraging the government imprimatur on producing a vaccine and having produced it to get this benefit from Twitter, as I think we have to presume they were getting from others. That's part of what makes this so evil. Like, it's a big tech companies or a big pharma company's dream to be able to get this kind of special treatment. Anyway, with that, Tracy probably needs to go after me there.
Okay, thank you guys. Yeah, a bunch of stuff here. It's not just the vaccines that we're learning about. It's also therapeutics, right? And if you think back to what they did to ivermectin and hydroxychloroquine, 2 drugs that were working in early therapeutic treatment, both of them off-label, off-patent, not big money makers. It makes a lot more sense now why this happened. It was seemingly purely financial, although I can't help but think there might have been some more nefarious stuff. And also, just to comment real quick on the other point that was made about the Disinformation Governance Board, that was just a shell to kind of make it okay to do what they were already doing and continue to do. We learned just the other day out of the lawsuit that's tackling all this that Facebook was literally banning the vaccine injured from being able to speak about their stuff. They were shadow banning them into oblivion, so that even though what they were saying was true and didn't break terms of service, they were deboosting them, breaking up their groups, etc., because they couldn't have that mantra get out that vaccines may not be, safe for people and whatever. And I shuddered to think that this is financially driven in a way, because they've got more money than any industry could ever know what to do with. So the fact that it seems like this is very money driven for them at this point with this drop is even more concerning to me, that they're like, you'd almost want there to be some other reason other than just money. It's hard to believe that it was just money, but I'm good. Thank you, guys.
Well, they used to tell us it was to save lives, right, Tracy? Like, you're hurting people. If you come out with any other narrative on social media, you're potentially causing someone to die, to not take the vaccine, and so on and so forth. But now we see the alternative. Now we see young people dying. I just found out today, sadly, that American Idol star died at 31 from a heart attack in Alabama. Just awful news that continues to come out and continues to make you wonder how many lives would have actually been saved if we were allowed to speak and allowed to ask questions and allowed to follow through with that information.
So, Tracy, when you mentioned that it could be is it only money? Do you mean like it could be something worse than money, or you mean it's a mix of money and like could be a mix of money and thinking it's the right thing to do?
I don't think that they thought it was the right thing to do, because in the face of all the safety signals and all of the study that they did to still push this thing out, there's nobody that could have thought that was righteous, especially not at the pharmaceutical companies level. I'm stunned that it is all about money, given how profitable that industry is, and given they were able to already escape liability. And if they thought what they were doing was so just and that it was a life-saving cure, you would think they would have opened this up to any nation to replicate. But they didn't do that. Instead, they went around with no liability clause and made countries contract with them for drop ship of this stuff. Never mind the volatility of it, especially in the beginning, and the necessity to freeze it and all of that. But they basically cornered off the market into a monopoly, decided that they wouldn't have any liability for anything that came from it, and barred anybody from even talking about that on social media. It's evil. Like, there's no other way to explain this whatsoever.
Nelson, I'll let you go, man. But I'd like Lisa and Brian to go afterwards,
There's
because
precedent for this. I mean, on the topic of it just being about money, it shouldn't actually shock you, because the gasoline industry,
every company, but I mean Apple, Facebook, every company wants to make as much profit.
Before that, with regards to health, for decades they used to put lead in oil, right? They used to put lead in gasoline because it let it burn longer, it let it burn, and basically they were able to use less fuel by putting lead into it, and this actually caused a massive rise in cancer. The reason why a lot of older people nowadays have cancer and they're dying of cancer is because of lead in oil, right? This was done for decades, and they knew what it was doing. They knew 100% that leaded gasoline was causing people to get cancer, and they knew that, and they suppressed it. They suppressed the science, they suppressed the research on this, and they it wasn't until like massive lobbying efforts from health groups, from health advocates, that the governments actually finally banned leaded oil. But there are places in this world where gasoline is still leaded. It's pretty fucked up, but it lets them make a lot of money. So profit is and can it can be the number one and only motive, and I think that's what we're seeing here. I don't think there's anything necessarily more nefarious, or that there needs to be anything more nefarious. They're simply greedy assholes.
Hey, Ian, does it make you question, and maybe this is also for Tracy and Mario, does it make you question the altruistic nature of which they marketed this vaccine for, that they won't allow the patent and the intellectual property out to anyone else? That's my first question.
That's
my second question.
What I was just saying.
That's a good question.
Yeah.
Yeah, like the reason they don't want people to know what's in there is because, the science itself is not good on this vaccine, right? As we are now seeing, there are many people with vaccine injuries, and they're suppressing the data for vaccine injuries, so they try to play it off as something else, or they call it disinformation if you even talk about it. So they're worried about their bottom line. That's the only thing they're trying to protect. And keep in mind, these organizations, they're not working for some bigger nefarious entity. There doesn't need to be one. This is these are organizations that want to last decades, if not hundreds of years, if they can. So it's not in their interest to lose money on this, right? They want to make as much money as insanely possible, as humanly possible.
But how much money do they need?
There is no
limit to it. This goes to human nature. Yeah, but it goes to human nature. Like, the greed is one of our fundamental biases. Like, we always want more. The curse of always wanting more. Like, Nelson, would it be surprising for you, before going to Bernard, Lisa, and Brian, would it be surprising for you if they just keep wanting more and more money?
Of course not.
And do you think, and Nelson, I'm going to ask one more question to you. Do you think, because I know Lisa will make that argument, do you think that some of them, I wouldn't paint everyone in Pfizer as a bad person. It's a really big company. I'm sure it has bad people, good people, systematic biases, and the executive team obviously are the ones pulling the strings, and they got the financial incentive. What's your take on it? How would you look at it all?
I mean, very simple, right? If you work for Pfizer and you know a lot of these things that we don't, especially when it comes to the data, especially when it comes to, the censorship, et cetera, you're just as liable, in my opinion. You're a goddamn criminal, right? So, I mean, that's how I feel about it. There's no innocent person. If you know something is harming people, right? If you know lies are being told to protect something, whether you work for the organization or whatever the case may be, I don't care if you're the janitor, right? If you happen to walk into a lab one day and see some documents that didn't make sense to you, you're a goddamn criminal, respectfully. That's how I feel about it, right? Because here's the deal. They're worried about the bottom line, but the way they're going about protecting their bottom line is affecting a lot of lives. That's a fucking problem.
I'd like to comment on that.
God damn, I just got the microphone, man.
Sorry. It's just sorry,
Lisa, well, I think we all would like to comment on that. So let's try to do this in some kind of coherent order. Because I would like to comment as well.
Right, absolutely. So listen, man. Some of us are going to end up on the right side of history when this is all said and done, and some of us are not going to. Right? I know I'm going to be on the right side, and I already know Jonathan Bing and some other folks will be on the other side. But I mean, bro, this is crazy, man. Every day now we wake up, it's something new. It's something new about the vaccines. It's something new about the vaccine manufacturers. Every single day now. Have you guys noticed? Literally every day we have something to talk about this. Right? It's absolutely insane, man. It's crazy. I still don't understand why we still have the other side. Like you shouldn't even exist right now. Right? But it's all good. No echo chambers. So let's talk about it. Appreciate you, Mario.
Lisa, Bernard?
So,
yeah,
Bernard, do you want to go first? Go ahead.
Yeah, so basically, I don't agree with Nelson in terms of saying everyone's liable. I do agree that if you had direct information or direct knowledge that there was something nefarious or duplicitous happening within these organizations, yeah, you're liable. But that's just like blaming our troops for Iraq or Vietnam. I mean, we all know that our government does things. They lie to us, and they do things that they think is altruistic, and they use the people to accomplish their goals. And that's not anything new here. But I think it's important to recognize that, yes, there was clear misinformation that was propagated by the so-called establishment under the guise of science. And there's a continuing pattern to censor information that would be helpful for people's health and wellness when it comes to the vaccine and the pandemic. I think that's abundantly clear. However, the difference between myself and many others is that I don't jump off a cliff. I'm always grounded in the information that's available, and that's the most empirical, high quality data that we can highlight or at least acknowledge to make our decisions. So Ian made a comment about 5G and a lot of the BS things out there. I agree. There's a lot of folks who are just jumping off cliffs, making up stuff with no basis. However, I do agree with Barbara as well. You can't censor these people. I think everyone needs to have a voice, and the American people are not as dumb as they try to make us out to seem. And we should be able to sift through this information and trust those who are able to verify what they're saying rather than speaking in anecdotes.
And to Nelson's point about, whether or not people knew or if there are, there's being information suppressed or hidden or things like that. I think one of the clear ways to delineate what's true and what's false about what people know is to see how many Pfizer employees and executives are vaccinated. Because if they believe in their in the validity of the studies, which I actually do, then if they thought that it would cause harm, they wouldn't have vaccinated themselves.
Liza, were they exempt, or was that just fake news circulating the
internet?
No,
they would. I don't know definitively, but my presumption is that they were vaccinated. So
they were mandated to get the vaccine. Would you or anyone else have that information?
I don't have that information. Okay, I don't have that.
We had a board member that was Aaron. Yeah, go ahead, Aaron.
Yeah, they were mandated to get the vaccine. Pfizer employees were mandated. So
yeah, I've heard the same.
Losing your job is not a form of informed consent.
There was a story that came out just yesterday about the Pfizer vaccine, the employees, the lots that they were given were separate than the other lots that were distributed to the general public. And I'll find that and share it here.
That's disturbing because that lot could have just been, some sort of saline. That's crazy because there's a lot of batches out there that are bad batches.
Yeah. Once again, I think that there are a lot of crazy stories out there.
It's not that it's saline, right? The thing is.
Go ahead, Lisa. Go ahead.
Can I go first? I just want to correct on the story. It's not that it's saline. The thing is, the issue here that a lot of people are talking about, like when you read the article, that Tracy's referring to. It's not that it's not a vaccine, that they're unvaccinated. That's not the case at all. It is a vaccine. The issue here is that those lots were vetted to be in good condition. The problem is there are a lot of bad lots out there, especially in Australia, where this stuff is being uncovered right now, that were given to the public, and those bad lots may have resulted in vaccine-related injuries. So people got the spike protein instead of the vaccine because those batches.
So what you're saying is that one reason for potential vaccine injuries is the speed in which it was deployed.
The speed in which it was deployed, the lack of quality assurance, and that's a big deal. So, it like vaccine injuries, it's not just the one thing. It's not like, the vaccine itself is causing it. It's more like bad manufacturing can cause it, expiration can cause it, bad storage can cause it. As we saw early on, a lot of vaccines had to be disposed of because they were not properly stored. And because there's so many of these batches, so we're talking 4.5 billion batches of vaccines that are being distributed
at such a short period of time as well, and the amount of pressure.
I'll
let Lisa.
A lot of money to be made, and they don't want to cancel $1 billion worth of it, right? It would be such a huge loss for them.
Go ahead, Lisa. I'll let you counter that, Lisa, before we go to Tara and Brian. Go ahead.
So if things are expired or things have gone bad, there are mechanisms by which you do not administer them. And I know this from doing relief work in Haiti after the earthquake, where we were looking at whether or not we could deploy tetanus vaccines. So there are mechanisms by which companies try to make sure that doesn't happen. So that's the first thing. The second thing is, I want everybody to just pause for a second. I know that there are a lot of concerns about big companies, but if you have, once again, we're all going to need doctors, we're all going to need medicines, and we're all going to need healthcare going forward. So the question is, how do you guarantee the quality of the doctors, the medicines, and the healthcare? If you have a company that is working with oversight from the government and oversight from agencies like the FDA and things like that, that company is required by law to follow certain procedures to put a medication on the market. If that bankrupts the company, you can't make any medicines. A lot of these smaller organizations are going to be competing for the same numbers, same ingredients, let's just say, to make the vaccine. And if those are scarce ingredients, and then you get variable quality of manufacturing, with the questions that there already are about drugs and the vaccine across the board, how do you guarantee a level of quality, a level of efficacy, a level of safety? How do you guarantee that when you've got a whole bunch of different little startups doing a whole bunch of different little things, especially when people have questions about the vaccine? I don't know what the right answer is to that question, but what I'm telling you is that the system that we have in place has guaranteed, very high quality medications, very important medications since the FDA was started. And so, yes, I understand that companies make money, and yes, I understand that people have mistrust in companies, and but what is the alternative? I understand that there's an interest in helping people
to stop the vaccine. That's the alternative. At what point, Liza, at what point do they stop the vaccine like they've done with other vaccines when they know that they're harming people? At what point, what's the protocol for stopping it?
The protocol for stopping it is to have the studies which are currently being done to demonstrate that there is more than an association, that there is actual harm, right? So if that harm outweighs the harm of COVID, I'll just take, for example, smallpox right now, right? So up until the 1980s, people routinely got the smallpox vaccination. Smallpox was eradicated worldwide. And then people decided, well, you know what, that there are risks associated with the smallpox vaccine. For example, people with eczema wind up getting a bad reaction to it that can be life-threatening. So
do they have a heart attack or die?
Oh, yes, they could. Yes, they could. So, the risk of the smallpox vaccine, by the time it was taken off the market, outweighed the benefits of being vaccinated. And and that was far, but while smallpox was prevalent, it was the risk of smallpox far outweighed the risk of the vaccine. So these are the things that we need to take into consideration. And I understand that people are angry, and I understand that people have this perception of pharma.
But Liza, they're lying about the numbers. So how do you have a clear? Really quick, just a moment. How do you have a any clear-cut data to go off of when they were fudging the numbers of COVID and saying that more people were dying from COVID and making claims that people died in car accidents because they tested positive for COVID, died from COVID? Those are the numbers that we're going off of, right? And so then now people who are believed to be dying from the vaccine, they're being listed as unascertained. They don't know what caused their death, even though it happened within 30 days of getting vaccinated.
So I understand that argument. What I'm saying is that the very closely followed trials are suggesting and there are hundreds of trials out there. The very closely followed trials that have a protocol that you have to be able to try to reproduce are suggesting that COVID is more deadly, once again, in certain groups, okay, in the elderly and people with predisposed illness and things like that, than the vaccine is. And so the trials are ongoing to establish. The companies are looking into it. Right. But
while they're looking into it, people are still being mandated to receive it is the issue. And I think that's the issue that so many people have. And then we find out today that we weren't allowed to even share the truth or even ask questions without being censored because social media is being controlled by big pharma. And let's remember who paid. Okay, I'm going to just mute you so that I can get a comment in. Let's remember of our mainstream media as well. Who is in charge of mainstream media? Who funds mainstream media? Why isn't mainstream media talking about this?
Tara,
do you think Big Pharma would be okay with it?
Just answer one question at a time. I mean, you sort of bombarded her with like 10 different questions. Yeah, it's very difficult.
These aren't questions. These are rhetorical questions, Ian. They're not legitimate really questions. I'm making.
You just want to hear yourself speak.
No.
And you know what? Here's the thing. I agree with you, but
this is my first time getting an opportunity to speak, Ian. You've dominated the stage.
The questions
Are you serious?
And use Liza as a foil for your platform. I don't think that's fair to her.
It's not. I'm not using anyone. I'm reiterating that we weren't even allowed to have.
And we know this, but I don't think it's fair to use her to pretend to ask her a question when you're not interested in her answer. I don't think that is in good faith. You get what I'm saying?
I can't hear Tara. I don't know if she's
Tara. Yeah, we can't hear you. Can you hear? Yeah, I thought it was my end. Tara, can you hear us?
Yeah, I can hear you.
Tara's mic. You're good. You're back now. Go ahead.
I can't hear me if Ian's speaking at the same time as me, and that goes for the entire call, which he does a lot. So when other people are speaking and then Ian starts speaking, you can't hear Ian.
Hey, Tara, you're glitching. It's not Ian speaking. He's muted.
Yeah, don't blame
you're
me
glitching
for
from your end.
Your hardware issues.
Oh, good. So yeah, Tara is glitching on your end. So Lisa, while Tara's connection, I'll just DM her now. I'll let Lisa respond. Aaron, I know you want to jump in. Yeah, I know you want to jump in, man. Lisa, I'll let you respond, and then we'll go to
So my question. So just the one thing I want everybody to take into consideration is, once again, we're all in this together. People from pharma have families and loved ones too. They are just as affected by this outbreak as everybody else in the world. I know scientists in pharma who want to make the reason why they go into pharma is to make a difference in the world. They want their products to help people. So that's one. The second thing is that if you ban the vaccine right this minute, based on anecdotal evidence as opposed to clear trials, what you then do is you put the people who are at risk of dying from COVID, high risk patients, immunosuppressed patients at risk of dying from COVID. So the question is, we got to come up with a reasonably vetted, balanced way of approaching what will benefit the most people. And I am very wedded to I took an oath as a physician, first do no harm. But there is much more complexity to this than just that big pharma wants to make money.
What leads it, based on that logic, how do you feel about the vaccines being approved for children based on a risk-benefit analysis?
Is Bernard glitching or is it my end? Sorry, hold on, Bernard. Is it my end or is Bernard glitching?
He's good.
He's good. I can hear him.
Yeah, he sounds fine.
I have an issue.
Yeah, so based on that logic, I think we got to be consistent here because it sounds like the burden of proof has shifted to instead of do no harm. We're giving these vaccines without any proven benefit in terms of risk benefit analysis, given the low case fatality rate and the low harm, the low relative
and like I said,
population without clear benefit based on their own data. And I think everybody just hopping on this train saying we should vaccinate across the board and not actually following the science.
Right. So here's my comment about that is early on when the vaccines first got approved, there were children in the trial. They've done, as far as I understand, you might have to double check me, that there's been a trial on kids of about 4,000 kids. Double check me on that. But and it didn't seem to cause harm. Now, the reason why it was important for children to get vaccinated was because they were a reservoir for transmission. People recognize the way.
That's not the case now.
That's not the case now. That's not. I agree.
Let's focus on now.
Let's
focus on now.
Let her finish. Let her finish.
I promise you, I will get to now. I promise you, I will get to now. Based on that fact, I vaccinated my children because I didn't want them to be reservoirs for transmission. At this point now, I think that the data, we've got a much more nuanced understanding of this vaccine and of the disease. And so I think that mandates should not be implemented. I think that there should be a sort of tiered level of administering the vaccine to groups that are at highest risk. But that's not what we understood when this first came out. So we're all in this together. We're all learning about this together. And I promise you, we're people too, right? The people in industry don't want to see people die. That's a bad business model. So I'd ask you to maybe consider that this is a little bit more nuanced than just, we want to suppress information, because I certainly am absolutely opposed to censorship.
But that's what they were doing, and it's been proven.
I agree with what they said.
But that they were censoring information, and that's been proven, and it's been proven again and again. And they're still doing it by not sharing. They're not sharing this information on mainstream media, and they won't because they're controlled by big pharma. And that's why it goes full circle. So how many lives are being risked by them not speaking the truth and sharing the truth with people?
To be fair, there is no evidence that Twitter actually acted on any of these requests by the lobbyist groups that were representing Big Pharma.
You're joking, right, Brian?
No, there is no evidence that Twitter acted on any of the requests from today's Twitter
files. Ask the doctors who were banned from Twitter. Ask Molly, Dr. Molly, she's here.
There's no evidence that anybody acted on the Twitter files from today.
No, there's the bricklayer that was suspended. Brian?
So Twitter.
He wasn't suspended. He was monitored. Just
monitored.
Yeah. So what I'm. Well, what I'm saying, yes, they monitored people, but they did not. There is no evidence that they banned or removed posts. I'm not saying that didn't happen, and I would love to see more details on this because I do think it could be a problem. Now, somebody said that, like, doesn't pharma make enough money? Now, like, most of these companies are corporations, and of course, if you know anything about the corporate world, they're run by boards of directors, and their chief goal is to maximize profits. Period. There's nothing else there. Now, maximizing profits could include trying to save lives as well, because bad publicity, of course, is not good for profits. Now, I think that what the pharma companies have done here in these Twitter files from today, I think that we need more information to know what actually was banned. But at the same time, the reason I asked Lee Fang the question I did about whether other organizations, other lobbyists have contacted Twitter about other things is because I know they almost certainly have. And as a lobbyist, that's their job, is to protect the rights of the company.
I'd say, yeah. Oh, sorry. Go ahead. Yeah, protecting the rights of the company. That's what I was gonna dispute. So you're talking about the lobbyists asking for censorship for financial purposes rather than, like, if you have a lobbyist that's requesting some level of censorship for the social good or what they perceive as a social good, at least that's something that we could debate. But if it's for financial incentive and then the social media platform acts on it when there's no social good involved, for example, censoring other companies from censoring anyone that wants the patent to become available for the public, that's a whole different. Sorry to interrupt you, Mel. I'll let you continue, but that's a whole different ballgame, no?
No, and I agree. I think that I think that most lobbyists are hired to maximize the profits of a corporation. That's almost certainly always the case. Now, does that mean protecting the company's patents? Most of these pharma companies do have patents on the mRNA vaccines. Now, if there were to be generic drugs using those patents, that would be a problem that would affect the company's bottom line, the top line as well. And a realist would say, hey, I mean, there's reasons patents are in existence is to protect the rights of the companies that spend the money to find these vaccines. And albeit government helped subsidize many of these vaccines, so the argument isn't quite as clear.
They more than helped.
Right. But I mean, legally, the right of these corporations, these pharma companies, is to protect their patents. And you can say it's immoral, which I do agree
Brian,
with in some respects.
Nobody is questioning the patent rights of these companies.
I'm just saying.
But it's censoring. Sorry, before you go to Aaron, just want to. I see. Before I'll give you Aaron. Hold on, Aaron, hold on, bro. Hold on. I'll give you the mic next. First, am I echoing Aaron, or is it good on my end?
No, it's fine on your end.
Okay. I'll fix it.
Yeah,
okay. I'm glad. So just wanted
to.
Okay, here you go. It's better now. Just wanted, because I see Dr. Drew and Eric Weinstein in the audience. Tell you guys, and everyone else that joined in the last few minutes, half an hour. The main concern on this one, and it's like I'm struggling to play devil's advocate, is that we had the body, the organization that's funded by Pfizer and Moderna, for bio, through the public good projects. They requested censorship for various things, such as vaccine passports, anyone that talks about vaccine side effects, lockdowns, the stuff we know, and the stuff we all disagree with, but at least we could debate. Because you can say, hey, this is for the public good or the perceived public good, or is it, etc. But then they requested censorship, what Brian is talking about. They requested censorship of anyone that was requesting or lobbying for the patent to be made available publicly for other companies to replicate it, for the cost to go down.
I disagree with that. I just want to say I totally disagree.
Yeah, so this is but you're trying to go through the process, like you're doing what I'm trying to do, is playing devil's advocate. So this is a really tough one. So this is why on this case, and we had Lee Fang here, and we agreed that this, in my opinion, is probably the worst Twitter files job if there's confirmation that they acted on that specific request, the one that involved the patent.
There is confirmation that they acted to comply and give people verification check marks and to suppress numerous accounts on a weekly basis. There is no question about it. The issue is not, how much they censor. The issue is that they censored people at all, that they had this ability to basically direct the content moderation systems on Twitter and on other social media companies, on big tech. And this is the tip of the iceberg, right? Because they had broad-reaching influence throughout the entire media. So I agree with Tara on this issue in that this is not just a social media problem. This is a wide-reaching problem that crosses every single spectrum. And it's like, why are there vaccine mandates? Why are there lockdowns? The purpose of that is to serve a single bottom line, which is to line the company's pockets. So why the vaccine mandates? Well, it means that they get to sell more vaccines. Why are there lockdowns? Why are there vaccine passports?
Yeah. So how much? This is a question, like how much of it?
Why are the accounts, really quick, Mario, the account that was set up to stop vaccine passports, why was it suspended? Why were these accounts that were speaking out and saying, don't do this, don't allow people to be forced to get a vaccine to be able to travel? Why are these accounts suspended and banned from Twitter still to this day?
Yeah, exactly. And this is where the discussion comes in before we go to Aaron. And by the way, I'll add a point here, Aaron, then I'll ask you a question that was targeted for Dr. Dunn, but I'll have you and Dr. Dunn answer it and let you say your piece as well. But this is where the discussion should be, is how much, this is where it gets murky. Are they requesting this for the perceived public good? Again, keyword here is perceived, or for financial benefits, or a bit of both? Obviously, it's going to be, in my opinion, it'll be both. Lisa will argue more for the public good.
The thing. Is there anything in the public benefit? Is there anything in the public benefit to even have logged
perceived public benefit. Yeah. It's a keyword here. Yeah. So the question, and I'll let you, Aaron and Dr. Molly, I'll let you go next. I just want to ask a question that was asked.
Dr. Molly's been waiting quite some time, so I think for her and then Aaron.
Yeah, sure. Aaron, is that okay if we go Dr. Molly first and then you next?
Hey, thanks, because I have to go see patients in about 2 minutes.
Yeah, sure.
So, no problem.
Dr. Molly, okay, go. I've got a question here, but if you've only got 2 minutes, I'll ask the question after you're done.
So as nefarious as it is that these private companies were censoring on Twitter, I want to know what their reach was with the medical boards and the medical colleges, because physicians who are speaking out to give true informed consent to our patients and provide early treatment to our patients were investigated by medical boards, and we endured the cost to defend ourselves when we were speaking based on our clinical expertise, our observed clinical experiences right in front of our faces. And so I think that not only did Pfizer and their groups influence social media, but the question is, how did they influence the medical boards and everybody else? Because they were threatening our specialty certifications and our livelihoods. Different doctors were sent threatening letters. So this is much more widespread than even just Twitter. And I want to speak to a couple of things that Liza said, because number one, the studies done in children checked antibody levels. It was not outcome-driven studies. And they followed them for 60 days. That is not how you check safety in children, number one. And number two, if you follow Jessica Rose and Peter McCullough's work, the criteria to pull these from the market was met in February of 2021 with over 1,200 deaths tied to these shots. So we need to get a little bit correct in our data in this space.
That's actually not correct in terms of the antibody level. There were outcome studies done. Now, granted, the outcomes were crap and were misrepresented by the media, but to say that they were not outcome-driven studies is just actually incorrect.
Can you send me those?
What do you mean? Oh, okay. Easy.
Aaron, go ahead, man.
Yeah, so first of all, there were a lot of very decent, well-meaning, good-hearted people in the German army in the 1930s and the 1940s. Nobody doubts that. But they still had to be defeated. Nobody doubts that most of the employees of Pfizer and Moderna are good-hearted people that want to help humanity. But the companies themselves can be behaving very nefariously. We know
is that systematic, Aaron? Systematic or based on certain people there?
Well, we know that Pfizer has a long quite frankly, criminal history. The company that has paid the largest criminal fine ever in the history of the world is Pfizer. And that wasn't a one-time offense. They've had to do that many times for behaving badly in relation to their products. In every country in the world, other than New Zealand and the United States, direct-to-consumer advertising of pharmaceutical products is illegal. When people come to this country and they see, ask your doctor about, fill in the blank, Viagra commercials on TV, they think it's totally insane, which it is. This was illegal, by the way, prior to 1997, when federal law loosened restrictions on that. So the massive expenditures on advertising are already, I think, ethically problematic. But what we saw in the Twitter files drop today was not just sort of bad advertising practices. And by the way, when you look at the vaccine commercials, you don't see all the, speak at 100 miles an hour to list various side effects at the end of the commercial, because they're not required to do that. With the EUA, with these being considered by the Department of Defense COVID countermeasures in legal terms, and in fact prototypes in legal terms rather than vaccines, these vaccines were not subjected to good manufacturing practices. I posted in the thread an article from a colleague at the Brownstone Institute that describes the legal issues behind this and why you don't hear the fine print on the vaccine commercials, and why we've seen this lot-to-lot variability in quality control. The answer to why that is that the GMPs that typically apply to pharmaceuticals are not applied to these vaccines. So it's not surprising that we're seeing quality control problems. But the Twitter files drop today went way beyond just bad advertising practices, because it's not just about sort of being dishonest about your product on TV or on social media. It's about spending $1.3 billion to try to suppress anyone who asks questions about your product, which is really quite insane. And yeah, there may be many other small lobbyists with many other interests that are making phone calls to Twitter and trying to, get them to nudge their terms of service. But I don't know of any of them that would be able to spend $1.3 billion on that effort. And having been on the receiving end, not just of censorship, and by the way, the censorship was not about me questioning safety and efficacy of the vaccines. It was about me, who at the time was the director of medical ethics at the University of California, Irvine, and chair of the ethics committee at the California Department of State Hospitals, questioning the ethics and the legal issues around vaccine mandates and vaccine passports. So it was about these public policy arguments, and a private company trying to control not only information about its product, which is bad enough, but trying to control public policy arguments related to its product is really quite astonishing, and I think should be horrifying to the American people. And of course, it doesn't mean that every employee of Pfizer was part of this. It certainly doesn't mean that every researcher who's doing work on behalf of the company has profit-driven motives for the work that they're doing. No, of course not. But it certainly does mean that the regulatory agencies and the federal law is set up to protect the American people from the profit motive running rampant. There's some very, very serious systemic problems there. And the relationship between these companies and the social media companies, I think this drop clearly reveals that there's problems there as well. And the fact is, they were successful at achieving the ends that they were aiming for. The Twitter censorship, whether it was as a direct result of the company's action or not, the Twitter censorship in 2021 followed to a T what the company was asking for. And there were a lot of casualties of that.
Yeah. So one thing to throw in here, I'm going to agree with you mostly, Aaron, but I want to make a couple addendums to this. First of all, having just worked within the milieu of making federal policy and watching how all that takes place, as a fundamental principle, I don't think we want to be against in any sense, the profit motive of any company. What we do need to aggressively pursue is the removal of.
I want to be against that. I mean,
okay, well, hold on. Well, just let me say.
I'll
Bernard.
let you.
Bernard.
Yeah. So
Bernard,
Jim and Bernard. Yeah. Hold on, Jim.
Let Jim finish.
Yeah. And just before you continue, Jim, I'm actually, this for me is an interesting discussion. Like trying to figure out the crux of the problem here. If it is systematic, what solutions are they? If it is specific people, which is usually the funner path that people like to take, then would be good to kind of explore that as well. But like for the audience, before Jim continues and responds to Aaron, then we'll go to Bernard. For the audience, like, what do you think the solution is? Like, tell us in the comments. I'm actually going to go through the comments. What do you think the problem is, and what is the solution in your opinion? And let's see if we can land on some sort of. Yeah, it's a good discussion. I think this is a good time to have it because we kind of censorship. And sorry, Jim, I'll give you the mic right after. But like the censorship that did escalate to a whole new level now. Like we saw, I did mention it to Li Feng earlier. It started off with censorship for a perceived public good. That was number one. Number two, censorship for political agendas or based on political biases. Or political biases kind of exist throughout it, but I'll put it in number two. And now censorship with profit motives. So these are the three big categories we have. We're focusing on the third one now. So for the audience, like participate a bit, give us ideas. Why do you think that happened? What is the systematic issue, which is it's more likely to be a systematic issue, and how can we solve it? Go ahead, Jim.
Yeah, I mean, and before I finish my thought, just a quick statement. It's interesting when you bring up profit in the West in particular, but I think somewhat worldwide, there's immediately the hairs in the back of the neck start to come up like profit. Oh my gosh. So the profit motive in and of itself is not evil. What is evil is the means sometimes by which people seek to get profit. So as it comes to pharmaceutical companies, one of the worst things that happens in Washington, D.C., and it happens in governments around the world as well, too, with the EU and others also, is the special arrangements that companies make with government to give them special advantages. Big Pharma in the United States has been exceedingly effective at gaining special advantage in the United States regulatory policy and other things. For example, the FDA gives preferences in many ways to large pharmaceutical companies so that they can move their stuff through with some under-the-table type things available to people on the board there. I mean,
and they also ban generic drugs, right? That's the reason why you can't import drugs that are cheap from India or Canada. I mean, Canada allows a lot of generic drugs. It's very cheap in Canada. So very basic things like stuff that's over-the-counter drugs, for instance. You can in America, they're only under specific brands that have been licensed to produce them, right? They're the only ones who can sell it. You can't buy the 10th set variety of it, which is the exact same drug from Canada or from India.
Yeah, and so Aaron referred in this case to the inconsistent batching protocols with the manufacturing of this vaccine, which one would admit also, by the way, which is no different than the nutraceutical side of things that the FDA is so often against. And in some cases, there's bad information when it comes to all the nutraceuticals and vitamins that you buy off the shelf, of course. But the funny thing is that preference is given to Big Pharma in regards to those things. These are the people that batch right. These are the people that, and it's all crazy. So the system's been built up to give them advantages. Now, I bring that up because what's interesting in this particular Twitter file drop, as I saw Dr. Drew come in, is that there is what we're seeing in this drop is how empowered Big Pharma feels to go directly to companies like Twitter, and I guarantee you they were doing it with other ones also, to go in and leverage their power, both the advertising that they sell and other reasons, by the way, with the imprimatur of the government, because you just remember there's no direct government connection to this Twitter file drop, but it is within reference to a larger discussion that was taking place in this country about moving the vaccine forward, getting people, and all this kind of stuff, and with government actors talking about how important it was to, and how much and in this particular case, how much the Biden administration was taking claim for all they were doing. In that milieu, you've got a huge pharmaceutical company coming to Twitter.
So Jim, just to keep it focused. So the point you're making before we go to Bernard, and I want to kind of go back and forth with Tara on this as well. Hey, Dr. Drew, you're here. How are you, man? Can you hear me, Dr. Drew? Or is I think you're.
I hear you. Thank you. I wanted to get at the solution, which might take things in a little bit different direction. So put me in line somewhere 2 or 3 back.
Yeah, sure. I'll what I'll do is I'll let Bernard respond to Jim. I wanted to go back and forth with Tara, but I'll actually give you the mic right after Bernard.
Okay.
To kind of lead the conversation. It's good to have you back.
Good.
But Bernard, I'll let you respond to what Jim said, and I think you wanted to respond to what Aaron was saying as well, just mainly regarding the what you think the crux of the issue is that led to corporations having potentially the ability to censor, or we've seen it actually, having the ability to censor on social media platforms. And then Dr. Drew, I'd love your thoughts on this as well.
Thanks, Mario. So I share Jim and everyone else's concern that empowering the pharmaceutical industry to have that much power over our social media, our mainstream media, government policy is highly problematic. But his conclusion that a profit motive is not the issue could not be further from the truth. I mean, at the end of the day, that is the ultimate goal. And even more than that, I mean, it's an oversimplification just to say profit. I mean, these companies want market share. They want power to do other things long term rather than just a profit. So some companies will lose money just to gain a higher market share. So it's a lot more complex. But ultimately, they want to empower their company to be able to do whatever they want to do long term. But obviously, they want to make money both in the short term, long term. But beyond that, I think it's important to recognize that the healthcare system in the U.S. is a for-profit entity, and there's 3 primary stakeholders with all the power. It is the insurance companies, it is pharma, it is the hospitals, and they dominate our policy. They dominate the care in our country, and they're a big reason why we spend so much on healthcare, yet we're not getting the outcomes that you would expect for that type of expenditure from our government. And so in terms of my solutions, we got to de-link the profit incentive. And one more point, I think a lot of people forgot when the AstraZeneca vaccine was first invented. I think it came out of a university in the UK, and they were going to open source that patent, allow other countries to make the vaccine on their own. But Bill Gates and the Bill Gates Foundation came out against it and influenced them to sell that patent to AstraZeneca to make a profit. So we have to understand that you cannot tie people's lives to profit motives. I think.
Okay, so let me just. I don't want to go into too much of an economics lesson here, but listen, the profit is not the problem there, and you laid out my case there, because the problem is the government carve-outs that lead to profit. So if the playing field is fair for everybody, including if we hold companies liable for bad manufacturing practices that harm people, that is a huge problem. And that's not a profit problem. That is a profit government problem. It's the government carve-outs that cause these problems.
I think
so, Dr. Drew, before you go, Dr. Drew, just adding to the discussion and the various solutions that we're kind of going back and forth on, and Bernard's point about delinking the profit incentive. I don't know. Would that be enough? And is it going to ever happen? Is there any chance for that to happen?
I'm not sure there's much chance of that happening, but it's an interesting idea. But let me just share with you my thoughts on solution. And as usual, when we're trying to learn about the present, it's usually in our best interest to look back at history. And I've mentioned this before in these forums, that the opioid crisis was line and verse identical to what's going on with these vaccines. Identical. It's uncanny. What we found from that history, and by the way, I was censored, investigated, completely vilified for standing up against the excessive prescribing of opiates back during those days, while my patients died around me by the hundreds. So the same thing was happening. What I found in that particular episode was that it was not the pharmaceutical companies per se, although people still think simplistically that that's what it was. The pharmaceutical industry blows wind into the sails of what our profession is doing. It always requires a discipline that takes it on as though they're wearing a white hat to save humanity. You'll find evangelists. That's what it was back in the opioid crisis. There were pain management evangelists who took control of the state medical societies, the JCO, the VA, pain is the fifth vital sign, and the drug companies stepped in and helped them all out, and people were silenced who raised their hand. A lot of people are not aware that what turned the whole thing around, because I was there when this gentleman said this, is that Jeff Sessions in the federal government, I heard him, he said to me, or to this group I was with, that he sees what's happening and he knows how to turn this kind of thing around. And we didn't know what he was talking about. He went in and he put 3 or 4 of the main unrepentant evangelists who were physicians, who were killing patients, but took absolutely no responsibility for it and saw it as still their white hat sort of obligation to give as many pain medicines to those heroin addicts as possible. He put them in prison, and things stopped immediately. Our professions froze, as we tend to do. Whenever anything is scary to us, we froze. We took a look at what we were doing, and we immediately changed directions. So it seems to me, if history is going to be a lesson, there has to be some sort of aggressive, significant legal action that affects our profession directly, particularly the evangelists, for vaccine uber alles, until we're able to take a look at this and change direction. That's my 2 cents.
So I'm just taking notes as you compared this to the opioid crisis. And the last thing you said about, taking a break, are you implying like pausing the vaccine until we understand the effects? So that's not what you meant. I misunderstood the last thing you meant.
I'm saying until somebody, I know there's lots of legal cases sort of brewing out there, but until there is a significant intervention that catches the attention of our profession to just at least forget whether we're halting the vaccine or not, that really isn't in my thinking. It has to halt us in our tracks professionally and make us think through what we're doing, and maybe things aren't as they seem. It was stunning to me. The opioid crisis, when it broke out, was because of some legal cases that held doctors criminally accountable for insufficient treatment of pain. So doctors froze in place, the evangelists stepped in, and off they went. What's crazy to me was that when it stopped, it was the inverse of exactly the same thing. The evangelists were criminally prosecuted, physicians froze, we looked at the insanity and we changed direction. We tend to do the right thing, but when we're being censored and marginalized and investigated, as Molly said, by our professional organizations, we shut up. But when we can step up and go, yeah, this is crazy, let's take a good look at this, we tend to do so, and we tend to right the ship. But when all the forces are lined up, Twitter, lobbyists, all these things you're talking about today, we are easily frightened, and we go underground.
Dr. Drew.
So what will be the first step?
I have a question for
Go ahead.
Yeah.
Go ahead, man.
Okay. So big fan, by the way. Pleasure to have you here. Yeah. My question to you is, in your estimation, where do you see like the weakest, the weakest link? What is the weakest link in this chain? You got Twitter, the media, social media, the pharmaceutical companies. They're all one big chain, and the governments. Where do you think is the best angle of attack that I think the public, members of the public, or maybe state legislatures or wherever, right? Like whoever has the ability and the means to take these hold these people accountable. Where do you think is the best angle of attack? I want to know.
See, I think everything we've been talking about is all downstream. And I wish I could tell you exactly where, I keep calling them evangelists, where the people are who are leading the charge, so to speak, and the ones that are sending the orders out to the people to censor and whatever else is going on. I don't know how Jeff Sessions decided who to go after, and I didn't know who those people were when he was talking about it, just like I don't know who they are now. So I'm guessing that I know how lawyers work, that they're looking at people. That's sort of my guess. And I think this gets worked out in the courts. I think that's where we should.
But you're pointing out to finding the right people and setting an example. But would that be sufficient? Because then if the systematic issues are still there, that will be replaced by new people.
Well, again, the pharma only blows wind into our sails as a profession. They will not practice medicine. And if the physicians all of a sudden turn to pharma and go, look what you're doing, because they know what's going to happen next. They're going to be like the opioid drug companies, we're going to come after them next, and they know it. So they're not going to keep pushing. They will not, in my opinion, they do not practice medicine. They only accelerate whatever it is our profession is doing. The accelerant is unethical, and we can go all, at what you guys are already talking about. But they don't establish things. We establish things. It's our profession that do it. And whether it's at the CDC or whether it's the Surgeon General, I don't know where it is, but it's there. I guarantee you there is a group of people, and probably my guess is there's a few state officials and there's a few federal officials that are the ones that are unrepentantly evangelical. And as such, you will find they're thinking way over their skis. They will be doing and saying and thinking things that is excessive, and that will be kind of obvious at some point.
Look, since I have you on stage, Dr. Drew, I want to be selfish and ask another question I asked in the last COVID space we did 2-3 days ago. And I asked it to a few doctors. Dr. Lisa was there. I think Dr. Dunn was there and a few others. And the question was, for anyone that has the vaccine and has the boosters, I know we have limited studies, but question number one, should they be concerned? For how long should they be concerned? The first 30 days, the first 60 days, etc. And is there more levels of concern depending on the amount of boosters you've taken? What's your stance on this? And I know the studies are limited, so based on the studies we have so far.
Right. So let me just point out and I think Dr. Molly was sort of tilting towards this when she said we're just aiming for giving our patients good informed consent. The thing I am disturbed about is that we can't stand up and ask these questions with clarity and demand that somebody do the necessary research to clarify what's going on. There are not good randomized controlled study to answer these questions. There's lots of studies, I'm using quotes, on both sides, and it's very confusing. There are signals. The signals are concerning. And if you raise your hand and say, first of all, when you say there's a signal, people immediately say, no, there's not. So already we're in weird space right there. So, okay, is there a signal? Which there is. And B, what should we tell our patients? What is the level of it? What is the risk reward? And I've seen not one study to help us establish the risk reward. How long you should be concerned? We don't know, of course. I mean, look, 60 to 90 days generally is kind of, for adults. I heard somebody, Molly, I think, say that from a pediatric standpoint, that's not enough, but I'm not a pediatrician, so I take her word for that. But 60 to 90 days after that, probably okay, but we don't know for sure. Should we be doing something to mitigate our risk? Should we be taking aspirin, or is aspirin to make things? What should we be doing for our patients? And then we heard this recent sort of signal about strokes in elderly patients, which clinically I've not seen, and yet I'm seeing lots of other things clinically that they're claiming is not a signal. So it's very confusing landscape. And just the fact that we can't get these questions answered is the outrage. Not really what's going on, but what is actually going on, and what do we tell our patients is the problem.
Dr. Drew, I got a question for you. Yeah. So to what extent in your mind does the fact that well over 50% of our medical delivery system in this country has some government connection to it, how does that play out? Because I got to tell you, I just recently went through getting 3 stents put into my heart, and I got into the depths of the hospital system again for the first time in a long, long time. And I'm telling you, it's radically different than it was 20 years ago. I mean, walking into a hospital, and I went into a good one, St. Vincent's Heart Center in the north side of Indianapolis. But these things are really changing, it seems to me. I say it from a public policy perspective, having worked on Capitol Hill, but just as an American, getting into the system, it feels like we've got a lot of skewed access, or the whole thing is skewed so that doesn't feel the same. It doesn't work the same anymore. Is that the dynamic here that we need to be concerned with?
I can't disagree with what you're saying. I mean, there's all kinds of distorted. Look, the fact that Medicare sets policies and then insurances follow suit, and then the insurance companies tend to practice medicine, then claim they don't. Yeah, that's the problem. I mean, that was what I fought against for years and years and years, and that's still going on everywhere. We are completely beholden to this system in the middle that is exclusive. I think that's the greater sort of concern about how our medical system operates, more than the profit motive of pharmaceutical companies. It's really the profit motive of insurance companies, who, by the way, take a significant percentage of your healthcare dollars and do nothing but put it in a bond fund. There is ridiculous, and the administrative looks at the data on the administrative burden on medicine right now. It's gone up exponentially for a decade. And the fundamental unit, the well-informed patient and the highly trained caring physician, that is your unit. That is your most effective unit. That has been completely adulterated and destroyed. And that's why you felt like you were just in a system, because the doctors and the nurses just have to follow what they're told rather than what they think is best for the patient. Let me give you an example of how this plays out. This happened to me when I was running a large drug and alcohol and recovery center. This in a psychiatry, it gets worse than anywhere. And so and particularly in addiction, you see it first, which was, doctor, the patient calls the insurance company says, Dr. Pinsky nearly needs to tell us exactly what he wants to do. And of course, we'll listen to him and we'll fund that. Well, but they don't tell you that exactly what he wants to do has to meet their specified criteria, not what I think is in the best interest of the patient, but has to meet their criteria, which are never met, ever. So
the
insurance
company's criteria.
Insurance company sets the criteria. I know immediately the patient's going to be discharged, or at least their funds are going to be withheld. So I explain it to the patient. The patient says, why would they do that? And I'm saying, look, it's going to cost you $800 a day if you stay here. I have to find some way of getting you care on the outside that they will cover. And of course, the patient needs weeks and weeks of treatment that they never get. They, of course, relapse. They relapse a few times. I literally had one insurance administrator tell me, well, when they do it multiple times, they lose their job, and then they're really not our concern anymore. I mean, think about that. Those words came out of somebody's mouth. In any event, I complain to the insurance company. Insurance company does not, on appeal, change their position. The patient is, of course, burdened with whatever financial obligations are incurred. Or let's say they go home and kill themselves. Then the insurance company says, what? Oh, we don't practice medicine. There's Dr. Pinsky's signature right there on the discharge. He discharged the patient. Can you imagine that? So there you go. So then I make a claim to the California Insurance Commissioner. Then the insurance company comes back and says, Dr. Pinsky, we understand you're not, you have concerns about our business practices. I'll tell you what, we're going to decertify you. You're no longer allowed to be participating in our insurance coverage, and will in fact decertify the entire hospital. That's the game they play. They are in complete control.
Well, and by the way, maybe you don't want to address this, but I think it's an important thing to point out, because the insurance problem has been a problem. I mean, remember back in the 90s, we complained about third-party administrators, and you get into nowadays where we're literally and I'm not asking you to diss on Obamacare for my purposes as a conservative, but we're in the Obamacare age where everything's thrown up on the exchange, which brings in a new set of requirements layered over other sets of requirements that Medicare provides or Medicaid provides. And I think it's kind of made that whole insurance component even more crazy, that adds more to the layers of paperwork, it seems.
Way more to the, and as soon as you get into the state systems, the Medicaid, Medi-Cal systems, it gets super crazy. People have to understand these organizations survive by restricting access to care, not by providing care, but restricting access to care independent of what practitioners believe or think they need. You can't get what the patient needs, or you can keep them in the hospital, keep treating them, but you do it for free. And a lot of hospitals, a lot of practitioners already are doing a significant percentage of their care for free, a significant percentage. And then the physicians can't do anything about that, but the hospital then puts it over on your stent hospitalization. So that gets added to your cardiac procedure as a way to survive.
Last question on mine that I'm curious about. Do you see, as I've worked with folks who are desperate to want to reform a lot of this, and I try to inform members of Congress that I know or various people when I'm having these discussions, and I've done some serious work on this, but one of the things that seems to be part of the real problem here is transparency, not just in pricing, but in the delivery system. And I think you sort of alluded to that in your previous answer. But talk about the transparency issue a little bit.
Well,
do you not think that would help?
It would, but I can barely figure it out, and I've worked in it for 40 years. And so I always feel like one of my jobs is A, representing the patient in a maze of a system, but B, trying to help them understand what's going on. So all those insurance stories I've told to my patients, and their eyes glaze over. They take away 20% of what I said, and they're just angry. That's how they walk away. So transparency, I'm not sure is the answer. I think humbly that we always have to have some sort of care system that is highly restrictive. If we're going to give care to everybody, it's just the nature of the economics of healthcare that people are not always going to get everything they want. But you could argue that there should be a second system for people that want to pay for it that can get people what they want, whatever that might be, and however you structure it, whether it's as a savings plan or as some autonomous pools of risk capital or something. But it's less built on restriction than the opportunity to give care to everybody.
I think Leah Houston, who's I think listening, has actual solutions to that problem. It has some really good ideas about how to approach this. She's a physician as well, and she's listening.
Yeah,
love to hear
Lisa,
her.
send me through her username, Lisa. I'll bring her up.
Okay.
We've gotten way afield of vaccines, though. Here we've gotten way into solving all
the
misery.
Well, but
how
does that tie in? I'm curious because
there's a very serious thing in here that's embedded in this, which is who's going to want to become a physician. I mean, when I hear young people going into medicine, I just was now struggling with this opportunity to talk to some of the medical students at USC, and I was thinking, Jesus, I'm not sure I want to get into it, but everyone I hear going into medicine wants to become a plastic surgeon or something that is outside of the system and just a cash, system. The people that are really needed to actually be doctors and actually be in the system and actually really be passionate about the care of the patient, you've got to have a screw loose to want to do that the way the system is set up now.
And that's why I left.
Who is that?
Really
Who said that?
I was going to say,
Lisa, God bless you. God bless you. And it's why I found other ways to make a living myself, so I could go on practicing the way I wanted to and not have to worry about it or shut myself down. And it's a losing proposition. Every month I lose money practicing medicine. It's the way it is.
Yeah, that's the thing.
Internal
practitioners are just not even able to operate in this environment.
That's why I went into medicine, was to be the doctor, to be a doctor for you and your grandma, and to really do that job that I feel is so sacred. But I'll shut up.
No, thank you for coming on, Dr. Drube. It's good to talk to you again. I'm Joanna. I'm one of the panel members practicing currently here in New York City. And I think it's important to identify, and it may be self-evident, we go into medicine to help people. But what's really valuable about this particular drop, I think, is just the relationship that exists that's been kind of identified between government, private business, and the media. And I guess my question to you, just as a fellow physician, kind of balancing the risk of retaliation and punishment from even governing medical associations, and practicing critical medicine, where we're really examining all of the data and approaching with caution and being able to vocalize that. I think people need to understand we don't have a union. We don't necessarily have, those protections in place if we disagree. And I'm curious what you think as far as how we can be effective as a group entity?
I don't know the answer to that. All the organizations that are supposed to help protect us seem to be aligned against us. I don't expect any organization from your state medical associations or your professional societies or the American Medical Association. Back during the opioid crisis, they lined up against me significantly. And I expect them to be towing the line of the evangelists today as well. So I don't know the answer to that. I do think that you have to just keep standing up and do what's right. You just got to keep doing it and keep putting one foot in front of the other. And that ultimately, we know what's best. We're the ones trying to make great decisions on behalf of our patients and move forward. But it's demoralizing. It's very, very difficult and painful.
Isn't it even harder now with censorship being so easy, where everyone's influenced, everyone's reach is on social media? So it's all based on the algorithm.
Yeah, speaking of algorithms, I mean, and one of my other concerns about how medicine is practiced, based on the insurance companies and the hospitals or the employers of physicians now, which is a whole nother layer of catastrophe, frankly, is this algorithmic approach to clinical pathways where, I think Joanna or somebody's talked about her clinical judgment, or maybe Molly did, that this is, we're seeing this happening. It's a clinical impression we have. Research is typically has to catch up with the doctors and their clinical impressions. Research typically confirms or refutes what we think we're seeing clinically. Research doesn't lead the way. And so these clinical pathways and this so-called evidence-based medicine has been adulterated. It's been significantly adulterated. And again, it's weird how in psychiatry and addiction medicine, you see things first. That's where I saw it there first, with these mandates for certain evidence-based treatments that really were just one fad after another. And I had to, again, live through many of those since the early 80s. And I'm worried that now is sort of ossified and then held by the hospitals, who are the employers, and the insurance companies. So that's another layer of concern for how medicine is practiced today. But I don't know, Joanna, how we get around it. I don't know. I just keep doing what's right is all we've ever been taught to do and all we know how to do, really. And it's sad because we're too busy taking care of patients.
That's exactly right. That's exactly right. And I think that's a problem that actually predates the 80s. It goes all, in the 50s, once again, we talked about this on a previous space, but lobotomy was the first line treatment for any psychiatric disorder.
When I give my lectures on the opioid crisis, which I do because I lived through it, I talk about the opioid crisis in 1890, which resulted in the Harrison Narcotic Act. And by the way, the imprisonment of 20,000 physicians. People don't know this. There were tens of thousands of physicians imprisoned for excess opioid prescribing in 1910. It's what caused the unwillingness to use opiates until the evangelist stepped in and said, "You have been you've been too afraid of this. We have to help." But anyway, and then I also point at psychosurgeries. Someone won the Nobel Prize for lobotomies.
Egas Moniz in Spain.
And by the way, Rose Kennedy felt that the biggest tragedy of their family was the lobotomy they performed on Rosemary, not the assassination of her two sons. She felt on the record that what happened to Rosemary was worse than what happened to her sons. Be that as it may, when I got to the psychiatric hospital and I was the young internist that took over their medical services, I assumed the care of many, many, many post-psychosurgery patients. The hospital I worked at was like a museum of psychiatry, and these were catastrophes. They developed gliosis and just horrible problems neurologically. So, yes, this is again about the time horizon that was asked a few minutes ago. Yeah, if somebody has addiction and borderline personality and do you singulotomy or a lobotomy, they look better for a couple of months. They are less of a problem to you. And then their life is a complete and total catastrophe. And the research may not reflect that.
Drew, since you're here, again, a question, I'm asking selfish questions. Anish, I'll give you the mic right after. Sorry, Anish. But the question is, so there's a lot of talk, a lot of concerns right now about the died suddenly movement. And is there studies that show an increase? There's a documentary about it. I haven't had a chance to watch it. I probably should. But is there studies to show that there's an increased number of people, I know it's really hard to measure, that have died due to unknown causes? And, which countries, what's the causation correlation? Is it at levels that are concerning or way too early to tell? Like, what's your position on this? Because more and more people are mentioning it to me, even on a personal level. Like, I had a business meeting yesterday with another large company, the CEO of a really large company, and he brought it up. He was listening to my space before coming to my meeting, concerned about that particular topic.
I'm concerned about it too. I wake up every day to news stories on my threads that may be causing confirmation bias. So I have no idea the answer to your question because.
But is there any data? Is there data?
There's data. There's data here and there, but none of it really is asking the question out loud. Are we seeing excess deaths? And there's all-cause mortality is up. There's data. I mean, Aseem Malhotra will say yes. Aseem Malhotra will say categorically it's cardiovascular and all-cause mortality is up. I'm seeing data going both ways, and until that sort of gets sorted out, that is one question that needs to be answered. Back to the idea that clinical impressions precede data or precede research. I've never watched a football game and seen somebody drop of unknown cause, but they've not yet shared with us the cause. By the way, if it were commotio cordis, they would have told us by now. So I'm guessing that it was probably a pulmonary embolus or something specifically associated with vaccine, which is why
that's not true, Dr. Drew. What do you mean they would have told us by now?
Everybody ran to commotio cordis, right? Everybody, the whole ship.
I mean, both can be true, but to say that they would have told us by now, that is just an incorrect statement. That they have.
Why would they withhold it? Why would they withhold it?
Because of patient privacy loss.
Exactly.
What if you were the patient and you had a pulmonary embolus in the football field? You wouldn't want to share with everybody that's a concern and get your. Or let's say it was whatever the cause, commotio. Wouldn't you want to share that with your teammates so they could do things to mitigate?
Well, Dr. Drew, you don't mitigate commotio cordis. I mean, it is a freak accident. It is a freak accident that happens, on the order of 10 to 20 times a year. So basically, just saying because they haven't told us means that he has commotio cordis. I mean, just because they haven't told us that he had commotio cordis doesn't mean that he doesn't have it. I think we should pause and wait for the evidence and information to come out rather than making assumptions.
Oh, I agree with you. I agree with you. I think it's a reasonable position. But let's just talk about, we've talked about this all before, but I mean, the fact that he rearrested, okay, maybe. The fact that he took so long to get off the ventilator, well, maybe shock lung. The fact that he took few steps after he got up after the tackle, well, maybe he was in VTAC. So now we're contorting ourselves. And by the way, commotio almost never happens in adult males playing football. It happens in young prepubescent males playing baseball, hockey, and getting an elbow. But okay, it's possible. Possible. We have to contort ourselves to make it so.
I've got a comment from the audience, Dr. Drew. By the way, Drew, as you know, like anytime you want to jump off, just say, "Hey, bro, hey, Mario, I got to jump off." So it's fine. So this one's from the audience. Audience is bottom right corner. You can ask your questions to Dr. Drew and other doctors here. I'll read it out to you. I'm listening with you. Just an FYI that it is the same shit as what has happened with antidepressants, except with 60% of the globe and very quickly. Have you heard about how antidepressants are proven to induce suicide, chemical castration, anhedonia? It's the same model they knew what they did, suppress data.
No, I mean, no.
So I'll let you refute it.
Yeah, well, this is the problem with everything we're discussing is people go, running to one side or the other, which is why we're trying to be careful to really look at the data. The fact is, yes, certain SSRIs cause increase in suicidal ideation, not suicide acts, but suicidal ideation in adolescents. Yes, SSRIs dramatically reduce libido and orgasmic function and desire to sort of pursue. All that's, yes, completely flattened by SSRIs. So I don't know maybe that's what he's talking about there. And they save lives. And they're very effective in certain situations. Are we overprescribing? Yes. Are primary physicians who are not necessarily trained to do this prescribing the primary prescribers? Yes. So there are lots of problems. But with all this stuff, you don't want to throw the baby out with the bathwater. I think vaccines will be proven, for instance, to be very helpful in certain populations. I really strongly believe that, and that we've done the right thing with it. But that the mandates and the excessive sort of push to prescribe in certain age groups, that's where the concern is. It's the excesses that are of concern. But excesses go both ways, everybody. They go both ways.
Maybe Dr. Drew, like reading the comments, I'm going through the comments. Maybe ask you a tough question, like what are some positives you could say about the healthcare system and people within the system, or the entire system, from the executives at Pfizer to executives at insurance companies? What are some things they're doing right?
Our physician training system is second to none. I've never met a more altruistic, ethical group of human beings than my physician peers. It's remarkable how much they put themselves out at sacrifice for their patients. People literally wouldn't believe it. And I find it to be everywhere with my peers. It's again what Joanna and I were just talking about, which is we won't support ourselves. We won't even do that because we're too busy supporting our patients. And no matter what happens to us, we still put the patient first. And that is an extraordinary reality. Now, will that sustain itself in the current, sort of state of medicine? I'm not sure. I worry about that. And in terms of the physician, mostly the way this system operates that is so good is exactly what gave us the mRNA vaccines. I mean, we can improvise, we can mobilize, we have rich, deep scientific resources. And when the pandemic started, I thought to myself, we'll figure this out. This will be the country that figures it out. It's no accident that it happened here. Now, when the government and everybody else got involved, that's where things got off the rail a little bit. But the fact that we came up with a solution, I mean, we should be very proud of that. It's just what we did with it is sort of what we're talking about.
Tracy?
Coming back, if I may, just real quick, coming back to what the Twitter file dump here was, right? I'm a cardiologist, by the way, and I think partly in response to what Lisa said about an hour ago in relation to the smallpox vaccine, right? I think one of the issues that allows pharma to send stuff to social media and say, hey, I need you to censor this because it's misinformation, is entirely because the government has made this big deal about misinformation and made it like enemy number one. And now everyone is kind of running around saying misinformation, and social media companies then have to now act then the pharma companies, will send a response. The social media companies will then feel like they need to respond. And what the point I want to make with the smallpox vaccine is that if you just look back, like Lisa did, at the smallpox vaccine story, okay, you see that we have the mechanisms in place to do appropriate regulation. And what happened with COVID is completely not what happened with the smallpox vaccine. All right. So the smallpox vaccine story, just in 30 seconds, all right, was that yes, we ended the smallpox vaccine campaign at some point because the risk of the smallpox vaccine was higher than smallpox because smallpox was eradicated, right? Then after the Gulf War happened, there was concern that Saddam Hussein and other actors may have reconstituted the smallpox vaccine, and the United States, felt the need to start the smallpox vaccine over again. The problem is that they started it with a vaccine that, when they monitored these folks, had high rates of, guess what, myocarditis. All right. So the initial smallpox vaccine after the Gulf War, when they tried to restart the campaign for first responders who were going to go be in the Gulf, they caught a bunch of cases of myocarditis, right? And in part, they then as a result, when they went to a second generation smallpox vaccine, all right, they specifically looked using troponin samples and EKGs in the trials that were done to approve that second generation vaccine. It was called the ACAM vaccine. Again, this was a smallpox vaccine, all right? So the government regulatory agencies said, you know what? We had this big problem with the Dryvax vaccine. That was the first gen smallpox vaccine. On this, when we try another more safer variant, in order to make sure it's safer, how do we do that? Well, we're going to give the vaccine, the second generation vaccine, in the trials, and we're going to monitor troponin levels, which is a blood test in the blood, to see if there's cardiac activity, as well as EKGs, right? And guess what? The ACAM vaccine showed a fair percentage of folks that were having elevations in their cardiac biomarker levels, right? And so that's why we don't use the ACAM vaccine today. So today, for the monkeypox epidemic that happened, that we ran around vaccinating a bunch of people, we used the smallpox vaccine for monkeypox because the smallpox vaccine works for monkeypox as well. And that vaccine that we used was not either the Dryvax, which is first gen, ACAM, which is second gen. We used the third generation vaccine called Jynneos, And guess what? Jynneos, in order for it to get approved, had to do the same trials where they had to look and see, is there cardiac muscle that is damaged after getting it? In order to do those trials were done by checking those biomarkers. None of that happened with the mRNA vaccines, right? So, if we allowed the regulatory system that we currently have in terms of surveillance and safety to work, you would see a much, much, much different approach to what's going on. What's happened is the regulatory environment has been completely screwed up by politicians and by politicians in government, and that's why we don't have. What's happening now is not what should happen, and so this idea that we are doing the right things right now with the mRNA vaccines and safety surveillance. There's a safety signal that comes up. We have a pause. We then check a variety of things. We're not doing it. The FDA, when they gave the EUA for the Pfizer mRNA vaccine, said, hey, Pfizer, you must do a study which looks specifically for myocarditis by checking cardiac biomarkers after giving it, right? And you must release the data on that. They were supposed to do it in the summer. It didn't come out. The paper was supposed to be released by the end of last year. That still didn't come out. So I don't think they've done the study, but yet the EUA approval stands. So things are happening here that are not the way they should be.
I think that's right. I looked back in my calendar and I noticed it was almost a year or more. I think it was sometime in summer 2021.
Yeah.
Go ahead.
Yeah, and one more thing, and just to disagree slightly with Dr. Drew, is that I think putting the government in charge of prosecuting physicians for practices is kind of like giving a blind, trying to have a blind squirrel find nuts, right? Maybe every now and then it does the right thing and finds a nut, or maybe every now and then they find a physician that is doing bad things. But
so what's the alternative, Anish? What's the alternative, Anish? I see Dr. Drew on mute, but what's the alternative? Drew, I'll let you respond, Drew, as well.
Yeah, we have a medical malpractice system, right? And it can work that way. But I think the last 2 years especially have demonstrated clearly that the government has no clue what they're doing when deciding who is doing the right thing and who isn't doing the right thing. And I may disagree with...
Anish, I could not agree with you more completely. And interestingly, I should have been clearer. When I was talking about these evangelists, I really wasn't thinking about practicing physicians. I was thinking about people in public health positions, people in regulatory positions. There's something somewhere, people with great far-reaching influence, or maybe even in professional societies or something. It's not going to be just some practicing physician. I should have sort of been clear about that.
Tracy?
Yeah, I think that the biggest problem here is that the trust in the medical system from an everyman's perspective. I mean, I'm just an investigative journalist. I'm not a medical professional. But from our perspective, trust is completely gone because of the things that you guys have all been saying up here as professionals. For example, they're not doing those studies that we're talking about here. And if we were doing those studies, the results would have been clear. I mean, it was left to the people to look inside of the VAERS system to see what was going on, because they started to realize that all of this was everything was done out of order. You're basically running a phase 2 trial on all of humanity all at once. And anytime anyone speaks out about that or says, hey, I have a bunch of friends who are having strokes right after getting this vaccine, is that weird? You're basically called a conspiracy theorist and shut down. I mean, Dr. Drew, it's great to meet you. I think you've experienced this from some of your peers just for having a conversation. So how do you get the trust back?
Just for asking the question.
Right.
I'm becoming and again, my thing is just to ask the question, to get the questions answered. I don't claim to know the answers even, but I am sort of a broken record. I just keep thinking it has to go back to, there's only one group that's actually has the patient's best interest in mind. One group all the time, the patient sitting in front of him or her, that's the doctor.
But we become the most impotent group among the stakeholders. I mean,
yes, sir.
We have no
that's
power.
Not even always true. That's not even always true, sadly, because there's a lot of doctors who would refuse to write exemptions for their patients, even though it was in their best interest because of the threat of their medical license being removed. There were a lot of doctors
I agree with
recommending this shot to people with autoimmune disease and other issues without doing the research that others have done. And I feel like that's not having the best interest of your patient in mind. So how do you make the distinction?
Well, we're talking about in there's always exceptions, but in the totality of physicians in the U.S., I think we're disproportionately empathetic and altruistic when it comes to our patients. Yes, we're indoctrinated. Yes, we're influenced. Yes, the pharmaceutical industry influences our healthcare system in a number of ways, including our medical education and our default to prescribing medication rather than focusing on prevention and environment. There's all those issues can still be true, but as a profession, we ride or die for our patients. I can say that off the bat, but the corporatization of healthcare has changed that between the hospitals, the pharmaceutical industry, and the insurance companies. We've lost a lot of our ability to engage and direct our patients' care without these other industries with other motives controlling us.
Yeah, I think it's.
I may
100%.
But isn't that really a function of government, Bernard? I mean, really, we don't talk about government enough, and it's mixed into this problem, and which
but it's
play
also,
out in
Jim,
the present disaster.
It's also a function of how the healthcare industry is currently working. So a generation ago, a few decades ago, 80% of physicians were in private practice and 20% worked for a large, corporate HMO, large hospital system type context. Now those numbers are reversed. So 4 out of 5 physicians are now working for a large, typically corporate entity, or government entity like the VA hospital, where they have far less autonomy, they have far less discretionary latitude to try to tailor individualized care. They also feel, right or wrong, probably rightly in many cases, far less ability to speak out publicly on questions of healthcare policy, public health policy, or to criticize or ask questions about what can become a dominant narrative, and what becomes a dominant narrative very easily when we see the kind of behind the scenes manipulation that was described in today's Twitter files drop. And I just want to, just one quick point, just to again provide maybe some historical context. There's a political theorist named Eric Voegelin, and Voegelin studied the totalitarianisms of the 20th century. And his insight into the way in which totalitarian systems functioned, I think, is important for us today. And because he said the central feature of all totalitarian systems is not concentration camps or men in jackboots or secret police or mass surveillance, as bad as all those things are. And by the way, we do have at least the mass surveillance component of that in place today. And we do have this sort of government-sponsored control of information component of that in place. But he said the central feature of all totalitarian systems is the prohibition of questions, the inability to ask, the inability to pose questions about what's going on in society, about what the government is doing, about what public policy or private corporations are doing, is what all the totalitarianisms and the horrors of the last century have in common. So if our society has gotten to the point where doctors, lawyers, scientists, well-informed professionals working in the spaces where their expertise would be relevant feel that they cannot ask questions, feel that they cannot raise questions, or their job may be at risk, or their reputation may be at risk, this is a very, very bad situation. And a digital gulag can be, I don't want to say every bit as oppressive as a real gulag, but it certainly can be every bit as effective in terms of silencing questioning, silencing dissent, suppressing the ability of, let's say, frontline doctors to come together and speak to the public at large about what they're seeing. And Dr. Drew is absolutely right that frontline physicians drive medical research because they're the ones who raise the hypotheses and the questions that ought to get studied down the road. It's not people sitting back in a lab somewhere that are learning which questions are most important to ask. It's frontline physicians seeing things, quote unquote, anecdotally in their clinic, which is a form of data. It's not the most rigorous form of data, but it's a crucial form of data, because if you start anecdotally seeing strokes or pulmonary emboli or any number of other problems that seem temporally associated with a new intervention, then you got to be able to raise your hand and say, hey, wait a minute, we got to look at this. And if you suppress frontline physicians' ability to do that, those questions are not going to be raised. And you're not going to find something if you don't start looking for it.
Yeah, I think I was thinking of this is not an enviable profession. Even 25 years ago, from the very first patient that walked into your office, printed out in hand with a big MD printout, right, and said, hey, this is what I got. I just researched it on the internet, right? And the democratization of information has really made that so interesting, partly because a lot of the success that, as I understand it, the medical society has had in the past 20 years has been implementing rote designs that are designed to reduce mortality, right? Washing your hands more, washing your fingernails more, that sort of just inch by inch sort of repetition and the application of consistency there. But again, when you get into that, now you have a differential. It's like when something new comes up, how do you deal with that? And how do you deal with a populace that is more, advised, more informed? I know my wife, we have 8 kids, and my wife went into the doctor the other day, and she's been, along with me on this COVID journey for the last 3 years too. And the doctor says, hey, have you considered getting, a flu shot for yourself and your kids? She says, no, I think we're okay. He said, yeah, because the flu is back now because, we were all, wearing masks before, and so it went away. And she's like, well, that's debatable, because she knew all the science and she knew exactly that he was really nonplussed and taken back. But it's because, when you go into your doctor and you say, okay, let me show you the autopsies that were just performed in Germany, or let me show you the latest cases. Did you see the FDA put out the VAERS information? They're seeing these signals and they have no idea, because frankly, they're just heads down trying to do their practice and trying to do the rote things that have worked well over the years. And a lot of them just aren't quite attuned, in my experience, to say, okay, what am I seeing that's abnormal, and can I raise a big alarm bell? And here in California, they can't do it at all in fear of losing their job.
I've got a question from the audience. I had my own question as well. Actually, I'll ask my question first, and I'll ask it to the same to Lisa and Drew, just because that's the question from the audience as well. It's for you, Drew, and for you, Lisa. But my question is, studies are the Bible for all doctors. Have we seen? So I've got 2 questions about that. Number one is, have we seen any studies that were censored throughout the last 3 years? And number 2 is, have we? What's the solution for studies sponsored by the pharmaceutical companies? And is that conflict of interest a serious one that could be impacting the results? Like the Israeli study we were talking about 2 days ago that was sponsored by Pfizer.
Lisa, you want to answer that?
Or funded by Pfizer.
I've got some comments too on that, but Lisa, I'll let you go first.
Sure. So there've been over 320,000 studies out. I can't comment on how many of those have been censored, or if there's been censorship along those lines. I think that there has been a censorship in terms of doctors not feeling like they can say things and things like that. Now, I can point out,
I've never heard of any studies being censored. So I'm asking.
No, there's a whole paper listing these. There's a bunch. This bunch been censored.
Okay, so okay. I like I said, I can't necessarily comment on the vast number of studies. Now, there have been studies that I think were very rapidly published that actually created a whole lot of doubt in people when they had to be retracted. And I'll give you 2 examples of those. The first paper that was published that created a whole lot of doubt was The Lancet published an article in May of 2020, so 6 weeks after the epidemic was announced, claiming that in intensive care unit patients, that the use of hydroxychloroquine had a worse outcome. And Twitter actually helped kind of raise some questions about that study. And the editor of The Lancet, Richard Horton, was very, very defensive about the peer review that went into that study. Now, what it turned out to be was that people started asking for data, and they weren't able to get the data from the group that was called Surgisphere. And so Surgisphere then got investigated a little bit more deeply. And it turned out that Surgisphere was a panel of 3 people, a science fiction writer, a cardiologist, and a stripper, who had basically manufactured this data. And that ultimately had to be retracted. And to me, the outcome, the fallout from that was really catastrophic, because here you had a top-tier medical journal trying to debunk a claim that because it got politicized, because Trump had said that he had used hydroxychloroquine to fix his COVID, or some right-wing thing. Anyway, so the politicization of that actually made the public think, oh my gosh, why did they have so much blind faith in this study? On the flip side, shortly when people started getting very interested in ivermectin, Rolling Stone published an article saying that there was a huge such a huge upsurge in cases of ivermectin overdoses that it was keeping people from going to the hospital. Gunshot wounds couldn't be treated and things like that. Well, that actually turned out to be bunk too, and so that made people not believe the mainstream media. Now, once again, I will say I think that when you look at how the pharmaceutical companies acted in these situations, Sanofi had donated millions of doses in the hopes that hydroxychloroquine would work. And I think that the preponderance of the data about hydroxychloroquine, the scientific data, suggests that in Petri dishes it might have some benefit. Really, in the real world, it probably doesn't. And my qualm with hydroxychloroquine is that it's got a very narrow therapeutic window, meaning that there are significant toxic side effects that would preclude me from saying, go ahead and take this drug that may or may not work, because look at the list of side effects. They're not minor. On the other hand,
so Lisa, before you continue, Lisa, I'm just going to say, Drew, I just muted you because you had the background noise. I'll let you finish, Lisa. Then I'll go to Drew right after, and I see Tracy's not happy with what you're saying, Lisa. So then that's Tracy, fine. Also Tracy, Tara, and Nick, I'm just going to be offline for 2 minutes. I'll let you just leave the room till I'm back. I just have to take an important call. But sorry, Lisa, go ahead.
So once again, ivermectin, I'm pretty agnostic about. I show some benefit in a petri dish. I think that it's that there should have been a free and fair discussion about these interventions. And people could have weighed in one way or the other. The information should not have been censored. It should have been a free medical discussion about the pros and cons of these things. And I think that's what's happened since then, is that it's the discussion around those initial days that led people not to believe in whether or not the vaccines are safe and efficacious. And I think that underlying mistrust, because of censorship, is really a problem. I think that, once again, with just an eagle-eye view, we have a system that is very robust, that tries to help people get some life-saving idea off the shelf and onto the market. And the fact that that system has a regulatory apparatus that's built on safety around it, that you can take the most potent toxin known to mankind, botulinum toxin, nanograms will kill a grown adult, and you can get it through a process that you have enough trust in that we can inject it in our faces for cosmetic purposes, because we know that the regulatory apparatus, the FDA, it says that you can do this and it's okay. But we don't have that same kind of trust for vaccines. Is mind-boggling to me, and to me that's a very worrying signal for how do we do this going forward? What do we need to change? What can we do to make it better? And how do you build trust?
Yeah, don't lie.
You can't build trust.
I agree.
Absolutely. I agree with you 100%. Don't lie. That's true.
I'm going to pile on a little bit what you're saying, and just because, again, my lived experience is my best teacher. And if everyone remembers the Danish mask study, the large-scale randomized controlled trial with weaknesses, but there was a lot of excitement about it. We were finally going to answer efficacy of masks, how much, how yes or no. And all of a sudden, and it was to be published in the New England Journal, all of a sudden it wasn't going to be published. Then I heard it was going to be published in JAMA. Then JAMA turns it down. And then finally, Annals of Internal Medicine publishes it's a negative study. So, what was that all about? Then I recently had an experience where somebody tweeted me a study about multisystem inflammatory disease in children and how common it was and how devastating it was, that more than 3 organ systems were involved. And I thought, oh, wow, maybe this is why they're pushing the vaccine in that age group. I've missed this. Let me look at the research. So I spent a couple hours poring over the pediatric literature, and after 90 minutes of really digging in deep to literature, I could not tell whether the multi-system inflammatory condition was exceedingly rare or exceedingly common. And that actually scared me because I rely on the medical literature. I've relied on it my entire career. And I've never had an experience where 2 completely different outcomes are published and peer-reviewed in legitimate journals. I don't know quite what to do with that. But when you put it in the context of that Lancet catastrophe and the mass study, it makes you wonder, is there something going on an editorial basis? And that rocked my world a bit. I don't know, Lisa, if you saw stuff like that, but that
Hey, Dr. Drew, we actually spoke with the author of that study, and he emailed us, and we emailed him. We said, why aren't you publishing the data on the Danish thing? He says, I'm just waiting for someone to take it. And he was very polite, but he knew exactly what was going on. And he pushed a little more. We had a few other people push for him to finally get it published. But that happened again and again throughout this pandemic. I've posted something on there.
Well, that's exactly what happened with the Wakefield article in 1998. And I'm sorry, there are dead kids because of that article. And I think it's egregious. It should have been.
What's the article, Lisa? What happened?
The Andrew Wakefield 1998 article associating the MMR with autism. And there were major conflicts of interest that were discovered by Brian Deere that it took him 6 years to find out about and then publish. And they still didn't retract the article until 2010 when Brian Deere had spent all sorts of time getting the actual medical records of these children and finding out that the article that had been published was fraudulent. So I cannot emphasize enough how my big fear about this distrust in the COVID pandemic really is more a fear of what the impact is going to be on vaccination. Because like I said in one of the previous spaces, we have 5 public health advances of the 20th century that brought us a close to 35-year increase in life expectancy in the West. And those 5 things are water sanitation, food security, vaccination, antibiotics, and vector control. Without, in the 1900, we all lived in the West, or in the U.S. anyway, we lived to the ripe old age of 45, and 45% of our population farmed. By 2000, we were making it close to 80, and 2% of our population farms. And what I have seen emerge from the House of Medicine, as I've watched the House of Medicine actually become an administrative state where doctors are not allowed to practice what they think how they think they should manage patients. What I've been seeing out of the House of Medicine is this incredible distrust of the innovations that have made that 35-year increase in life expectancy possible. They are, everybody's talking, and once again, I don't want to derail the whole conversation, but we have 10,000 years of experience with organic farming and 50 years of food security in the West. We use far less land now to grow our crops than we did in 1945. And so, but there's all sorts of doubt that's often coming from the world of medicine that about these things. And once again, we can do a space, and I'd be happy to go into much greater detail than this. But I'm watching these. We have a romantic notion of what life was like in the Middle Ages. You've got people lobbying to drink raw water to reconstitute your microbiome. That's how you get cholera and typhoid. We've got people who are lobbying to get rid of antibiotics. Well, that's how you die of, bacterial illnesses that were rampant in the early 20th century. We've got people lobbying to get rid of vaccines, but what they don't realize is that these are hugely important advances. So all of them, none of them are perfect. We need to work together to try to make them get better. And we need to be aware of the risk benefit ratios of these things, but we've got to cool our jets a little bit and try to think about how we're going to approach this going forward, because we need to rebuild trust. Because I can tell you, life in the Middle Ages is not fun. And neither is
Liza, can I ask you, are you speaking from the medical industry side of things when you're speaking the way you are? I just want to know, just so I can put my...
And before you answer, Lisa, just quickly, I also want to give a shout out to Lauren, who's up on stage for the first time. I think it's, Lauren, your first time on our space.
Yes, it is.
Yeah, I invited Lauren up to speak with us. I actually was curious if Lauren is following the Twitter file. I was curious if Lauren's following the Twitter files conversation and what was released today, but I really want to know, just for the integrity of the space, is it Liza or Lisa?
It's Liza. It's Liza. Like
Liza. I would like to know.
I messed it up. Yes, my bad.
Don't worry. Everybody calls me. So I am an emergency physician. I'm a medical toxicologist. I was in academia for a very, very long time, 16 years. And then I've moved, and I now work for industry. I now work as a medical affairs lead for Bayer Crop Sciences. So when I am speaking about this kind of stuff, I am speaking as an individual, one. Two, Bayer Crop Sciences has never asked me to come do this. I think that, Bayer Crop Sciences and Bayer as an industry has a transparency policy where all of our studies about our products are put on our website, so the normal everyday people can see what they show.
Yeah, I just asked because you're talking about regaining trust. So I don't know who, are you talking about the medical industry?
No, I'm talking about just, this is me talking as me as an individual. And I think that there needs to be a renewal of trust in science. And the reason why is I am terrified of going back to the Middle Ages. Remember, when Rome fell, it was followed by 1,000 years of the Middle Ages, or of the Dark Ages, So this is, we as a society have to we've got just unbelievable, unprecedented wealth and health and well-being. And, we've really tried to come together to achieve good things for people. So what I want to try to do is figure out how do we rebuild that?
Okay, I would like to propose a couple of concrete policy proposals, because I agree trust is greatly diminished in science and medicine and in our public health agencies. And Liza, I agree that is a problem. Medicine cannot function unless patients generally trust physicians and generally trust the regulatory process by which, let's say, new drugs or new vaccines are vetted. And so the fact that trust has been diminished is a problem. But simply saying, well, we need to reestablish or regain trust without organized medicine and without our public health agencies making changes is meaningless, because there are legitimate reasons why trust has been compromised. And simply telling people that they ought to trust an institution or an organization. So here are some concrete policy proposals. I think the low-hanging fruit is to try to minimize conflicts of interest. And let's just start at the federal level. So the NIH funds research, the CDC makes public health recommendations, but the FDA is the ultimate gatekeeper, because it's the agency that approves new drugs or vaccines before they go to market. So when pharma cozies up to the FDA, there's a big payoff there.
There was a time when the FDA could not accept pharmaceutical company money. This changed in 1992 when Congress changed the funding mechanism for the FDA, which allowed pharmaceutical companies to pay what are called user fees. And user fees basically speed up the approval process for their products. So that was 92. The following year, in 1993, those pharma company paid user fees accounted for a quarter of the FDA's scientific review budgets, 27%. By 2017, and I don't have more recent data than 2017, but by 2017, pharma paid for 75% of the FDA's budget.
So, Aaron, if you don't mind me hopping in right here, I want to introduce
Nick. Hey, Nick, give me a moment.
Yeah, Nick is. Nick is. You guys are both introducing Lauren.
Yeah. So anyway, I want to introduce Congressman Lauren Boebert. She's a friend. She goes to church over in near the Glenwood Springs, Colorado area with mutual friends of mine. And she's one of the.
Now I know, Jim. Now I know where to find you and Lauren. Perfect. Thank you.
That's right, exactly. but she's a fantastic congressman, and I think has done a lot of good things.
Congresswoman, Jim. Congresswoman.
Oh,
it's
sorry,
2023. Use her proper pronouns.
I'll do it.
I'm playing.
Do it. Hey, Lauren's got a good voice here, and Lauren, we just got this dump on these Twitter files, and we're seeing Pfizer's injection of their preference into Twitter to make sure that there was no vaccine hesitancy, no anything that would oppose them keeping their patents. And I'm just curious your thoughts from after a big move into a new Congress, what your thinking is.
Again, Lauren, going to give you just a 5-second overview. The first bunch of files were about the censorship due to perceived public good. The second bunch was censorship for political bias or political agendas. And now we just saw for the first time censorship for financial incentives, which for me is the most concerning. So not sure you've been following the Twitter files as Tara asked, but yeah, would love your take. Good to have you.
Yes. Well, thanks so much for having me, allowing me to join y'all today. And Jim's a great friend. And unfortunately, you probably won't find me in Glenwood Springs because you have to be in the swamp to drain the swamp. So I spend a lot of my time there, unfortunately. But, with all of these Twitter files that are being released, it's showing that we were right to have the questions and the concerns that we did. And we tried as much as we could to have a platform in elevating our concerns. And many people were censored because of that, lost their livelihoods because of it. And even lost their life because, our questions weren't being answered about the proper effectiveness of everything that we were told by the federal government and by Big Pharma to actually move forward with. I think there were a lot of people who were in vulnerable states who felt safe wearing a mask and probably went to places that they should not have been in heavily populated areas because they thought a cloth mask over their face would protect them and prevent them from getting COVID-19, or getting the vaccine would prevent them from getting COVID-19, as we heard so many public officials state. So, with this latest dump of the Twitter files and Pfizer with trying to censor the questions that we were having, whether it's low-cost vaccines, efficacy of the vaccines, what have you. This is absolutely egregious. And this is something that the GOP has to take very, very seriously in this majority in Congress. We have to get to the bottom of everything that was hidden and expose all of it. All of our First Amendment rights were completely under siege for the past few years, and we are seeing that come out in real time, how behind the scenes people were being censored, they were being silenced, they were being shut down, and we were not able to get the answers that we all deserve to have. This has been a very troubling time. Certainly, it motivated me to get in the fight, to stay in the fight, to protect our God-given rights, our freedoms. That's what makes our country so exceptional. And then to see that you have big pharma, that you have the federal government and social media companies working hand in hand to hide this information from the general public and refuse to answer any questions that they had. It's extremely concerning, and it really it makes us look like it makes us look like a third world country. There's been a lot of Banana Republic type things that have come out over the past few years. And I'm very excited to be in the majority in this Congress so we can actually get the truth out to the American people once and for all. We are bringing in all of these folks under subpoenas and making sure that they answer to all the harm and destruction that they have caused so many millions of Americans, including our military personnel, many of whom were discharged from their services because they refused to take the vaccine. And then, of course, we're going to answer to all of these sudden deaths. We're going to make them provide answers to these sudden deaths that we're seeing in relatively healthy people and athletes who are dropping dead. So this is something that I'm excited to be a part of. To actually reveal the truth. I'm excited about all the Twitter files that are coming out that are bringing to the surface things that we have known, things that we have tried to communicate, and there it is now, right for everyone to view.
Tracy, do you want to ask a question? Tracy Tara?
Just go ahead, Tracy. Go ahead, Tara. You can go ahead. I'm good. It's okay. Lauren, it's really great to meet you, by the way. Thanks for being here.
Thank you, Tracy.
That's basically what I was going to say, is how incredible for Lauren, our Congresswoman, to be here and bypass the mainstream media, who does seem to be doing an effective job of suppressing all of this information from coming out. So I just want to say hats off to you, Lauren. Appreciate you showing up in this space with us little guys. Mario's been doing an incredible job of hosting huge spaces about topics that should be talked about, and the mainstream media seems to just want to sweep under the rug. So I appreciate you just coming directly here to do that with us.
Absolutely. It's an honor to be here. And then, I mean, also, look, I don't even have to watch Teen Mom to be here with Dr. Drew. This is great. And,
oh my God, Lauren, I'm blushing. That's so funny.
No, this is fantastic. My mom's in the background. I think
I have to say though, guys, this is what I remember. This is the kind of sort of intervention I was talking about an hour ago. This is what happened from the Justice Department and the opioid epidemic, and this is the kind of thing that's going to make a difference here. When this actually blows up, when Lauren and her colleagues go forward and really dig into this, that's where things are going to change, right there.
So that's the thing, like really digging into it, right? Really digging into it is something that everybody on this panel is mostly really wants. Lauren, how are you going to hold these people accountable to these subpoenas? Do you have a plan? Is there going to be actual action taken if they flaunt these things? Are we going to really get answers? Like, I know you will, but what about your colleagues?
Well, first of all, they have to respond to the subpoena and show up. Democrats have set that precedent. If you don't show up for a subpoena in front of Congress, well, then you get indicted. So, I mean, that's our first leverage right there. The precedent has been set, and I don't think that Chairman Jim Jordan is going to go easy on these subpoenas. We're taking them very seriously. We're actually they're meeting today to assign all members of Congress their committee seats, and I'm hoping to serve on the Judiciary Committee with Congressman Jim Jordan. And I mean, we have so many heavy hitters there. We have Mike Johnson, Chip Roy, Thomas Massie, Matt Gaetz, and Andy Biggs. And we are going to tear into every document, dive through it. We have an amazing legal team on the Judiciary Committee. And we are going to invest every single day into getting to the bottom of all of this and exposing it and holding these people accountable. There's many things that we can go into skiffs and talk about, and you know, there's ways to communicate with the people who are there in front of Congress to testify, to get answers out of them. And if we have to go into a skiff with them with classified information, there are still ways to to get that information and not necessarily release classified documents, but get that information out and get the answers that we need. So there are many different tactics that will be used. I know that Jamie Comer is going to chair the Oversight Committee, and they're going to be doing a lot of hearings and investigations as well. And this is what's most important in this Congress, the hearings and investigations that will take place, because we don't have the Senate and we don't have the White House. So this has to be our heavy lift. We can pass all the bills we want to this Congress, but that doesn't mean it's going all the way through. That doesn't mean it's going to be law. And certainly if we had to rely on 11 Republicans in the Senate, well, I'm not putting all my eggs in that basket, because we saw what they just did with the $1.7 trillion omnibus bill that allows Nancy Pelosi to rule with a dead hand for the next 9 months and take all of our spending authority away. So certainly there's some things that we need to get planned, get in the works for spending, for CRs, for the budget, for appropriations. But the investigations and hearings are the most important thing to watch right now in Congress. And I just cannot wait for them to get started and have these people in front of us and be held in account for everything that they've done.
Hey, Lauren.
Can I ask a question, Lauren, really quick? Can I just ask a question from a DM that I just received, asking if the Twitter files provided you with actionable intel, or would you have had this much success without them?
Oh, I think that this absolutely provides intel for us to go off of. This is massive information for us to utilize in committee and to begin to expose the truth. These are a godsend. They're really an Elon send, but I am so grateful for them, because this doesn't allow the mainstream media to put us in the crazy bucket for asking a question. These are the same questions we were asking for years, and now we are seeing that we had every right to have the concerns that we did. This provides so much information for us to be able to use going forward.
So now we have BE before Elon and AE after Elon, and we're in the AE phase.
Lauren, I have a question for you. I'm a physician actually in New York City, and I followed the speaker vote very closely. Thank you so much to you and to Matt Gaetz. What you guys did was just fantastic and very, very brave. What's the consensus like among Republicans and Democrats in the House and perhaps in the Senate regarding Twitter files, regarding Pfizer right now? I'm just curious to get your take.
Well, I think that Democrats hate it. They never liked it for the truth to be exposed. I mean, just last week, we had a couple of debates over rules and legislation in committees. We're forming a new committee over the weaponization of the federal government. And every word out of their mouth is conspiracy theorists and QAnon and all of this stuff. So they're going back to all of the conspiracies when they are the party responsible for all the conspiracies that have caused so much damage and so much harm, whether it's a cloth mask being effective, or the vaccine preventing COVID-19, or the Russia hoax, or hiding Hunter Biden's laptop, or knowing that the vice president of the United States had classified documents in multiple locations before the election. So, we're starting to hear all of this rhetoric really ramp up from them again. I don't think that Republicans are fazed by it like maybe they once were, because we know that we are on the side of truth, and history will prove that, and it already is proving that. And I think Republicans are just really excited to roll their sleeves up and get to work. With the speaker vote, just to touch on that, that was an amazing experience. It was the most productive week in Congress I have personally experienced since I've been there. We had cameras all over the floor, being able to get the intimate moments that were taking place. We had 435 members of Congress joined together. We were debating the issue at hand. We were having conversations with our colleagues, engaging with one another on the House floor. Now, the 2 years that I've been there, the House chambers have been empty. They are empty all day, every day. And it was really exciting to actually see members of Congress show up to work and work together. So from the outside looking in, people were saying this is chaos and you can't get your stuff together. But I'm a mom of 4 boys. I know chaos and dysfunction, and the speaker's vote was anything but chaotic. It was actually more productive for us to come out stronger than we went in. And I know that a lot of relationships were formed and were strengthened during that time. And we will be able to work together in the future better because of it. And really, I think I share the same sentiment as a lot of my colleagues in wanting the House floor open to media like it was during that week. Normally, it's just the fixed C-SPAN cameras that get very little movement and activity on the House floor. But I think more members of Congress would actually show up on the House floor for a debate if cameras were present and people would see if they were really showing up to hear the matter at hand. And then also just catch those really personal moments that were happening, whether good or bad, whether it's a chairman going after Matt Gaetz, or, just the conversations that are having with colleagues on the other side of the aisle. And so it, as Matt Gaetz would say, it really humanizes members of Congress and shows you it gives you a glimpse into a realm that you don't normally see when it's just in a committee, just on the floor, reading your talkers, or whatever you had prepared to speak for the day. It's not as orchestrated. It's more lively and more relatable to the American people. So I thought that was a fantastic week. And with all this information that's coming out, I know that Republicans are energized to do something about it and get the truth out to the American people, and Democrats hate that.
Hey, Lauren,
so
I got
Congresswoman,
a
you've been a vocal critic.
Nick calls out to say, Jim. Hold on, go ahead, Jim.
Lauren, got a question for you, but I got a little bit of a setup that you might not know about even. So, Richard Hudson and I served as chiefs of staff together back in the day when I worked for Tim Huelskamp. And I texted Richard after the Rogers incident, and I said, Richard, you just prevented the first physical altercation on the floor of the House of Representatives since before the Civil War. And we kind of chuckled about that together. But it was great to see Matt and Rogers get back together. I mean, that was actually, I think it bolsters your point that it was a productive thing because, they came back as friends together, very friendly publicly. And so that dynamic plays over. When I was Tim Huelskamp's chief of staff, he had gotten kicked off his committees because of some of these leadership problems. And then we had a little bit of a battle brewing in 2012, very similar to this one. Yet this one, and it failed, yet this one was very effective. Mm-hmm. So how do you see the dynamic building back up? Because you and Matt were definitely, two that were perceived, at least in the public, to be on the hardest edge of the opposition. Chip was there too. Chip and I were chiefs of staff together. He's a great guy. But how is it that you see that dynamic moving forward so we can deal with issues like the Twitter files and things moving forward?
Yes. Well, you can see the amazing concessions that were made, and to Speaker McCarthy's great credit, he saw the merit in what we were asking for. It took him a few days, but he saw the merit and he accepted it. And I think it does show good leadership qualities to be able to accept the concessions that were being made. We obviously, my red line that I was out public with very early on was the motion to vacate, saying that you cannot demand more responsibility and less accountability. That is our only mechanism to hold the Speaker of the House accountable. And Nancy Pelosi was the first one to take that away from each individual member. We've had that for 200 years. This is something that Thomas Jefferson wrote and created. And to have Nancy Pelosi take it away and then have the Republican Party follow suit was unacceptable to me. But that's where negotiations began, with that motion to vacate, because you can't have negotiations where trust is absent. So we were able to talk through many details. Chip Roy was amazing in that. Matt Gaetz was amazing in that. And we really came together, had a meeting of the minds of what we really wanted Congress to look like. So we had a once in a generation opportunity to change the way Congress operates. You can't ask anyone on the streets if they approve of Congress and then say, yeah, I think these guys got it all figured out. They're doing just fine. They should leave everything as is. Like, no, people hate the way Congress runs. So we were able to get single subject legislation, and any amendments to those single subject bills, they have to be germane to the bill. Which is amazing because Nancy Pelosi ran a complete con game where she'd title a bill one way and then load it with a bunch of junk that had nothing to do with the title. Look at the infrastructure bill that we passed, $1.2 trillion. Only 9% of it went towards anything infrastructure related. And so this also strongholds the Senate as well, because they have to send us single subject legislation with amendments that are germane to the subject. And we also have 12 individual appropriations bills. So the Senate can no longer send us a multi-subject multi-thousand. Sorry, I'm from Congress. I had trillion in my brain. We don't really deal in numbers like less than a trillion. So a multi-thousand page piece of legislation. They have to send us 12 individual appropriations bills instead of these big omnibus bills, and so they aren't able to send those to us anymore. So this really changed Congress as a whole. And I know that we are going to be more productive coming out of it. Speaker McCarthy is given great credit to the changes that were accepted, and he's eager to move forward with them. He even took it a step further and took Tucker Carlson's suggestion of releasing all the January 6th footage. This wasn't even something that we had in our demands, and he heard Tucker Carlson say it and put it in there. It's going to be amazing, the things that we're going to be able to accomplish, not so much with legislation being passed all the way through with these smaller bills, unfortunately, but the rest of it's going to be very productive.
Yeah, I think a lot of people are not aware of the fact that it's not the contributing factor, but it's a dynamic factor that has allowed this spending to get so crazy is that it has been probably over 15 years, nearly 15 years, if not over, that we have not done regular order where we passed 12 appropriations bills. And for those who don't understand, when you go through each individual bill, instead of doing these omnibuses and continuing resolutions, then there has to be actual debate on what's in the bill. And when you can offer amendments on the floor, then you can bring restrictions in that someone hadn't thought about or whatever. So this is going to be a key factor moving forward. But one other question I have for you, Lauren, while we have you here, and you're very gracious about giving us your time. So back specifically to what's been going on with the Twitter files. We just today found out that Pfizer was pushing Twitter very hard to restrict any opposition to what they were going to do rolling out the vaccines. Now, this is a function of corporatism that is very alarming when you watch it the way that we're looking at it. And if you haven't seen those, you definitely need to look at it closely. I think it's going to be important. But as we think through what's happening, not just with the government having the FBI, the CIA, the NSA, and DHS kind of urging Twitter along to shut down free speech, now we're seeing this massive corporate push as well. And it's alarming to everyone on this thing. So what do you see happening in Congress to try to address that problem moving forward?
These are folks that we have to bring in. Even Pfizer with their immunity, with vaccines that no one can sue them. All of this has to be brought in and brought under investigation and see what outcome we could have with different rules in place. I think all of these agencies, not Pfizer, the federal government agencies, they are all overgrown. They are all bloated. They all need to be diluted massively, and we have to clean house. Whether it's the FDA, the DOJ, the FBI, ATF, all of these agencies, they have to come in and speak to us, because it's not just the vaccines and Pfizer. It's happening all across the board. And if these agencies are so big that they think that they don't have to come to Congress and answer for what they are doing and how they are spending taxpayer dollars, well, then that just shows that they have grown larger than they ever should have. When the branch of government that created these agencies aren't able to bring them in and question them and have these investigations and answers to how the money is being spent, well, then that is a massive problem. And we have to reconsider how they are structured and the bureaucrats who are working there and how many they have. And if agencies need to go away, if ATF needs to go away, and, some of those duties fall under the FBI. And there's a lot of things to do with that. But just with the immunity is something that concerns me greatly, that Pfizer receives with their vaccines, to where they aren't responsible for any of the outcomes that happen with their vaccines. So this is just a drop in the bucket to what we're going to do this Congress.
Hey, Tara, why don't you throw in your question? Go ahead.
Yeah, I've just got a quick question, Tara, and I'll go to Tara Bernard. Do you mind, Tara? I was going to ask a very quick question, Congresswoman.
Yeah, sure.
And I always try to get this opportunity, Lauren, to ask this whenever we have lawmakers on the panel. Everything seems, so we cover anything that is gaining media attention, and obviously the Twitter files and the vaccines are a big part of that. But it seems any topic we cover gets politicized very quickly. Is that really a bad thing? Maybe we consider it a bad thing. Is it really a bad thing? And why? Like, what got us to this stage? Is it something systematic? Is it part of what makes us a democracy? Or is it a flaw within the democracy we have?
Well, I think the politicization of a lot of this, especially when it comes to COVID and the government's response to it, the politicization of that, it actually benefits us. Because when President Trump comes out and says, hey, this works for me, and that becomes politicized, well, people start perking their ears up and say, why? Why are you so against this if someone is saying that it works? And so it actually brings more attention and more awareness to the issue. But, I think the average American doesn't want everything politicized, especially on the Republican side and the unaffiliateds, because we desire to live a quiet and peaceable life, and for the government to leave us the hell alone. And so at some points it's beneficial because we're bringing awareness, we're getting truth out there. Maybe it takes longer than we want it to. But on the other hand, it's very frustrating because we want to go and build our lives and not have politicians overregulate, overtax, overspend, and destroy everything that we are working so hard to build. But you have to be involved to make a change. I never wanted to be a politician. I never wanted anything to do with the federal government, but I was so frustrated at everything that was going wrong. I decided to step up and do my part to serve my country, to be a part of the solution, to get the awareness and the truth out to the American people, to stand for them, to fight for them, to be their voice. And so we have to be involved and have a say, or you see how they will just radically overtake every part of our life. And so someone has to speak up. Someone has to take a stand against all of this. And, things are going to be politicized in the mix of that, or in the midst of that. But take, for instance, last year when I was in the minority and we had this disinformation governance board that was being formed, and the director of it was Nina Jankowicz. I got loud in the minority. I introduced legislation. I led a press conference. And got real vocal on Twitter with my colleagues and all of this. And we were able to get that shut down. This was a direct attack on Americans' free speech. This disinformation governance board would have been placed under DHS. This is a militarized department of the federal government, a militarized agency, and they have the use of force. And so that was terrifying to say that we are creating this to come after the American people for what they say, their protected free speech. And, I'm really proud that we took a stand and got very vocal over the issue and were able to put an end to that. But there's still so much work that needs to be done.
So Congresswoman, you've obviously...
Bro, hold on. Let me give Dara quickly the mic because I interrupted her. And then you can take it with Bernard and Tracy.
I'll be really quick. I just have another question coming from Freddie. He's asking if you know or maybe foresee Zuckerberg and potentially Elon being indicted to testify before Congress in regard to what findings they have, or even Jack, or the old Parag, the people who were in charge of Twitter prior to Elon's takeover, who were involved with the censorship. Do you see them being forced to come in and speak?
Yeah, so that's ultimately up to Chairman Jim Jordan, but I do see that. I do see them receiving subpoenas and coming before us in Congress. There's been too much that has gone on with all of these companies to not bring them in. So I certainly foresee that. Ultimately, it's Chairman Jordan's decision, but I think he wants them in there just as badly as we do.
Okay, Nick can go for it.
Nick, Tracy, Bernard, go ahead, guys.
All right, so
okay, yeah.
Go ahead, Nick.
Bernard,
okay,
go ahead.
Thanks, Nick. First of all, thanks so much for being on here with us, Congresswoman Bobart.
And Lauren, before Bernard, Congresswoman, just quickly before Bernard asks a question, just so you know the etiquette of the space. Whenever you have to jump in, it's not rude to say, guys, all right, I got to hop off. It's very common, so we know you're on a tight schedule. You just jumped in.
No problem.
Cool. Perfect. We'll go Bernard, Tracy, Nick. Go ahead.
Yeah. So basically, I never thought I would be in a position to agree with you as much as I have so far. I think anyone who's holding our government accountable should be supported in that regard, especially when it comes to our public health. And so, just to let you know, I'm a vascular cardiologist, professor of medicine, and actually have a more nuanced approach to this COVID-19 pandemic, and vaccines. My question to you is something that we discussed earlier on with regards to the profit incentives that are based into our healthcare system, specifically with regards to the vaccines and how Pfizer and Moderna and some other pharma-related organizations has operated. Now, I don't want to make this political, but the Republicans are well known to be pro-business, which I agree with and I'm cool with, but these large corporations that are now influencing our policy for clear profit incentives have run roughshod over a lot of the interests of the public. And so I want you to speak to that and can you talk about what we can do to mitigate or diminish their influence over our policies in government?
Yes. So, the Republican Party is certainly pro-capitalism, and to be able to put your hand to something and create wealth is it's the American dream. But I think big pharma is a bad answer. Big pharma has grown way too big. There's so many immunities that they have outside of the federal government because of the federal government, and that is something that we have to rein in. There are plenty of corporations that are massive, and some of them, we've seen cause problems, whether it be Facebook or Twitter before Elon bought that, and this, this is a problem when you are a public square and you offer people the time to debate and ask questions and have conversations, but then you shut them down because you don't like what they're saying. And so I do think that big pharma is need to dig deep into the corruption of big pharma companies and their relationships with entities. And then we need to pull it into Fauci. And so we need to pull him in. And Dr. Fauci has been the ringleader of all of this. He allowed big pharma to have all of this power that they did. He was the one propping them up and making the suggestions, forcing people to get this vaccine. And so that's where I politicize things and say Dr. Fauci has to come before Congress and answer to everything that his suggestions have caused, and we have to hold him accountable more than anyone else. There's a reason he said that he was resigning when Republicans were taking the House, because he didn't want to come in and answer to all of the destruction and the growth of Big Pharma, the propping up of Big Pharma that he caused. And so I am glad that
I'm glad you bring that up. I'm glad you bring that up because I wanted to speak to the corporate welfare that's involved there. I mean, taxpayer dollars went into developing the mRNA technology at a substantial rate, yet the pharmaceutical industries are reaping all the benefits while our government is using our taxpayer dollars to pay for these vaccines. And so I find issue with that.
Yes.
So yes, we can be pro-capitalism. That is not capitalism,
right,
when taxpayer dollars are subsidizing technology, yet we're not getting the benefit from that technology.
Yes. And that's why I have a problem with the immunity that Big Pharma has as well. But I mean, I'm probably one of the bigger fiscal hawks in the Republican Party. I think both parties are responsible for a $32 trillion national debt. And we have to start cutting this back at some point. You know, it starts with a study here and a study there, and then it does turn into corporate welfare and subsidizing all of these companies for everything that they're doing with no benefit, if anything, more harm to the American people than benefit to the American people. And so this is, I mean, spending is something I fight on a regular basis. I served on the budget committee last Congress. And I mean, there's plenty of things that the federal government funds that they should not. And there's a lot of subsidies that go into that. And, you know, I'm a small business owner. I never reached out to local or state or federal governments for help with my business. I wanted to grow that business and do. On your own, then maybe you're not doing the right thing here. But there is a massive there are massive subsidies that go out, just as you said, that do not benefit the American people, that we don't reap the gain from. And I mean, that's something that we have to get under control. I don't know if we'll fix that in one Congress. I seriously doubt that, but that's something we can certainly start working towards. You know, there's just so much corruption that takes place in all of these deals. And, you know, that's what I'm there to undo.
Thank you. I thought it was an excellent answer.
Thanks for saying you agree with me. You know, if you only read about me and never really get the chance to talk to me, you probably think I'm a lot crazier than I am.
I completely agree. And that's why we love these spaces, because it gives us a chance to actually get through the filter of the media and even social media. It's important to have these conversations because each side gets painted a certain way when that in fact is not the case. So I really do appreciate this opportunity.
Yes, sir. Thank you.
Go ahead, Tracy.
Awesome. Thanks, Lauren. I'm an investigative journalist and independent media. And so I have you here. I have to tell you one thing and then ask you one question. You talked about the Disinformation Governance Board. You were so wildly successful with getting them to publicly shut that down and stop the funding and all of that. But I need to make you aware that CISA has designated Americans' thoughts as cognitive infrastructure. That was discovered in a recent lawsuit that's ongoing between the states of Missouri and Louisiana. And I know you guys are probably going to be all over that. So please pay attention to CISA and these other agencies that are doing this stuff with censorship behind the scenes. And my second question is, are you guys going to be more open to non-corporate media covering Congress this session rather than only having corporate media inside the galley? Thank you.
Yes. So CISA is on my radar. And as far as the media coming into the Capitol, I think Speaker McCarthy has already agreed to that. For instance, I know Breitbart wasn't allowed in the Capitol when Democrats held the majority, and they are now allowed there. And so I think that you're going to see a lot more access to other reporters, other media that's able to come into the Capitol. But also the Capitol is open to the public again. That is massive. I served in Congress for 2 years where the American people didn't have the right to petition their government with their grievances. They could not come into our offices. For goodness sakes, we had a fence around the Capitol and miles of razor wire and 30,000 armed National Guard outside the People's House. It was absolutely disgusting and un-American to see that display, to walk through those fences and see the American people kept out of their United States Capitol. So Speaker McCarthy has already said the Capitol is opened up. We're already starting to see more people filter through. I know that he's going to have to hire more Capitol Police. Nancy Pelosi at one time was 300 police officers short. And that was one of her excuses, other than COVID and being a tyrannical dictator, that she would not open the Capitol to the public. But Capitol Police officers are excited. We don't have magnetometers in the House chambers anymore for members of Congress to go through before entering the chambers, which that was just such that was such a terrible thing anyway. There was such idiocy in planning that. The metal detectors were put up around the House chambers only because of January 6th. Now, I was in the chambers January 6th, and I didn't have my gun because we aren't supposed to carry it on the House floor. There was no magnetometer. I was just following the rules. And I sat there thinking, wow, I prepare every day to make sure I'm not in a vulnerable situation where I need to defend myself against a larger potential aggressor. And here I am, not knowing what's on the other side of these doors. I'm disarmed. I was not unarmed. I was disarmed because I'm not allowed to have it in there. And I wasn't thinking, gosh, I hope there are enough metal detectors outside. No, I was wanting my dang gun. And, so metal detectors are gone. Capitol Police are happy. The Capitol is open. I do believe you'll see more media there. And I am going to hop off for this round. This is a very, very impressive Twitter space that you have going on here. I think I saw you had about 10,000 listeners at one time. So good job for you guys getting a great base to listen to you. And I hope to join you again soon.
Thanks, Lauren. Really appreciate you having you on the panel, Congresswoman, and giving us your time. So whenever you want to jump in, just DM me and we can bring you up anytime. Thank you so much.
Awesome. Thank you.
Thank you. What did you want to ask her, Eugene, by the way? I know you in Portugal didn't get a chance. What was your question?
Well, I wish I had a chance to talk to the Congresswoman, but, just from a political side, I know I talk a lot from the physician side, but, I was blocked by Trump. I had Donald Trump Jr., Sarah Palin, so many others falsely accused me of being a wife beater. So what I wanted to ask her was, as a victim of cancel culture from the right, for myself, what do we do about social media companies that have grown so large, and big tech companies in particular, that have grown so large that they have like a monopoly on conversations, and they're protected by a lot of things like Section 230. There's also the New York Times versus Sullivan Supreme Court case that makes it extremely difficult for people to pursue defamation cases against media companies, which I think is egregious, especially if we live in a free country where we have the right to have small people, small individuals fight against gigantic media corporations and not be domineered.
How do you think? Like, I don't know. Like maybe Tracy, I'll ask you that question actually, if you don't mind. Like, without politicizing it, how can we remove power from these social media platforms, or can we? Like, they've just got. I don't know. You just need both sides of the aisle to come together and take action. I think it's the only way something could happen.
Honestly, like from Eugene's perspective, he was defamed. I've been defamed incessantly by the legacy media. I sympathize with you, Eugene, because it sucks. It's a terrible, terrible experience, and it never stops. And we are relatively powerless to stop it. In terms of the social media companies, I really feel no matter where you stand on the political spectrum, if government were not involved with social media regulation, and if government weren't holding a cudgel over social media in terms of antitrust threats or Section 230 threats or whatever, we would see a lot less of what you are talking about. So less government, more freedom, always.
Aaron, what do you think, Portugal?
Yeah, I'll keep it quick. There's only two things. The first I would say to Eugene is, disagreements or defamation is in cancel culture. I'm sure you weren't deplatformed. I'm sure you didn't lose your job. I'm sure you didn't, have the inability to feed your family just because you challenge certain things. I think, disagreements and the ability to censor your opponents is not the same thing as the, multinational corporations deplatforming you, debanking you, etc. The only question I wanted to ask Lauren, Rep. Boebert, and maybe Aaron can answer this is, a lot of us are forced to look at studies and data out of Europe, Israel, and other countries because it's so poorly done and tracked here, and they won't fund the actual studies that we want done regarding COVID and the vaccine. So I was just curious, since they are going to be bringing these, public health authorities and organizations before Congress, what authority or power do they have, especially since it seems everybody's funded till the end of the year, to actually force them to perform adequate studies with the proper controls and methods, so that people can have trust and confidence and have these questions answered, because it's clear that they don't want these questions answered for whatever reason. And they're never going to fund it if they have the chance. So I was just curious, what can be done, because I think it was Aaron who stated earlier, a lot of journals won't even publish studies that, that are credible, that contradict, the narrative they're pushing out. So I'm not sure what power Congress has to force these institutions to study these issues. If Aaron knows what they can do, I'd really appreciate it.
No, it's a great question. Congress has power because they control the purse strings. So their ultimate control over the executive agencies, because the executive agencies are part of the executive branch, their directors answer to the president. The whole layer of bureaucrats underneath that seems to answer to virtually no one, which is a problem with the administrative state. But at least the director of the NIH answers to the president. But his main job is to lobby Congress for additional funding, because Congress will put in the budget a certain amount for the NIH, and they could certainly exercise a lot of sway by putting stipulations in terms of how that money is spent.
But that's at least a year out, right? And if we're waiting a year to do this purse strings battle, right, and they have to fund the studies, and we're going to wait another year for the studies to come out, like what can be done now to force these individuals to actually study these issues that we want answered?
Well, I mean, Congress could pass legislation to basically, put out a request for proposals to study burning questions that have been largely ignored by the public health establishment, and they could fund that themselves. I think there are ways to do kind of short-term, stick your finger in the dam fixes. But you're absolutely right. The best research, very often the best research, came out of rather peripheral places like Qatar and Israel, and places whose budget is dwarfed by the biomedical research funding budget of the United States enterprise, 85% of which comes from the NIH. As a longer-term solution, I've proposed block grants to states so that we have 50 state institutes of health competing with one another, and maybe carving out a niche within their universities or the researchers that they happen to attract to that state. And then certainly states can regionalize and collaborate on larger projects that would affect everyone. And probably there still should be some national funding for biomedical research.
Aaron, can I ask you one last question?
Everyone to be involved.
In regards to, we all saw a couple of days ago when they said there was a flag regarding issues with the stroke and the vaccine, and a couple hours later they said, don't worry about it. Have you actually looked into any of the data, the info that the FDA and these other organizations said, the flag is nothing to worry about? What is backing up their ability to say that after their own system flagged it?
We don't know, because that data is largely unavailable. So we have access to the passive reporting system, VAERS. We don't have access to any of the other two active reporting systems, the vSafe, or the other one, the name of the other one is escaping me, but it relies on a Medicare database. So I filed a FOIA request to get the clinical trials data from the FDA, and they proposed slow walking it over the course of 75 years. My lawyer on that case, Aaron Siri, has managed to get some very, very high level vSafe data, but he hasn't been able to get the granular level data that's really necessary for looking at some of these side effects issues. So the federal government is literally keeping
the relevant data away from the American people. They're saying, okay, no, we're doing the work behind the scenes. We checked into this and everything's okay. Well, I think it would restore a lot of confidence if they actually made that data publicly available so independent researchers could verify what the FDA is currently saying. And the CDC and NIH also have financial conflicts of interest. I mentioned that 75% of the FDA's budget for reviewing drugs comes from pharmaceutical companies by way of user fees. Well, the CDC and NIH also found ways around federal restrictions on private funding and on philanthropic funding. They set up foundations. There's something called the CDC Foundation. There's something called the NIH Foundation. If you look at their board of directors, they're peopled largely by pharmaceutical company executives. And the money for those foundations comes largely from pharmaceutical companies directly, or from very large foundations like the Bill and Melinda Gates Foundation that also has investments in pharmaceutical companies and potential conflicts of interest there.
But Aaron, just a quick point. I'm sorry to interrupt, but you've made several good points. But I have an easier solution with regards to the public information is making that data publicly available. There's really no reason for them to censor that data.
100%.
Yeah, and Lisa, jump in as well, Lisa. I know you don't want to interrupt, but you wanted to make a response to one of the quick points that Aaron and Prodigal mentioned.
Just two quick things that because of the signals in the VAERS data, companies are doing research on myocarditis and stuff like that. One, and two, one of the reasons why funding comes from pharmaceutical companies to the FDA is it actually started back, like you said, in 1992, because of the HIV crisis. There was a real, lots and lots of people were dying, and there was a real push to try to get the federal regulatory system to evaluate drugs more quickly because people were dying. And so pharmaceutical companies helped pay for more people to work in FDA.
Yeah, but Lisa, to be fair, Pfizer and Moderna only decided to study the long-term effects of myocarditis in November, after they already rolled this out to tens of millions of children.
I understand. That's
a fact. That's what happened, right? Tens of millions of kids.
Prodigal. There we go. Let her respond, man. Let her respond. Go ahead, Lisa.
I'm not disputing the fact. I'm saying that you, once again, we had a lot of people dying, lots of concerns about the transmission of this, and then the signal has come up and they're investigating it. And I understand that people don't think that was quick enough. Like I said, we've got to have good data. So whose data are we going to trust? And how do we fund that is the actual question. Are you going to trust what kind Moderna and Pfizer, if they're studying this and they're paying for the studies? Are you going to trust their data, or do you expect taxpayers to pay for the studies? And will you trust the FDA? This goes back.
Two things. I have to jump in here. I have to. I've been very quiet this entire time, and I've disagreed respectfully, Liza, with a lot of what you've said today. And I know that, this is your background and this is what you do for a living. But I have to say, without transparency, no one's going to trust anything. That's number one. And number two, the first COVID was HIV. So I don't want to go down the road of what happened during the HIV era, because it's not a pretty story and just not enough people were awake to what was happening at that point in time. But literally, we're having a repeat on a much grander scale of the HIV era in this country with COVID. And a lot of the people you're talking about that died from the drugs that you're saying were used during that time and not HIV. That's just fact.
I was not saying about died from drugs. I was just talking about how funding got put towards the FDA. So I'm once again,
and trust.
Actually,
I don't have all the background on that.
So Tracy, would you say a good, I'm just listening to all this, trying to think, what's the solution? Because I think the solution will be pretty complex, because the issue is complex. But would you say, and you said it, transparency is the main issue. We don't know what we don't know, and we sit there speculating,
and then some of the things we speculate turn out to be true, and then we speculate some more because the facts turned out to be not true facts. So Tracy, would you agree transparency could probably be one of those core pillars? I'd say financial incentives are not aligned, and transparency.
And accountability.
Transparency, because release the data that everybody's looking for. Release it. And then if all these things are safe and effective and there's nothing to worry about, we'll all be like, oh gosh, we spent all this time so worried about something that there's nothing to worry about. But instead, we have to have doctors like Dr. Kheriaty going to court and suing the federal government in FOIA lawsuits, and them trying to tell us, no, we're not giving you this for 75 years. And God bless attorney Aaron Siri I can for this, because otherwise we wouldn't know half of what we know. So yes, release the data. Release it. The
Tracy,
American people are so good at reading studies at this point that they'll be able to decipher the data, I promise.
So,
you.
Mario,
Protocol, before you go, hold on, Sphinx. Yeah, Protocol. Before you go, Protocol, do you mind if I give Sphinx the mic and I'll give it back to you, Protocol? Yeah, go ahead, Sphinx. So I actually wrote down, before you go, Sphinx, I wrote them down, my key learning lessons, and for the audience, go in the comments, give us your what are you learning from this? My 3 core lessons are financial misincentives, transparency, misincentives, I don't know if that's even a word, transparency and accountability. So aligning incentives, increasing transparency, and accountability is a cliche, but we'll put it in there, would probably, I think those would kind of encompass most of the problems or solutions that we need. But go ahead, Sphinx.
Thank you. If I may, I just want to address what Prodigal, Tracy, and Eliza have brought up, and Aaron. An open peer review system based in decentralized science could have prevented a lot of the problems with the COVID vaccine, and much of the current distrust the public has of the medical community. It would have increased transparency, accountability, collaboration. When I hear medical professionals or anyone saying something to the effect of, don't knock vaccines because life in the medieval era was terrible, what I say to that is, why aren't you pushing for open peer review? One of the major problems with the current system is the lack of transparency. This was seen in the vaccine development process. For example, the public wasn't fully informed about the clinical trial data and how the vaccine was developed. This led to so much confusion and mistrust of the vaccine. Also, there were issues with the speed of vaccine development, with the distribution, and that was partly due to how centralized the nature of the current paradigm is. A decentralized open peer review system makes all the data, all the methods, all the results publicly available. Researchers would be able to be accountable for their work. They could be more easily vetted by experts in the field. Also, to Aaron's point, government help would help, but it's not necessary. So decentralized science can be implemented without government support. Researchers and institutions can also work together to establish these open science practices, share the data and their sources, their resources, even without government funding. So I just want to say to Liza, let's not say we need vaccines because medieval life was better. Let's talk about how to come up with systems that make transparency, what Tracy's saying, what Prodigal's saying, what Aaron's saying, make these things possible, because these are not fantasy. It is possible to have systems where the record is immutable. You can't go back and change the record to fix your hypothesis. These are important. Thank you so much.
And to your point, I agree with you that transparency is critically important, and Bayer has a transparency webpage for our products. So people can go to the data and look at it, because we believe that it's really, really critically important, because we understand that there's the trust is at zero.
Liza, I'm going to do something with you and Tracy. Liza, sorry, shit. I keep saying Liza. Yeah, go ahead, Sphinx.
Bayer, Liza, respectfully, Bayer does not participate in any sort of open peer review. Let me just say, there need to be incentives put in place where wrong results, failed projects are published. Why is this important? Because we are now only seeing what happens. Clinical trial after clinical trial fails. Then once one succeeds and we see the results, we need incentives for the scientists to say, hey, I want to post my failed results. Why? Because that encourages the right kind of innovation. And Liza, respectfully, Bayer is not participating in peer review, and Bayer is not participating in any kind of sort of review where the actual review process is open. So I don't know what you mean by transparency.
Liza, I'm going to go down another path before going to protocol. Tracy and Liza, I've got a question for you, Tracy, and then I've got a question for you, Liza. Question for you, Tracy, is what is your biggest compliment? Because there's no such thing as bad and good. So it's a tough question. What is your biggest compliment or praise you could give to those pharmaceutical companies? And then I'll go, Liza, you can answer first. Liza, what is your biggest critique of the pharmaceutical companies? Maybe you can go first, Liza, because I think yours will be easier than Tracy's.
Sure. I think that my biggest critique of industry in general is that we haven't been as transparent as we could be. And that has engendered a lot of distrust. And and as a matter of fact, we've been very open to taking the slings and arrows. If you think that there's not a lot of bad discussion about big pharma and big ag, you should come see my Twitter feed to see how many people throw things at me and try to defame me for what I know to be scientifically good data. So we've been too scared to stand up come up to the plate and defend ourselves. And often that's perceived as a lack of transparency.
And Tracy, the tough question of what would be your biggest praise before going to protocol, your biggest praise for the pharmaceutical companies? Like, I'll give you, like, for an example, an easy one, like you want to praise for the people that did try to speak up, or the people trying to do the hard work with the right intentions. They're pretty easy ones. Do you have any tough one you could give praise to? I know it's a tough question, Tracy.
It's a really tough question because, I have a sarcastic one that I could say, but I'll be genuine when I answer this question. I take a prescription every single day that is saving my life. I think that the pharmaceutical industry in general is replete with people that do really care about ingenuity and extending the lifespan of human beings. I think that regulatory comes in and government and greed comes in and ruins a lot of the really good work that brilliant scientists do. So the people that make up the pharmaceutical industry who have good hearts and are really doing this for mankind, that's a good part of the pharmaceutical industry. You can't crap all over science and think that,
I'll go to, you're cutting out, Tracy, because I know you're underway. Protocol, I'm going to ask you the same question because I know, and don't be facetious because I know you're really good at doing that. What would be one bit of praise you can give those pharmaceutical companies? I think Tracy did a really good one before she dropped out. What would be one you could do? Because you've been very, very critical and rightly so. But I want to give this a shot.
Yeah, listen, I think that they've made immense progress. I think the issues we see with pharmaceuticals is the issues we see with other industries. Their consolidation and lobbying power is so immense. Right, I don't like that Monsanto bought Bayer. I don't like that Novartis is buying out its competition. I think that the consolidation of power into a few players who can push narratives, et cetera, is a problem. There's no competition, right? This is crony capitalism. So I don't doubt any of the successes and models going forward. Not going forward in the past that led to improved health standards and care, et cetera. But when you look at the power that they wield, and the inability of the government to regulate them and their ability to basically fund FDA studies, it's a big problem. And, just off topic on this stuff, like even when we talk about transparency of data, I'd love Liza to reply since she's championed this. To me, it never made sense when we look at a lot of this data. How come when you're given the vaccine injection, within 2 weeks, you're not counted as vaccinated? In UK, I believe it's up to 21, 27 days. There was a German autopsy study that came out that showed out of 25 people who died, 20 of them, it was within a mean of 2.5 days after receiving their injection, right? Why are our facilities allowed to classify COVID deaths? Even, why is there no differentiation between correlation and causation? Well, this data has been meaningless. And I'll end with this. To see Leana Wen, Miss World Economic Forum herself, write a Washington Post op-ed piece saying that, yes, we're overcounting COVID deaths, when everybody who said this was silenced. And that, yes, there's instances where gunshot victims are being counted as COVID deaths, et cetera. And pointing to Massachusetts, as Aaron stated earlier, that's finally trying to delineate well, who tested positive for COVID and who's in the hospital for COVID? They found 90% of the people in the hospital were not there because of COVID. They just tested positive. So the entire apparatus of how this was set up was to push pandemic fear porn, push the vaccine, push the mandates, and whether it was for profit or control, it's unforgivable. Transparency is good, but I want accountability. Because there's a lot of people who went on TV and gave out bold-faced lies, and they're still skirting consumer fraud and marketing laws. There hasn't been one commercial from one of these vaccine producers on TV listing the side effects, yet they sponsor every goddamn program. I have my public officials and so-called health experts going saying take the vaccines, and they won't list the side effects we know of. May cause stroke, may cause blood clotting, may cause myocarditis. So to talk about this as if it was all done in goodwill and to make sure the population was fully informed without any accountability is just insane.
Liza?
Well, that's a lot.
This please meet Prodigal. He's a regular on the show.
Yeah. Once again, I understand.
Hold on. Someone's background noise. I think. Yeah. No, it's not. I don't know whose it is.
I got it.
Okay, go ahead, Liza.
Once again, I understand that people are very, very frustrated. I'm very, very frustrated with the House of Medicine and the state of politics around the world and everything that's in this discussion. And I think that the COVID pandemic brought out in clear relief what fissures there were along these lines. I personally think that the vaccines were beneficial for people, because I think that there was it was an unprecedented pandemic and lots of people were dying. So people who rose to the occasion to try to mitigate that effort are now being told, are now being completely mistrusted. And I get why. I get that the messaging, the rollout of the vaccines was the messaging around it has not been great. But I don't think that they were meant to cause harm. And to be honest with you, I think that there is not a lot of money in making vaccines. And vaccines are critical for public health. And so,
have you looked at their profits?
Hold on. So that's an important point, Liza. I don't usually interrupt. Aaron. So just briefly, before you go, Aaron,
I would like to respond to that. Mario, I also want to praise the vaccine companies, which might surprise. Or I want to praise pharma and answer your question.
Cool. I like
positive.
Before you go, Aaron. Yeah. So what we'll do? How to structure this? I would like you to respond, especially to the statement about the profitability of vaccines. I'm actually curious. Yeah. So Aaron and then Tracy could respond to this. Then obviously I just want to welcome Tom and give him an overview as well afterwards. But yeah, Aaron, if you can respond to that point, and then if you want to praise pharma, it'd be good for the audience that's listening, like don't hate whenever someone praises. It's just a good mental exercise to do. It's like, challenge beliefs that you have, and they could be even to an extreme level, because it's just a good exercise to do. And it's always a good reminder, there's no good and bad. There's more bad than good or more good than bad, but there's always good within the bad. I don't know if that makes sense, but go ahead, Aaron. I'll let you respond to the point about vaccine profitability.
So the COVID vaccines, the mRNA vaccines, in their first year were $100 billion industry, $100 billion. Why wasn't natural immunity recognized? Because even when the vaccines first started rolling out, half of Americans had already recovered from COVID infection. Take $100 billion and cut that number in half, because half of Americans now no longer need your product. That's a lot of money at stake. That's a lot of lobbying money. That's apparently a lot of money that you can pay to Twitter based on what we saw from today's Twitter files drop. That buys a lot of influence. So, and it's funny because my praise of Big Pharma is going to be maybe surprising to some of my listeners, that Big Pharma knows how to do clinical trials very, very well. They know how to do adequate safety studies. They know how to do adequate efficacy studies. But the problem with vaccines is that several years ago, the pharmaceutical companies, which I think is absolutely hilarious if you just look at the numbers, convinced the federal government that vaccines were insufficiently profitable to do any research and development on vaccines unless they were protected from all liability for the harms caused by vaccines. And the federal government said, okay, we will protect you from all liability from harms done to vaccines, which has distorted the entire field of vaccine research and approval, in my opinion. And the analogy that I use is car companies. Suppose the federal government told all the car companies, you're responsible for safety issues with your car. If you manufacture a car with a seatbelt malfunctions or a car that blows up when it gets into a fender bender, people can sue you because you didn't do the right safety testing to make sure that your car was up to safety standards. But we're going to carve out an exception for minivans. Minivans don't have to go through any safety testing. How many people would, first of all, buy minivans? And wouldn't people maybe reasonably be suspicious that maybe some of the automobile manufacturers, if it was profitable for them to do so, might cut some corners on safety testing? So I guarantee you that because Pfizer is responsible and liable for harms done by new medications, they never would have done a 3-month trial of a new medication that was going to be given to billions of people. They never would have done that because they're going to be holding the bag if this ends up being another Vioxx. Vioxx was a medication that they didn't pick up adequate cardiac safety signals when it went through clinical trials. People died of heart attacks at higher rates who took this. It was a pain medication, mostly for arthritis. And the pharma companies had to pay out a lot of money in damages for not picking up that safety signal. So my praise of Big Pharma is that they do know how to run clinical trials to assess safety. But in the case of vaccines, they're not really incentivized to do that. And that's a problem. That's a very serious structural problem. And it's not to claim that anyone working for Pfizer is evil and creating a product that they want to kill people. I think that's a straw man argument, Liza. I think that's entirely beside the point. The question is whether we are setting these companies up via adequate regulatory mechanisms to act in ways that are responsible in protecting the public. And when you indemnify these companies against all liability for just one kind of product that they produce, they're going to behave differently when it comes to the testing of that product. They're going to behave differently when it comes to the marketing of that product. And so the first step in all of this to regain trust in the vaccine approval process is make the companies liable for those products the same way they're liable for all of their other pharmaceutical products.
Mario,
Rob, I actually want to go to before everyone goes. Rob, you've been very quiet. It's first time on the panel. Are you there?
Yeah, I'm still here. I'm patient.
You're too nice. Yeah, you're too patient and too nice, man. You gotta either put your hand up or just jump in and interrupt. So what's your thoughts so far, especially on what Aaron just said, but more generally the discussion so far today? It's your first time on the panel, so we'd love your perspective on all this.
Yeah, so really, being on the panel was more so related to some of the IP properties of the vaccine and of the carrier mechanism. That's more so what my expertise is in.
Okay. So when about the IP, I don't know if you can answer this question. It's probably a highlight of the space, and the Twitter files drop earlier, is that we saw efforts by Bio to censor anyone that was requesting for the IP to become open for the public, especially with the funding they receive from governments. Can you comment on this? Like, what's your thoughts on this? Is it common? How serious of an issue is it? Do you think Twitter acted on these requests?
So I think that some of the IP related to the issue of this vaccine is more so actually in how this vaccine of mRNA is delivered to cells. So while there may be IP on the actual genetic material, I think that a lot of the arguments of IP are related to the lipid nanoparticle and particularly some of the components of it. So we've seen this in the news a lot about some of the different pharmaceutical companies arguing over which lipids were produced by certain methods, and then those lipids belong to that company. And I think the unfortunate thing about that is that it really does limit, not just for COVID, but for a lot of other vaccines that may be coming out in the future, on how this technology can be leveraged, because if they can't actually deliver it the way that they're trying to argue it, whether somebody wants to receive whether we want to have this vaccine be equitable for the entire world or any vaccine for that matter, then you need to be able to deliver it appropriately. And if there's IP levels in place there, then you're kind of defeating the point of having an equitable vaccine. So my take on the IP is more so related to the carrier and how it's delivered. And I think that there's some inherent challenges and problems associated with that unfortunately, don't make it to, they don't line up with this vision of having an equitable vaccine that's available for all.
Understood. I think someone was jumping in now.
I wanted to just, may I say, Mario, just wanted to say regarding the profitability of vaccines. So manufacturing vaccines can be profitable business, yes, for pharmaceutical companies, but that profitability really varies depending on a number of factors. The main one being the size of the market for the given vaccine, and vaccines that are in high demand, right, such as for those diseases that affect a large number of people, insert parentheses, mandated vaccines are considered, for public emergencies, can generate the kind of revenue that we saw for the COVID-19 vaccines in the billions of dollars. Just wanted to add that.
Okay. Tom, how are you?
Well, there's a lot. Sorry, I'm a little bit late in joining.
Did you read the drop?
I did. The problem for Big Pharma is they're their own worst enemy. They may make public policy arguments that are defensible and should be pursued, but then they play games like this and completely undermine the ability of those, more likely to kind of, understand that the pharmaceutical companies in the United States are able to accomplish much more here because of a light regulatory touch or a lighter regulatory touch and a strong protection for their intellectual property and their patents and such. Yeah, and rather than make that argument straight up, they just want to censor anyone who suggested otherwise. And then secondly, you have them, when you get into the censorship business, there's nothing too petty to censor. So I was a little disappointed in seemingly the ideological direction of the Twitter drop by the author, more interested in making some sort of smack at Big Pharma, as opposed to highlighting that Twitter was once again caught lying about why it was censoring people. They weren't censoring people because they had policies in place that people were violating, that they understood were violating, that the rules were clear cut. They were making it up as they go along, and they were responding to outside pressure, none of which was from the right. Just because it's from a corporate entity doesn't mean it's from the right.
This one is not from the right or the left. This is from corporate entities. So this is like,
right.
Tom, tell me if you agree on this point.
But that also mimicked government suppression as well. So it wasn't they weren't hearing anything.
So the way I summarize this, Tom, because you've been on with us on a few spaces about the Twitter files and helped us understand them. So the way I've summarized this is that the first bunch was, and I know the audience has heard this twice already, it's the third time I say it, but the first bunch was censorship based on perceived public good. So people thought that they're helping the U.S., mainly for the U.S., they're helping the U.S. and that's why they're censoring misinformation, disinformation. Second part was censorship based on political bias, which is, for the last few weeks, that's been the main focus. And now we saw censorship based on profit incentives for the first time. So I would say, would you say this is this is the first time in a while we see one that's not that doesn't have any politics involved, at least not yet, but profits, which could be even more concerning. What do you think?
Yeah, you have an attempt by the corporations to censor those who would undermine, their ability to conduct business. What's interesting, though, is that there's no evidence Twitter actually followed up on it and rejected it. Yeah. And the more concerning point is that regular commentary about public health policy was censored at the behest of fronts for Big Pharma or the CDC or even a less accountable organization, essentially the China Front World Health Organization. So that's kind of the basis for their censorship decisions. We're seeing that most directly in this later drop with this third party. But it's interesting how all these third parties are geared at attacking conservatives who are advocating for a different public policy. And that's, this is just more of the same in that regard. And it highlights that, for Twitter, there were special interests, none of which were of the conservative nature in any traditional sense of the word, that they allowed to come in and get folks' Twitter censored. And the concern I have is that it's continuing not only here on Twitter in some respects, but in certainly the other platforms, it hasn't been turned off at all.
Go ahead, Tracy, just jump in. No need to wait.
Thanks. I just wanted to say, I don't know, we talked about how great Pfizer is at running critical trials. Have you seen the lawsuit by the whistleblower from inside Pfizer about the clinical trials that they were running in the middle of the COVID, in prep for the COVID rollout? These trials were run absolutely terribly. They were run like a third grader would be running them, almost as though they didn't care, likely because there was no accountability or no liability on their part. And the other thing I just wanted to say quickly is, in terms of them not being a moneymaker, they are certainly a moneymaker when you're being guaranteed contracts by the government for millions and millions and millions of dollars, almost as though the government would be billions, right? Billions, I'm sorry. Almost as though the government would be doling out, Pell Grants and loans and student loans to college kids. So therefore, the college hikes up their costs because they're getting guaranteed money from the government. It's the same exact thing, and it happened all over the world. So lots of money involved.
And none of these concerns are new in terms of the studies and such we're seeing. I mean, they had tried this technology in another set of vaccines years ago. The animal studies were a disaster. They shut it down. They started it up again with the mRNA. Their studies, I don't think, would reassure anyone in terms of their scope and complexity and length. And they've started showing some consequences that the American people should have known about early on. And I think, one of the mistakes, this is the Fauci approach, which is no nuance. Everything must be this way because we know everything, as opposed to saying, we have this new vaccine and it's risky. So we're going to keep it limited for those who choose to those populations more susceptible to adverse COVID outcomes. Now, this vaccine may cause some problems, but we think the risk is worth the benefit. And here are the risks. Instead, we were told there were virtually no risks warranting pause in mass vaccination, no matter your age, no matter your risk profile. And as a result, we're where we are now, which is vaccines world without end in ways that are providing, that are causing additional problems well beyond just the initial risk with taking the vaccine with a seemingly more aggressive version of COVID early on. Now we have less aggressive versions of COVID, boosters that are raising a whole host of additional potential health impacts. When something is so bad like that, that's only the government. That's not Big Pharma. That's the government.
I've got another question for you, Tom, and I will pivot before going to protocol. It's a digression, but I'm curious. You don't have to answer this. Have you been vaccinated, and are you concerned?
Well, I'm not discussing whether I've been vaccinated or not, but my joking answer is I have plenty of spike proteins, thank you. No more necessary. And there could be, you could be 75 and still take the booster. That might be a reasonable response to the risk, even the ones we're seeing today, if you're concerned about COVID. The question is, are we given enough information to make an informed choice? And we haven't. And we're only now getting, Judicial Watch just obtained material showing that rodents were being born in the mRNA category with, a substantial risk, a seemingly higher risk of skeletal deformations. Now, of course, the vaccine companies, they say, well, that's not an issue. Others think it's a big issue. Well, either way, shouldn't we have been allowed to make a call there one way or another as a patient or doctors?
Eugene, you can go ahead, Tracy.
No, I'm curious how you can, Tom. I'm curious what you're using to say that there could still be some benefit for those over 75. Like, what makes you think that?
I think there's enough information out there that someone who has a severe risk from complications if they get COVID to take a chance on the booster. Would I do it? Probably not. But I'm younger. I don't have, seemingly some of the health risks that others might have. My point is, I'm not going to get in the way of people making a decision here. And the question, though, in the end, though, to your point, Tracy, is has the FDA done or engaged in the proper process to ensure that the drug is safe and effective so that anyone can make the choice? And I'm not confident that's happened. But, the fact that it's on the market, people have the choice right now to take it one way or another. But I'm just highlighting the fact that the process that it took to get to market was very much different than virtually any other medication, including prior vaccines.
Like, it's a personal choice, right? Actually, it's a personal choice for everyone to take the issue. As Tom highlights, is that the way it got to market was basically forced onto market. It was rushed out using Operation Warp Speed, it was under Fauci, right? And it was marketed as this miracle cure, this be all end all for the pandemic, that it would 100% protect you from COVID. That they talked about some side effects, but they just sort of glossed over it. But for the most part, they literally lied out there, and they said that it would 100% make you immune to the virus, and that is obviously not the case. That's not the case. I mean, if you want to take it now, if you want to take the booster, I think that's up to you. I think there's probably enough information for you to make a somewhat of an informed decision. The issue is that getting to where we are right now, none of it was done correctly, right? No other drug in history was pushed out like this.
Ian, are you more concerned, you've talked publicly about getting the vaccine from memory, correct me if I'm wrong. Are you more concerned now with the uncertainty that is starting to come
Absolutely.
up?
Absolutely. I would not get jabbed anymore. Like, I would not get a booster shot. If you forced me to get a booster shot right now,
do you regret? So if you went back in time, would you still take the vaccine, not the booster, the vaccine itself?
If I knew,
you have enough information where
if I had the knowledge I have now, no, I would not take it, because I don't think that the information that was put out there was legitimate. I think they lied to us, and it's quite clear that they lied to us. Albert Bourla, the guy who, is the CEO of Pfizer, goes on TV and says that it 100% protects you. And this is what a lot of people believed. I mean, it is like in any other circumstance, if a CEO of a medical company, a pharmaceutical company made that kind of claim, they could be sued for it. But now, there's no repercussions for this for whatever reason, right? He's protected, and all these people are protected despite all the lies they told us, despite all the lies that Fauci told us, and he willingly disclosed to the public that he had lied about herd immunity. At first he said 60%, then 70%, then 75%, then 80%. All that nudging, all those lies that they put out there. No, I cannot trust them anymore. So if I had the knowledge that I have right now of what they did in all of this time, and if I were to go back with that knowledge, I would say no, I would not take the vaccine. Absolutely not.
So, Eugene, to balance it out, what's your stance? Like, knowing what you know, would you have taken the vaccine? And having taken the vaccine, are you more concerned now than before? Not saying are you concerned, are you more concerned than before, even if slightly?
Yeah, thanks, Mario. So in my case, I took the Johnson & Johnson vaccine and then the Pfizer booster, and I don't regret that decision. I think the vaccines definitely have far more benefit than risks. And as with any kind of intervention we do in medicine, whether you take an aspirin, whether you take, a coronavirus vaccine or any other kind of drug or intervention, there's always some amount of risk. The question you need to ask, and the question that patients need to ask themselves, is, do the benefits outweigh the risks? And in the case of the vaccines, I do believe the benefits outweigh the risk, and that's backed by a lot of the high quality data and studies that I've seen. But I also just want to recenter the conversation and try to remove politics out of it as much as possible. I've heard tons and tons of chatter on social media and also here within this group about, Anthony Fauci and how a lot of the political shenanigans that he has done has created this situation. But I also want to remind people, on the right, that Donald Trump's Operation Warp Speed was the deregulation of the pharmaceutical companies that allowed a lot of these things to happen too, right? So it's not a right or left issue. I think both sides, contributed to how pharmaceutical companies can make tons of money from this. And even right now, we tend to think of the conservatives criticizing the pharmaceutical companies. But there's also plenty of liberals I've seen criticize Moderna in particular for wanting to charge $130 for a Moderna shot when it only costs, I think $2 or something to make. I think that's outrageous too. And I'm a liberal. I don't want the pharmaceutical companies to rip off the American people and rip off the taxpayers. I think that's something that all of us can be aligned with. So rather than viewing this whole discussion as a right versus left kind of thing, maybe it's like a we the American people against powerful interests kind of thing. And patients should always have their own informed consent about whether to take the vaccines or not. I don't believe in vaccine mandates. I don't believe in forcing people to take vaccines. And I also don't believe in forcing people not to take vaccines, right? Everybody should make an informed decision, informed choice for themselves, and they should have access to the best available information without censorship, without social media algorithm manipulations, and just have the right to make the best decision based on the best information.
Mario, if I can jump in, and if Eugene or Liza would like to answer this. I'm going to go back to the beginning of the pandemic. My issue is with this Frankenvirus is that the vaccine was never going to stop this, especially when it was non-sterilizing. All the data, all the scientific literature for decades showed you do not begin a mass vaccination campaign during an ongoing pandemic. And even if we vaccinated every human in the world, right, studies that were done on deer populations, et cetera, show that this virus was switching up to 40% of deer. How was the vaccine ever going to end this when 40% of the deer population in the U.S. had COVID? When this was going to apes, it was going to
cats
tigers,
and dogs,
it was going to felines, it was going to household pets. So they sold this on the basis that this would end the virus, this would protect everybody, and it flew in the face of what they already knew in regards to this Frankenvirus's ability to jump between species, etc. And they punished people. They tried to starve people into submission, and they basically ignored scientific data that had been built up for decades regarding leaky vaccines, non-sterilizing vaccines, whatever you want to call it. So I'm curious how you get past that in regards to how they sold it to the people that this would end the pandemic.
Yeah, so Eugene, do you want to respond to
this?
I can respond. I want to go to you, and then Liza, I'll go to you after Stella. I know Stella's been trying to come up for a while, so I'd love Stella's thoughts on all this. But go ahead, Eugene.
Yeah, so I think one legitimate criticism of the vaccines is in the beginning, we all hoped that it would prevent transmission of COVID. I think over time we've realized that that's not the case.
But Pfizer admitted they never studied it. So why was that belief even allowed, right? Pfizer came out later and said, hey, I never said it. It was only Rachel Maddow. It was Dr. Fauci. So how did this belief got blasted on all airwaves by public health experts and public officials?
I think there's two reasons. One is at the time when there was only the new variants haven't come out yet. There was, the data, the preliminary data, right, which wasn't perfect, showed that perhaps it could, prevent transmission of the earlier variants. But then new variants came out, and it made that very challenging for vaccines to prevent. And then two, I think there was a political element too, right? People wanted to believe that the vaccines would absolutely prevent transmission. We all hoped for that to happen. I personally hoped that vaccines would end the pandemic straight off, right? I think it's a legitimate hope to have, but that shouldn't be scientific evidence, right? Just because you believe and you hope something and you want it to be the case doesn't actually make it case in reality. You have to always look at the data. You have to continually monitor what the data is telling you, right? You have to divorce your narrative and what you want from what the world and reality tells you. And I think that's something we can all learn from with the coronavirus pandemic and how all of this occurred.
How are you giving informed consent to your patients with no real safety data to go on, given that they've all admitted that they haven't done the studies and we're basically in phase 3 of a trial right now, but on the wide swath of the population? Like, how do you sit with your patients and tell them true, real, informed consent when they're hiding the data from everybody?
Well, that's a good question, Tracy. And what I do personally, and what a lot of my colleagues do in the clinics, is we take a look at the best quality data that's out there. So there's large studies in New England Journal, in Lancet, and others. And then we go by the guidance by the CDC and the FDA. I know there's, a little bit of hesitancy and mistrust in those institutions, especially in the group here in this Twitter Spaces. But when it comes to standard of care as physicians, we can't just go by what we personally believe in or find some paper that, justifies our, personal narrative. We have to go by what the mainstream like medical communities and consensus of other physicians also believe in, so that patients get their standard of care. Otherwise, we would be sued for malpractice. We would get our licenses
Wait.
revoked.
So you're
right?
saying that if you didn't follow CDC guidelines, you'd be sued for malpractice?
If we didn't follow the standard of care, that is grounds for being sued for malpractice.
So basically, if you don't, okay, so that's false, and it's the antithesis of medicine. Otherwise, the CDC is your doctor, and I don't want the CDC to be my doctor. I want
to be fair, he is sort of correct in regard. I'm not arguing that what they said was right, but if industry standards and care said that this was that, and hypothetically, if the vaccine did work.
No. What about off-label medicine then? Still, Dr. Emanuel, you can speak. I'm not a physician, but people prescribe off-label medicine to their patients all the time. The CDC isn't directing them to do that.
Currently, the left is coming. They're coming after that too.
Let me say something. This is Dr. Stella Emanuel. I'm sure a lot of you knew me from my very public spat in 2020 about COVID having complete treatment. There's something that Eugene said that I would disagree with. Number one, before I say what I want to say. Number one, the COVID vaccine had nothing in. I'm a trained pediatrician before I worked in the emergency room for years, and I had given many vaccines. So I was not an anti-vaxxer. So most vaccines have like a long literature of side effects. The COVID vaccine had nothing. It was plain paper. There was nothing you could give the patient to get informed consent. That is one. Number two is the CDC when COVID started, there was no standard of care. It was a pandemic, and the CDC or anybody there was no standard of care that worked. And when you get a virus, let's say the flu, and you go to the hospital, we as physicians, like in the emergency room, we know how to treat viruses, like to give supportive care for viruses. Like we give you fluids if you're dehydrated, and we give you breathing treatments if you're having if you can't breathe, or we give you fever medicine, we give you steroids, maybe Decadron and maybe a Medro dose pack to help your body deal with the with what's going on. So we give you so we know how to even treat the blood clotting. We put you on baby aspirin or Plavix or whatever that will help you with blood clotting. So the standard of care for COVID was go home and take Tylenol till you can't breathe and you come back. And that has never been done in medicine, where they rejected treating patients on even just giving supportive care, which is what we've always done for viruses. So it was not done. So that's one. Number two, many of the journals, like the Lancet, the first study the Lancet did, they did a fake study that was done by some guys that were sitting in their basement to come against just regular treatment for COVID. And they used that it was all over the news. Number three, safe and effective. When they did trials on these vaccines, they knew it was not safe and effective. They knew it, and they told people anyway that it was safe and effective. Number four, they refuse, I think Tracy just said something about off-label medications. They refuse people from taking medicines that could treat COVID. I started out in March of 2020, and I was kind of pushed into it because I had a clinic here in Houston, and 15% of my patients were from China. And somehow I had to figure out how to take care of COVID. And then a pharmacy friend told me that they were using hydroxychloroquine in Europe. I went digging. I found a study that was done under Anthony Fauci in 2005. It was an in vitro study that said chloroquine was a potent inhibitor of SARS-CoV-1. And it had several things that made it work. Number one, it stopped viral uptake, it stopped viral replication, and it was an ionophore. It opened zinc channels. If you go on the NIH website and you search zinc and RNA viruses, there are studies on the NIH website that says zinc is a very potent inhibitor of viruses. The issue is that zinc cannot enter into the cell. Hydroxychloroquine, ivermectin, even quercetin opens zinc channels, works as an ionophore to allow this zinc to enter into the channels, which can kill most RNA viruses, whether it's flu, RSV, or whatever. These things were in the NIH website. We have over 300-400 studies that show that ivermectin and hydroxychloroquine works. Personally, my team, we've treated over 100 and something thousand patients. When I started seeing the first patients and I saw that this was working, why was it comfortable for me to do? I trained in Nigeria, in West Africa, where we use chloroquine, mefloquine, and all the quins. And it was very easy for me to start using hydroxychloroquine because those were medicines that I was used to. I went online in big doctor groups and told them, well, I'm taking care of patients. I'm using hydroxychloroquine and Z-Pak and everything, and it's working. And I got attacked. I got vilified. And I mean, in medicine, Dr. Eugene, in medicine, standard of care is not just about what CDC said, because CDC does not actually give us the standard of care. Standard of care comes from peer review. Standard of care comes from medicine has always been apprenticeship. Standard of care comes from other doctors doing studies, taking care of it and working, and then we tell other doctors. Medicine has always been like that. The CDC just takes studies, the NIH, FDA takes studies which doctors do and use it. And if we, something like COVID, till today, I say COVID is completely treatable and completely preventable. I've seen so many patients, 80-year-olds with diabetics and all kinds of stuff, and they've been treated. If for a minute I ever thought that maybe Anthony Fauci was right, maybe the Pfizer was right, maybe the government Operation Warp Speed was right, if for any reason I question myself, the fact that they were rejecting medication, simple medication as over the counter in many countries that could treat patients, totally took it off my mind. And Eugene, I know that we have doctors, I keep talking about, we as physicians, we spend most of our life trying to protect our license. And that's part of the problem in America. There's so much litigation that almost everything you do, you worry about, can I be sued? Can I be sued? But there are times when there has to come to time, us as physicians, to look at stuff like, what is our Hippocratic oath? What are you willing to give? When I got out of Houston and traveled to DC that fateful day on July 28th, I called my family. I said, I'm going to DC. I might not make it back. They might kill me. But I had gotten to a place where I saw patients getting well. Every time I heard one more person had died, it ripped through my soul. Even till today, COVID is completely treatable and completely preventable. So I got to a stage where I said, if I perish, I perish. And if more doctors were willing to stand for the community, stand for humanity, this will never have been done. And I don't blame the doctors, because there are several things that in our training.
Instead, I'll let you. I know you've made some great points. I'd love Eugene maybe to cover them, and then you can make more points just to kind of go back and forth.
Sure.
Yeah.
So Eugene, let's try to go through point by point to just keep it as an interesting debate on the various points made.
Yeah, thanks, Mario. So when it comes to interventions, I think Dr. Emanuel was mentioning that there are some like therapeutics like hydroxychloroquine or others that maybe she or other physicians were giving off label. That's also an intervention that can come with, risk versus benefit, right? So I guess I'm curious as to why people or physicians who are like very much fearful of the vaccines and believe that the risk of the vaccines outweigh the benefit, why there's this allure or drawing to other kind of therapeutics off label that also have risk, right? So that part has always been a little bit confusing to me. Why,
so maybe
ivermectin,
Stella, if you could, Stella, maybe that before you go. Yeah, go ahead, Stella. I'll let you respond to that particular point before Eugene goes to the next one.
Yeah, Eugene, hydroxychloroquine and ivermectin are very safe medications that have been around for over 65 years. In many countries, they're actually over the counter. The risk of hydroxychloroquine is safer than aspirin. These are medicines that are taken over the counter in all countries. And for example, in Africa, West Africa, COVID did not really get into West Africa because people get malaria and they get fever and they go over the counter and they buy some of the quinones and they take it. This medication is so safe. People that have lupus, they take hydroxychloroquine daily for years and years and years. Maybe after 5 years, they look at their eyes. But taking hydroxychloroquine for 5 days to treat COVID is almost no risk, I would say, compared to other medications that we take. Ivermectin is a dewormer. We take it all the time. So I'm just saying that these medications have been proven and tried for years, 65 years or more, and they have worked, and they have a very great safety protocol compared to a vaccine that they knew could harm people, and they lied to us.
Eugene? But yeah, I would love to respond to that. So in particular for hydroxychloroquine, right, one of the side effects of hydroxychloroquine is it could prolong the QT interval for the heart. If you prolong the QT interval to for some patients, they can go into, cardiac arrest, right? You could have torsades de Pointes, ventricular fibrillation. It could be deadly for them, right? I'm not saying that happens in all patients. I'm not even saying that it's not rare, right? So I mean, I'm saying it's likely rare, right? But it's a rare event that can happen, right? So what I'm saying is, for the vaccines, there are rare adverse effects that can happen: anaphylaxis, myocarditis. I'm not denying that, right? But why is it that there's no self-awareness that, okay, if you think that any rare event that happens with the vaccine, that's terrible and should be shut down, but then with hydroxychloroquine, any rare event, like, who cares? That's fine. It's safe and effective. So why is it okay to say?
So maybe I'll ask. If you put,
Doctor,
both. I'll let you answer it, Stella.
Hydroxychloroquine wasn't mandated. That's one reason.
No, but
let me answer that, Eugene.
Go ahead, Stella.
I want you to go online and Google medications that cause QT prolongation. You'll find out that most of the medications we take cause QT prolongation. QT prolongation, one, is a rare side effect. Number two, it can actually be treated with magnesium. And QT prolongation, I'm talking everything we take, even marijuana that is legalized to take over the counter can cause QT prolongation. So QT prolongation it's something that they picked up and they said that to scare people. Z-Pak, Zofran, Cipro, Bactrim, all cause QT prolongation. Do you tell your patients when you give them Bactrim that you can get QT prolongation and die? Pharmacists mention it to patients when they give medications that cause QT prolongation. So I just want you, because sometimes it's just good that we have information, and most of the time we hear what people say, especially in the medical community, and then we take it and we start speaking with that. Just go online and Google medications that cause QT prolongation. Everything we take causes QT prolongation.
So Eugene, I'll let you respond last time, and I'll let you respond to it, and then Eugene, after you respond, just move on to the second point, because there's so many points. I'm really interested to hear both sides of all these points.
Okay, perfect. So I agree with you, Stella, that there are many medications that can cause QT prolongation, and we always have to watch out for any medication adverse effect that can cause QT prolongation, right? So for patients in a hospital, I wouldn't give them an antipsychotic medication without checking what their EKG looks like before, and measuring their QT interval. And I do agree with you that while it may be rare, that was an example of one side effect of hydroxychloroquine to watch out for. And if you can say that hydroxychloroquine is safe and effective, then how is it any different than saying that vaccines are safe and effective? Right? Every intervention that we have has a risk of a side effect.
How many decades of data are there on hydroxychloroquine versus this vaccine?
I mean, that's a legitimate point. There's more years of data and study on hydroxychloroquine, but also how many years of data protocol was there that hydroxychloroquine is effective in defeating COVID?
No, I'm not arguing it's one way or the other. Okay. My only point was you're arguing about safety and efficacy. There's a reason it was on the miracle drug list for the UN and other organizations. You act like this was something new. It could cause major harm, etc.
No, you're putting words into my mouth, because I never said it's something new. Hydroxychloroquine has been used for a long time.
Well, your question said, what's the difference between the vaccine and a drug that's been prescribed to billions?
No, I'm saying what's the difference between saying the word safe and effective for hydroxychloroquine, which it can be. Hydroxychloroquine is safe and effective for many things, like, for treating lupus. That one is it's totally fine to use hydroxychloroquine for that, right?
Your vaccine was never safe and effective. It was not.
I just wanted to point out the difference in the same group that is, scared of vaccines is not scared of other interventions.
I'm not scared of.
I've had every vaccine other than the COVID vaccine. I've had my meningitis vaccine, hepatitis, everything. So the ability for people to still smear people who have legitimate concerns with the
No,
COVID vax as
it just seems kind of like
anti-vaxxers,
there's
is
two
insane
camps,
that you can
and
still say
May
that.
I say something?
and
It's
there's like
Sphinx. That's just
Sorry, go ahead, Sphinx.
Thank you. That's a bit disingenuous, Dr. B, because we have a medication here. You're saying you're comparing it to the vaccine. Well, the rate of those adverse effects matters. Okay, you're just comparing them like the rate of the adverse effects of hydrochloroquine and the vaccine are exactly the same. We don't have that data in front of us right now. So the fact that you're throwing that around, that's not genuine. We need to realize if the rate of the vaccine adverse effects is like 10 times higher, if it is, that's a difference. And also,
but it's not right?
one
So
second.
I agree with you that the rate matters.
Okay, but 1 second. One of the two was mandated. One of the two made people lose their jobs. One of the two made people unable to travel to funerals, to see dying family. One of the two wasn't hydrochloroquine, it was the vaccines. So the fact that the vaccine is getting more attention makes sense, because this can't go on. This can't happen again. It's just common sense.
So Eugene, I'll let you respond to Sphinx, and we can move on to the second point from what Stella mentioned, if you don't mind, Eugene.
Yeah. What I just wanted to point out was, I feel like it gets very political. There are two, opposing camps here. But when it comes to interventions, right? I think everyone should know there are always benefits and risks to any kind of intervention we do. There isn't one intervention better than another, right? Every patient needs to have an informed decision for what intervention to choose for themselves. But I just find it curious that for a lot of people who, are, opposing the vaccines, they're not opposing other interventions like hydroxychloroquine, like ivermectin, even though that they do have a risk as well.
If you started to mandate hydrochloroquine for people to go to school, for people to fly, for people,
I don't agree with the mandate.
I'm just saying,
right? So
if you did, you would
see
it. It's not made political by the people. It was made political a long time ago by the government. It's not being made political in this space.
Dr. Gu, it got pressed and pushed by government authorities, the vaccine, whether before it was mandated or not in certain areas. I mean, that's not really a good apples and oranges comparison. And there was backlash against hydroxychloroquine just because, and it was blocked. The political thing, merely because Donald Trump had promoted it. Now, I don't think you're giving a fair assessment. I understand your concern, and I appreciate it and respect it, but I don't think you're giving a fair comparison here that someone that wants hydroxychloroquine is being political, but someone that wants to promote the vaccine isn't. The whole thing was made political.
That's not what I'm saying, Jim. I'm just saying, like, maybe we can have a little bit of self-awareness or introspection on the sides where those who are very fearful of the vaccines are not fearful of hydroxychloroquine and ivermectin.
Eugene,
but they don't. Let me finish that up, because I don't think that there's any reason for them to be fearful of hydroxychloroquine in a major sense. Obviously, there are some people who can be harmed, and a doctor helping you understand that is very useful and helpful. But, people on lupus have exactly the same risk of side effects as people who took it if they didn't have lupus. Like, it's the same range of side effects. So what we're talking about is an already known, safe, and effective drug.
There's another issue here that needs to be pointed out in regards to these early treatments, which is why this kind of symmetry argument breaks down. Tara already pointed out the asymmetry of the mandates. And absolutely without a doubt, if people had been mandated to take any of the proposed repurposed drugs, whether hydroxy or ivermectin, and it was required of them, a lot of people would have pushed back. A lot of people might have said, hey, I have concerns about potential side effects. So the mandates was one form of asymmetry. But the other form of asymmetry was that people's access to these early treatments was blocked, which has never been done before in the history of American medicine, where off-label uses of certain medications were not permitted by hospitals, or in some cases you had physicians writing prescriptions and pharmacists who had no authority to do this, refusing to fulfill those prescriptions if the indication for hydroxy or ivermectin was COVID. So one of the reasons that all this controversy got stirred up about the early treatments is not how safe and effective they were, but the fact that there was evidence in favor of them, and I'm not going to get into the debates about safety and efficacy of those medications because that's beside the point. The point is people were not permitted to do things that is routine and standard and always has been in medicine. In this case, using an off-label medication. Second point in regards to all of this is that the reason that ivermectin, for example, was smeared, and it wasn't, Eugene, wasn't people raising their hand and saying, hey, what about QT prolongation? Maybe we could do screening EKGs before people get ivermectin. No, it was people saying this drug is a horse dewormer. It's a horse paste, implying that it's not a drug fit for human beings, whereas it's a drug that has probably saved more lives than almost any other drug on the market. The person who developed ivermectin won the Nobel Prize in Medicine for the discovery of this drug. It was on the WHO's list of essential medications, and yet people were told that it's a drug for other animals to take and not for human beings. So no one raised questions about, cardiotoxicity or whatever with hydroxy or ivermectin. What they said was, you're not allowed to have this, even if you want it. And one of the reasons for that is that under federal law, emergency use authorization can only be granted to a product if there are no other alternatives for treating the illness that product is indicated for. So if in 2020, the public health establishment would have admitted that these early treatments or some of these early treatments are safe and effective for use in COVID, then the legal justification for the emergency use authorization of the vaccines would have disappeared. And so if you want to talk about people getting political, there was political and legal motivation on the part of the people developing and pushing the vaccines as the only viable solution to the panic, to make to the pandemic, Freudian slip, to make sure that nothing else was used or nothing else that was used was acknowledged to be effective, because then they wouldn't have been able to push through the EUA, and the vaccines would have had to go through the full clinical trials protocol necessary for full authorization of other products. So, and that was a real big P political issue that I think needs to be stated clearly.
Eugene, before you reply, Tom, I'll give you the mic right after Eugene as well, because I know you've been waiting for a while. But Eugene, I'll allow you to reply. But even before that, Eugene, just got some good news. So we've been working hard to get some executives from Pfizer to join the space, just to be able to ask them questions, to have those discussions, civil discussions and debates. And we've had incredible progress, especially in the last few minutes. We got another person as well as replied very positively. So I'm really happy to mention this. I think it will make for a great space. And before Eugene replies as well. So that's the good news I wanted to share with everyone. And then the second piece of good news is not good news, but a reminder that there is a newsletter I forgot to mention that summarizes the spaces and mentions things that we don't get the chance to talk about. And that's pinned above and tweeted on my profile. So make sure you go there. Subscribe and get the updates there. But Eugene, I'll let you reply to the points Aaron made, and then we'll go
before
to Tom.
Eugene replies. I just want to thank Eugene for being here. I mean, it can be a bit of a struggle.
And outnumbered, Ian. He's outnumbered as well, because Lisa and Joanna were here, and I think it was, I forgot his name, Bernard or someone, but they're all gone. They said Mario had to jump off. I'm like, guys, no, stay. Eugene needs the backup. And Dr. Drew's in the audience watching. Dr. Drew always gives a shout out to Eugene when he's outnumbered, and Dr. he's in the audience right now saying, "Go Eugene, one against six."
I think honestly, though, it's also a testament to the people up here who don't disrespect Eugene for his difference of opinion, even 100%. As emotional as it can get at times. It's nice that we can have this open dialogue. So yeah, respect to you, Eugene, and everyone who comes with the information and facts and not other, outside of stuff.
I mean, I don't know if I.
And have you noticed as well? Have you Prodigal? Don't ruin it. Have you also, Tara? Have you also noticed that it's just getting, as we've been doing those spaces every week, just gets more and more civil in those discussions. Like when we first started, people were blocking and arguing, just really heated. But now all of them are civil discussions with people that strongly disagree and people that have blocked each other, but they're having great discussions on the panel. Ian and Eugene had each other blocked, I think. So yeah, it's just been progressing really well.
Let me just say, really quick, in Mario's defense as a host and co-host, and I'm sure Ian gets this too, people will sit and DM you and message you and say, don't allow so-and-so to speak. But that's the beautiful thing that Mario does do, is he gives everyone an opportunity, or tries to anyway. It's not always easy when you have 10,000 plus people in a space. So thank you for that, Mario. And thank you for pushing through, even though you do get, people telling you who you should and shouldn't allow to speak. You always tend to open up the space to everyone and all points of view and perspective. So yeah. I appreciate that.
I've had people that blocked me on the stage many times. But yeah, Eugene, sorry, I don't want to move away from the points. Thanks, Tara, for that reminder. Go ahead, man. And then we'll go to Tom.
Thanks so much. I just want, in the spirit of being civil, I just want to actually praise Aaron for the way that you kind of constructed your argument. I think it's, pretty compelling. And the one thing that I would agree with you, Aaron, is how the media and society treated ivermectin. I think I saw on CNN that they were calling it a horse dewormer, and it was very derogatory. When, ivermectin has been used in many third world countries to treat parasite infections, or lymphatic filariasis, river blindness, I think strongyloides as well. There's many kinds of parasitic infections that ivermectin has been crucial to fight in many third world countries. And just like for CNN to say, hey, it's just a horse dewormer, completely ignore that. I thought that was not a very strong argument for them to do.
But why did they make that argument, Eugene, in your opinion?
That's a great question. And I think maybe some of the elements, I don't agree with everything that Aaron said, but some of the things that he said was compelling to me. One, in that there was this need to get this emergency use authorization for the vaccines, and to not have the public distracted with other kinds of things, and maybe just focus solely on the vaccines. I don't know if that's true or not, but it's plausible, right? And that's why we have to debate, how did that come to be?
Eugene, let me ask a question.
Sure.
This Dr. Emmanuel, we are in a country where anybody can use any medication that they want to use. It's called, you have the right to choose. You have the right to try a cancer medication that has all kinds of side effects, and you have the right to. People were in the hospitals crying and begging for ivermectin and hydroxychloroquine, and the hospitals refused to give them. Pharmacies blocked our prescriptions. I have over 30 board reports. Thank God that I live in Texas, that if not, maybe I would have lost my license. I have over 30 board reports. People calling the boards on me because I chose to take care of patients and use the medication. Use a medication that is been around forever. So my question to you is that, why did they vilify me? Why did pharmacists do this whole thing that has never been done in medicine? Why did hospitals allow patients to die crying for ivermectin? People had to go to the length of getting lawyers to sign a document for doctors to be allowed to give this medicine. My question is, why were people refused other options and now forced to take the vaccine? It's something you have to ask yourself as a physician.
Well, I mean, I think if a patient wants something and they've been informed and they know the risks and the benefits, patients should be in control of their own care, not the hospital, not politicians. And I don't know what to say for your experience, Dr. Emmanuel, but patients should be in control of their care, right? And they should, if a patient wants to have whichever kind of intervention they want, and they've been informed of the risks and the benefits, and they still choose to move forward with that, I think that's the patient's choice.
But they were not. So that's why I'm asking you. Why do you think they were not? Because you have to ask this question for you to see the whole picture of what happened to us and to humanity. Patients were not given this right.
I think it's because the pandemic, especially in the very beginning, was almost like a war-like environment. When you have the war on terror or World War II or whatever happened in World War II, we interned a bunch of Japanese Americans, right? Like, I think anytime there's a war, there's always going to be an assault on civil liberties, and that's not right. It doesn't make it right. But the coronavirus pandemic was kind of like a war, It wasn't a war where we fought with an enemy country, but the same amount of fear was involved, and it changed our lives very much.
Okay, Tom, sorry.
You know, the politics of this is what's ruined medicine in this regard. I mean, this was not a debate that the debate we're having today was not allowed. I mean, in fact, we see from the Twitter files, we know the reason it wasn't allowed because, you know, as Eugene highlighted, that there was this desperate effort to keep vaccine participation rates high. And when there were stories that came out that showed that they were withholding information from the American people that they had a right to under law and morally and civilly, they decided to withhold the information in order to achieve the result of maintaining high levels of vaccine participation and not giving grist to those concerned about it. And what was the response we see in the Twitter files today? Big Pharma, it's cut out, tried to censor that story or highlighting the fact that happened. I mean, the absurdity of it is just tremendous in that regard, in terms of the kind of the Alice in Wonderland rabbit hole we were thrown into. And I would also highlight it was the intellectual dishonesty of the public health establishment and their cutouts in discussing these that I think caused smart people and people with their radar on to say, what's going on here? You know, I remember when Fauci and company first said, well, you don't need to wear masks. My first instinct as a government watchdog and someone who's skeptical was, oh, I think masks might be a good idea because they're telling us we shouldn't wear it. So there must be something they don't want us to know. And then, of course, they reverted to, oh, masks are necessary and mandated. So my government watchdog ears go up and get pricked up and say, oh, well, that must be false as well. But secondly, though, they also engaged in imposing and pushing non-pharmacological interventions that had no standard by which to measure their safety and efficacy. Interventions that had never happened before in the history of humanity, mass shutdowns of businesses and schools, interventions with requiring masks in all places outside the home. Arguably, they wanted you to wear it in the home. The social distancing and the other techniques to maintain, to control the spread of the virus. There was no evidence any of that worked. And, you know, we were in many ways subjected to an experiment, a mass experiment. Our children were as well, without any informed consent or any consent at all. And at the same time, they were suppressing information about a medication that not only deprived the ability of people suffering from COVID, perhaps, to help themselves, but other folks who needed the medication for other purposes. One of the reasons I would post repeatedly on Twitter, hydroxychloroquine is a safe drug, other than to make a point that was true, was because there were reports that people who needed it for the traditional purposes were unable to get it because of the totalitarian approach the public health establishment and their hangers-on had pushed. And sure enough, what happened? They told me to take the tweet down eventually, and I was locked out of Twitter for 10 months. So I forgive us for being skeptical that there's been a fair airing of the doubts and efficacy and safety debates here. It was suppression. And when you suppress, we should all presume there's some misconduct behind the suppression.
I want to go to Dr. Dinesh, if you don't mind. I know, Justin, I saw you on mute. I want to go to Dr. Dinesh. Dr. Dinesh, did you hear the debate between Stella and Eugene earlier about the discussion between off-label medicine and the vaccine and the risk-reward ratio of both? Did you hear that discussion?
No, I did not hear the discussion.
Okay, maybe I'd love your take on it. So maybe Stella or Eugene, do you want to ask that same question to Dr. Dinesh to get his take on it?
Yeah,
go ahead, Stella.
Yeah, my question is hydroxychloroquine and ivermectin. I'm talking about we've taken care of over 120,000 patients with hydroxychloroquine and ivermectin. It did very well. But in the beginning, when I started taking care of patients and I started reporting hydroxychloroquine and ivermectin was working, these are off-label medications. Almost 80% or more, or maybe of the medicines we use on a daily basis are used off-label. I was vilified, I was blocked, and I was cancelled, and pharmacies blocked using the medication. We'll call in medicines, they will cancel them. We had board reports. I had probably over 30 board reports that I had to hire attorneys to fight just because I said hydroxychloroquine and ivermectin is an option and it works and people should be allowed to use it. And it was crazy. And then if hydroxychloroquine and ivermectin, they are medicines that have been around for years and years, we know their safety profile. But the vaccine, which was, they say, safe and effective, is something we don't know. So why did that happen?
So yeah, and Dr. Dinesh, can I give you the take? So why was off-label medicine vilified to that extent? And then Eugene's question was like, why are we treating off-label medicine as a safer alternative to vaccines? Like Protocol made the point that we've got a lot more research around. Right. Go ahead.
I just wanted to pose an exercise question, for people in both political camps or both sides of it is. For those who are fearful of the vaccines, why would they not fearful of other interventions like hydroxychloroquine and ivermectin, right? Just as a thought exercise.
Yeah, exactly. So that's a better way to put it. Like fearful of the vaccines, but not fearful of the. So it's two great questions
answer you
there
right away on that
for you, Dr. Dinesh.
The vaccine isn't an intervention. Is the vaccine an intervention?
So, Dr.
if you're sick, you don't take the vaccine, do you?
So again, I think. Technically vaccine is considered an intervention, but I understand your point, which is a patient's not sick when they take the vaccine. And that's a fair point. I think ultimately we can't vilify off-label use. There's a lot of medications that we use all the time off-label. Eugene, you know this. We do this all the time. It
was not meant to vilify. It was more like the thought exercise about.
I think it's a juxtaposition for sure. Like to say, look, we know, and again, this is for some reason this has become very politically charged, but ultimately, and the other day I was going to say the same thing, but we didn't get to it. I think we had to close the room at the time. But ultimately, like everything else, there is a right intervention for the right person at the right time, right? So if you are an immunocompromised patient that is super high risk, right, and if you do catch COVID, you could be incredibly sick. Well, for that person, maybe, education of a right fitting mask, an N95 mask, and getting vaccinated makes complete sense. So, trying to act like everybody's really healthy. And, I heard some comments in the space about, hey, we've got these very, like 0.09%. It's like, okay, sure, on a population level, but on an individual level, sitting down and having informed consent is a fair point. If you're young and you're healthy, yeah, sure, we shouldn't be pushing anything on anybody. It's about having a conversation. Going back to what Stella was saying, though, about off-label use, I agree, that ultimately off-label use should be allowed. I think we also need to have a conversation around why are we talking about specific medicines like hydroxychloroquine and ivermectin when there were actually other early intervention medicine that now we have data. We've done there's trials out of Brazil. Last time I thought, that we know that trial, randomized controlled double-blinded trial out of Brazil, was not supported by any specific government organization. It was an independent study that was done that compared ivermectin, hydroxychloroquine, fluvoxamine, and metformin. If people remember that study, it was a very, very well-conducted study. That was, again, none of those are expensive, just an FYI. All of those are super cheap, right? And all of those are, and now we know steroids. Steroids are super cheap. There's other medications that have proven out to be better in terms of outcomes in multiple study after study. Metformin and fluvoxamine have outperformed both ivermectin and hydroxychloroquine, but there's this zeal. It's like, no, we believe in this one thing, so we've got to focus on this one thing. As far as the general thing of a doctor sitting down with their patient and, she tells her patient, hey, I think this medication makes sense for you. And if that patient takes that medication, that's between them and their doctor. The government should not be in the room. I think that's completely ridiculous. And I agree with Stella on that. But I think we also have to have a conversation and say, Stella, I know you believe in hydroxychloroquine and ivermectin, but there's been multiple studies done now that show clearly that there are better early intervention treatment. Steroids, metformin, fluvoxamine, tons of data around it. We should be focused on that.
Actually, we do use steroids. We use budesonide. We use fluvoxamine. We use hydroxychloroquine and ivermectin. I just mentioned those two because that is what was vilified in the news. I mean, budesonide is amazing. In fact,
budesonide also has incredible data. Mm-hmm. You're absolutely right.
Yes.
That's correct.
Mm-hmm. So
I'll say if I could just highlight, one of the big issues out here is the unnatural nature, in my view, of the COVID infection and the refusal of our government and our medical establishment to grapple with its origins, which, of course, would not only help with treatment and prevention, but also future viruses of similar nature and, similarly dangerous viruses in the future. And, that's kind of like the whistling past the graveyard thing where, we start at third base and we pretend, that what happened to get us there has no interest. And how the virus entered into the human population has been one of the dirty little secrets that we're not allowed to talk about in any significant way because of the political ramifications. Not because of China, but because it's likely it resulted and can be credibly tied to the type of research that our government was happily funding and arguably still is funding under the Fauci regime.
If you don't think, Tom, that doctors in every corner and publicly are speaking against gain of function research, I don't know where you're at, man. Because we're doing it on a daily basis. If you don't think doctors are saying, hey, we need to figure out what BLS protocols are being used in these labs, I think the general consensus amongst physicians across the country, and I can't speak for all of them, but the general consensus is that there was something that occurred there. Now, there's different levels of nefarious intent, right? One is just incompetence and negligence, which is it was a lab leak. I think there's a lot of data pointing towards that. The other is, hey, it was engineered in the lab. Some of the research around Peter Danzig and the DARPA submission kind of makes us really concerned around the fact that there was, specific lab engineering. And then there's another level, which is it was a bioweapon. And I don't think that currently the consensus is that it was a bioweapon, but we don't know. And so I think you're right that doctors and the public, the medical establishment is a very broad term, right? Who do you think? Do you think the average doctor should be stopping taking care of patients and stop?
No. And it's a fair, it clearly, if I wasn't clear, let me be clear. I'm talking about the decision makers in public health policy and those gatekeepers for discussions of these issues at the study level and at the public discussion level. And I don't think there's been adequate attention paid and appropriate focus given the crisis nature of what happened here.
And what I think was really scary too is why was the lab leak theory, I guess portrayed as a conspiracy theory, and then it turns out that it may or may not be plausible, right? And then I think it was censored by Twitter. They were labeling it as misinformation and then taking it off. That's pretty scary to me as just a regular American citizen. Why is it that certain theories can be labeled totally wrong, conspiracy theory, and then later on it's revealed that it may or may not be correct? Then who am I to trust, right? I think the same thing happened with Hunter Biden's laptop and other things. I'm a liberal, so I don't know why. Even as a liberal, I don't want things to be mislabeled as conspiracy theories and misinformation, and then later, a year later down the road, it turns out that it may be correct, because then I don't know what to do or what to believe.
Because one of the hardest things as a doctor, I've got to say, is that I had posted a tweet about this for a very, very long time. Doctors were saying, hey, for your mood and disposition, right, smoking cigarettes can really help. I don't know if you guys knew that, but that was a very common sentiment. And if somebody spoke up against it, there's actually a really good episode of Cosmos, I know, super random, but they kind of went into this doctor that had found specific early data around the carcinogenic nature of smoking and how the entire establishment came against them and censored them. And I think that what we don't realize is not everything has to be like that. But if you don't set up the system to reduce censorship and to reduce this ability for any doctor to raise their hand and say, hey, this is not right, right? It's okay. I don't agree that nobody should get the vaccine. That's ridiculous. I think some people should get the vaccine. Other people should make their own decisions. If you're a young male that's within that age group that's high risk and you're healthy, and maybe you've had COVID already, maybe that's your personal decision. It's a completely personal decision. But to completely vilify on the other end, like the other night, I can't remember who said it, but someone was like, you should be worried if you've gotten the vaccine that 20 years later, there could be a problem. You should be worried if you got COVID. We don't know what the long-term effects of that are. We actually know that there was all inside your body, whereas the vaccine is limited to one part of your body. So what I'm saying is, there's all of this conversation around censorship. I think censorship and mandates are wrong. And I think doctors need to say that out loud and very clearly. Censorship and censorship is both soft censorship, which what these files showed, which is, shadow banning and all this other stuff. It's part of the same.
I think that's right.
And let's not forget that the doctors, Mario, I think Eugene, frankly, is being disingenuous.
Justin, go ahead after Tom. Go ahead, Tom.
When he suggests that, why was this, why wasn't there any concern here or suggesting that this debate was normalized. If you were supporting the use of hydroxychloroquine as an option, you had folks like, Dr. Gu highlight, basically trying to destroy your medical practice and delicense you. Pfizer, yep. We knew, Judicial Watch found out. We remember that Project Veritas had some tapes showing that you had internal Pfizer people highlighting the value of antibodies and combating this, the natural antibodies. And what did Pfizer do? The documents show they suggest they were going and running to the FBI and trying to target Project Veritas for daring to disclose that type of journalism. So when people were facing the loss of their livelihoods for promoting these drugs in good faith, or facing jail for taking on these companies, forgive us for being a bit sensitive when we say, there's no there in terms of why was this debate so heated in the past. They were trying to jail and destroy the lives of people who objected.
I spoke out against the benefits versus the risks of hydroxychloroquine, but never tried to get doctors' licenses removed or ruin their careers for that.
You didn't think they should have their medical licenses revoked?
I never punishing physicians or anything like that. All I advocated was just educating the public about. I believe that the benefits don't outweigh the risk for hydroxychloroquine when it came to COVID, and that was my opinion as a physician.
Actually, Eugene, I think you should go and do a little more study on this, because just go read. Just go read. Go read on that, please.
Stella, I'll just let Justin. I know he's been waiting for a while. Justin, go ahead. Then we'll let.
I think the time factor is something that we have to consider here. You talk about this hypothetical, Eugene. I think it's a valid hypothetical, but so is the hypothetical I would hear in and out here in California when people would say, "Well, why do you oppose the COVID vaccine as one of the scheduled vaccines into the school schedule? Your kids are already mandated to do that." And what we would reply is, yeah. Every single vaccine on the school schedule for California and nearly every state across the country had been in an EUA status and then an approved status and in an actual circulation status for a decade and a half before it was ever considered to put onto the schedule. Here we were considering, and schools did it across the country, mandated this vaccine that was out for a year, had only been in human trials since about 2015, had been out of EU, it wasn't even out of EUA status. And I think that's kind of the factor there. And if I bring it back to the files today, I think all of this comes down to a key point in this pandemic, and that was Omicron. Omicron at the end of 2021 was everywhere. And if you look at the thread today, there were several instances there right around February, right around January, right around November of 21, and then January, February into the next year, where you had the Pfizer kind of really anxious about the narrative that was going around, because every single business, every school, every big city was performing these PCR tests massively. We're performing more single week tests to find COVID in a week than we would for an entire year of influenza. And Sunetra Gupta was right. The Rona is a slippery virus, which is why we've never attempted to produce a vaccine for it. And when you look at, the case rate, if you Google United States COVID cases over time, right, and you see this massive wave that's 5 times higher than anything we saw during the Omicron sector, straddling 2021 and 2022, you realize something was completely out of sorts. All of a sudden, Fauci and Walensky had to completely backtrack. Fauci admitted that most of the infections for children that were in the hospital with Omicron were incidental infections. They were there for something else. Walensky had to finally admit something we've been saying for a year, that the PCR tests were very sensitive and could pick up a virus at 5 days or 75 days. That was her exact quote. And then we were able to FOIA, for example, New York State, because what was happening, remember that Christmas message, that terrible Christmas message that the Biden administration put out that said, hey, to the vaccinated, peace on earth and goodwill towards men, and to the unvaccinated, stop breathing my air, you virus-filled meatbag, you're making me sick. And that was like almost verbatim what they said in this message there. You're going to die is what they said. And that wasn't the case. And they said, they used this terrible, terrible stat. They said, you are 97 times more likely to die if you are unvaccinated than vaccinated. And we said, those numbers are completely off. We FOIA'd New York City and New York State for all the data they had on this information, okay? And we came back and we said, maybe for elderly populations, we see a 2x benefit, maybe. 1.5 to 2.5 is the range that we got, because they were using old population numbers. And then what you would find is that people would come into the hospital. They had gotten their vaccination from a system that wasn't accepted in that hospital. They had to go look it up. And so they were put into the system as unvaccinated. And so if you recall in the Twitter files today, it was number 12 when what's his name, when Fang was going in there, and he mentioned, for example, that Pfizer had sent this email to Twitter, and it was February 24th. And they said, there's this New York Times article, and we're really concerned about this New York Times article. And they said explicitly, there's nothing wrong in it, but we're really concerned because, it really makes us look bad. And the history of that was that on February 22nd, the New York Times, Apurva, who is kind of their headline reporter there, and she's not the best reporter there at New York Times for this stuff, but she went through and found some very revealing data. You had the spokesperson of the CDC, because there was major clamor to get the data from the CDC on vaccination data. They had it. They didn't share it. And so they were showing these rates, and we're like, well, show us the numbers behind the rates. We called it denominator gate because they got the denominators all wrong, and they wouldn't share the data. The New York Times even had to admit they were hiding the data. And that's when Pfizer sent that email in and said, Twitter, we want you to be apprised of this. We want you to take down these accounts. I don't know who those were. It may have been some people on my team that are saying that, the CDC is hiding data, because they were. And they admitted that it was true. And so, I think what we're finding is that was a critical point in the pandemic when, the narrative was slowly crackling away through the fingers of Dr. Fauci. But by Omicron, it was gone, because everyone knew that the vaccine was not going to protect them. Remember, just a year previously, Dr. Fauci and his group, Slavit, the rest of the crew said it is 100% effective. This is a direct quote. It's 100% effective against hospitalization and death. And then they were saying that all the way through July. But by the time the summer was over, you realized, it's not working. You can blame it on variants all you want, but there was no data in the trials to support this. They completely overplayed their hands, as a Walensky leader admitted. So crazy stuff. But I think we need to recognize that Omicron was the turning point and hinges on this whole thing. People got frantic because the narrative was destroyed. The vaccine didn't work as they promised.
CDC, before Eugene replies, CDC was hiding information. Which information exactly are you referring to?
They were hiding the detailed vaccination data. They have the vaccination totals. They still won't release it, right? We have, for example, they know because we have the case surveillance file, which is 10 gigabytes. In fact, I think they're coming up with a new update in a day. I'm going to pull it down. But nowhere there do they allow each case to be specified vaccinated, unvaccinated. It's there. They won't share the data. The only thing they share is the rates. They say, "Oh, look at these rates. If these rates go up, these vaccinated people are far safer than the unvaccinated people." But they won't share the bottom line denominator. We called for it a year ago now, and they still won't release all the data on that piece. And it's
Eugene,
it's
can you comment on what
Justin?
Can you comment on what Eugene said, what Justin said, especially the data?
Yeah,
where's Eugene?
I can comment on principle. I need to know more about the facts situation, but I don't think it's right for anyone to withhold data. So if Pfizer was withholding data, that's wrong. Especially if they're taxpayer funded in acquiring that data and doing the studies. The data should always be made available to the public, especially when it concerns them. So I also need to look into it more and see what data was withheld. But if data was withheld, that's wrong, and I'm not going to support
that. This is brought to my attention, and it jogged my memory, and I think Jim might be able to speak on this one a bit more than I can. But California passed a law that says that the state can revoke the license to practice medicine if they go against any narrative or directive of a health official. So, Jim, you want to weigh in on that one?
Yeah, they actually did, and I'll bet Justin has good information on this too. But they definitely did pass a law that told people if they give advice against the vaccine of any sort, they can lose their license to practice. We've talked about it a little bit on the space before, but I think you've been tracking it too, Justin, haven't you?
Yeah, 1486, this bill that went through Congress. There were 12 bills that were put through by by State Senator Dan Pan, I think, Dr. Pan, excuse me. And he was term limited out, so he was kind of throwing everything to the wind. And it included everything from reducing the age of consent for a vaccine from 18 to 12 or 16 to 12. It included everything. And this was one of the only bills that he got through, which was a bill that basically says that if you are a practitioner here in California and you give out misinformation, you can lose your license. What's funny is in the bill it specifies, for example, an example that if you give out information that an unvaccinated person is anything other than 11 times more likely to die, then that's an example of misinformation, which was completely false information even when they published it. So they're giving out misinformation in the actual bill. And so that's law now. That went into law just a few days ago. And I think there's going to be some major challenges. Aaron probably knows of some of those challenges that are coming up, but lawsuits will definitely be formed around that because it's basically a gag rule for physicians. I know in my own experience, I had young children who were in preschool, tried to get, for example, a mask exemption for them. They had anxiety around it and everything else. I'd had anxiety for them wearing it, knowing the details of the masks there. And so I tried to get a physician to prove that. And she was scared to death. She didn't want to do it. She couldn't do it. She couldn't bring herself to do that. My group was actually one of the only groups that actually went out to mothers. We took, 12 masks from these mothers' children, and we sent it to a lab in the University of Florida, legit lab, who tested it against the mask and against their shirts and everything else there. They found everything from Lyme disease to what was the other one? Oh, cow herpes. They had cow herpes on it. These masks were gross. I can't believe we could force those on kids.
Okay, so I wanted to weigh in on this, Mario. So
go ahead.
The California law is specifically around not people's opinions in general. It's specifically around as it pertains to a doctor-patient relationship. And like I said earlier, I think it's unreasonable for the government to be in the room with the doctor, the patient. But at the same time, I just want to be thoughtful about what they're really discussing, which is the way that they define misinformation in this bill is false information that's contradicted by contemporary scientific consensus. Right. And so
consensus. Right.
So again, I think it's
consensus that time, for example, was that masks work and that the vaccines were completely effective. I mean, it's nonsense.
Work.
It's nonsense.
There's
evidence. What is the RCT study that you can cite that a mask works?
Happy to
we'll take it offline.
We've talked about this multiple times.
Okay.
We've talked about this multiple times. They are efficacious, but not effective. I think that's the point, which is when fitted correctly, using the correct mask, with a patient that is fitted correctly with it, it works incredibly well. We use it.
So just like hydroxychloroquine in the lab is effective, but not in real life, masks are effective on mannequins, but not in real life. Okay.
That's actually not true at all. I've worn masks, walked into a room with a patient that had a very deadly respiratory disease, and I did not catch it with an N95 mask that was
you got a study on that? Did they do it?
So Justin, your take. Justin, so your take. No. This particular point before you move on, Dr.
Can I just talk about masks for a second?
Yeah, go ahead. I'll ask before you go, Ian. Just one question, Justin. So, and before you go, Stella, because everyone is unmuting. Justin, so you don't, if masks were worn properly, you don't think they work? Just want to understand your stance.
No, the RCT study that just came out, it did a study against N95s. It's the true gold standard. It's an RCT study, looked at N95s against regular medical masks that we were wearing for 2 years. It found no efficacious ability for limiting viral diseases within a hospital setting. So even N95s within that setting. But no, I mean, like, for example, it looks like you're clean shaven, Doc. If you have a beard, you can't wear an N95. And just to be clear, there is no OSHA approved N95 mask for children at all. In fact, that's one of the signs they say that you're dealing with a fraudulent mask if they're marketing it for children. So anyone who's putting an N95 on a kid, there is no basis, in fact, and no approved N95.
And the sizes are all fucked up.
And
I was just saying the size is all fucked up. So the issue with N95 masks, and I was a huge mask proponent early on, and when I say mask proponent, I'm not talking, I wasn't imagining that they would make people wear these, these paper masks, these surgical masks, the ones that everybody wears nowadays, right? I know, I was talking about like the real deal, wear a respirator, like an actual big fucking respirator with oxygen, either a tiny oxygen supply or with like N95 or P100 particulate filters on it. You know the kind, right? Like the kind that you can literally walk into a room that's filled with Clorox bleach and not smell any of it, and you'd be fine, right? Like the kind that would stop mustard gas, right? Wear those masks. They actually do work. The issue with, masking up and all these mask mandates is that they're telling people to wear any mask, and they're not telling you what kind of mask. And also, even if you wear an N95 mask, even if it did work, people don't know how to wear them properly. People always touch their faces. So you're always, your hands are touching your eyes, you're touching your ears.
And that's the point that I was
worthless,
making.
right? You want to wear an N95.
Here's a funny headline.
But that can be fixed with education. It can be we do it again. That study that you're referring to in the Annals of Internal Medicine again was looking at effectiveness. And I understand your point about a mannequin, but there's also a lot of healthcare professionals.
I'm looking for the RCT study that says it works there.
There has to be a comprehensive study, right? A be-all, end-all, right? Children were always at low risk of COVID. There's been multiple data points now showing that speech and development delays in children who are forced to be masked, like rabid dogs, even outside, has impacted our children and has delayed them. Just look at the test scores. Look at the increase in anxiety and suicide rates. The Post just published an article in the last month showing that children's brains aged 3 years, similar to as if they were in high-stress environments like war from the pandemic and the lockdowns. I understand COVID's a problem, right? But this has to be a comprehensive, multifaceted approach that looks at net benefits and net harms.
Exactly.
And the truth is, multiple countries pursue different paths. We have 2 years of data out of Europe, out of Asia, etc. Germany, in some instances, required N95 masks. Sweden did not. And the reality of the matter is, at best, it blunts the progression. It was never going to stop the pandemic, and we have to look at the harm that was done. A lot of people on the left love the environment. These masks, a lot of them don't decompose for 400 million years. We're dumping $1 billion into the ocean a year. I can't have a gas stove. Like, can we have a nuanced, multifaceted, comprehensive analysis of this, and just instead of making COVID the be all, end all? Because we've destroyed the world over this, and there's been no accountability at all. Nobody, no reflection, no looking back, no, okay, can we do better? And it's a big problem.
It is a massive problem, and one that no one really wants to address. It's an elephant in the room. The environmental impact of these COVID masks is that they have literally destroyed the oceans. There is no recovering from this. People were worried about paper, like plastic straws. All you have to do is show them a video of a turtle with a plastic straw stuck in its nose. Yeah, it's tragic, it's sad. But what about the million turtles that are probably dying nowadays because they swallow a mask that they cannot digest, or it gets stuck around their esophagus? There are fish, like orcas drowning because they get trapped on a mask. And none of that is being addressed. We're dumping all this crap in the ocean, and at the same time, we're pushing, stupid mandates to ban stoves, to stop driving cars, to switch over to ban gasoline vehicles, all this stuff, all in the name of saving the planet, saving the environment, stopping climate change, and yet we're happily filling up our landfills, filling up our oceans with endless, crappy fucking masks.
Yeah, there was a headline. in the Santa Barbara News, let me just give you this headline. It was, "Mask is the chief ally of the disease, physicians declare." And just like the good doc says, the subtitle was, "Average person doesn't know how to take care of the mask, and it becomes a veritable bacteria incubator." That was in Santa Barbara newspaper in 1918.
Yep. That's exactly what happens. We see children in schools being told to wear masks, and if you're an adult, you're probably a bit more mindful of how you wear a mask, right? You probably, if you do wear a mask, you're probably wearing 3 masks a day. You're swapping out. You're not letting it become drenched in sweat. If you're a doctor, that's probably what you're doing. After a single 30-minute session or an hour session with a patient, you're taking it off, putting on a new one, and that it probably works when you're doing it like that because you're trained to do it. But kids are being made to wear it.
Well, more importantly, Ian, if we're going to have public health officials recommend the mask wearing of masks, then there should be some scientific basis. And I don't mean saying they're safe in efficacy. The efficacy is their safety. What are the risks of widespread mask wearing? Speech formation for children. Increased issues related to oxygenation for
increased
everyone.
crime.
Oh yeah.
Falling for those whose vision is impaired by the mask, which virtually everyone's vision is impaired by mask wearing. So none of that testing was done, and so all that damage, they didn't care because they wanted to push forward a mandate. It was the left approach, and it was a left-wing approach to universal masking here, and they were using the government and other cutouts to censor those of us who raised questions about it, or even pointed to information to suggest that they were wrong.
That's correct. And
I mean, it's even worse
I'd
than
like
that.
to jump in if I may.
Before you guys, I'll let you know before you do Estella and Barry. Eugene, I do want you to respond quickly about the discussion regarding masks, just to balance out the discussion.
He has had his hand up for a while.
Yeah, I'll go, if you don't mind, I will go to Stella and Barry because they've been waiting for about 30 minutes. And then Viva, I brought him up. I'd love to get his take as well. But Eugene, just quickly respond.
Phenom too, right? I mean, Phenom's been waiting for a long time.
Yeah,
well,
Phenom is Barry.
I'll be real quick with it and then give the floor to others. When it comes to the masks, I do agree that you have to be trained for the N95 mask. You can't have facial hair. Usually, you do a fit test where they put like a chemical that you can smell underneath the hood wrapped around your head, and then if you can still smell the odor, then they need to adjust the mask a little bit until you can no longer smell it too much. And so I don't think the public would be doing that. But if we gave good guidance and education, kind of like how Dr. Dinesh was saying, to the public about removing your facial hair, wearing it properly, trying to do as best as you can with N95 mask, maybe it could make a difference. But there was legitimate discussion and debate about the environmental impact of the masks. I can't refute that. I think that they do damage, ocean life and orcas and seals and everything like that. But I think overall, we were all trying to do our best in the pandemic to save as many lives as possible. Wearing a mask won't, wearing a regular surgical mask or cloth mask won't, prevent you from getting COVID, but it could help prevent the spread of COVID. Like if you're sick and you're coughing and you're ejecting respiratory particles, it'll capture some.
No, it's an aerosolized viral pathogen. The virons on this thing are so small that there's just no way they will go straight through these masks, even in N95.
All the small particles, but if you cough and there's like big, gigantic respiratory droplets.
Well, that was the big problem, wasn't it, Eugene? The big problem was that Fauci and Birx had proposed in their transmission study, in their model, that it was going to be that this would basically droplet transmitted. It would be a year before they'd ever come back and say, oh no, it's actually aerosolized. And during that year and a half plus, we were all wearing these cloth masks that did nothing. Everyone knew that. In fact, even Leanna Wen would come on and she'd say, these are just facial decorations. I don't know what we're doing. Hey, Eugene, though, I do have to just challenge you quickly. I don't want to put you on the spot, but someone sent this to me, and you talked about your sort of stance on hydroxychloroquine. I just wanted to call up a tweet that someone pointed out to me that you had in August of 2020. I don't know if you've seen it or not. I don't want to call you on the spot, but you said, that you recommended that hydroxychloroquine wasn't the answer. But here in this tweet, August 1st, 2020, you said, physicians who promote the use of hydroxychloroquine for the coronavirus without FDA approval or evidence from clinical trials are frauds and quacks, and they're a danger to society. They must have their medical licenses revoked by state authorities. I think you said just the opposite before, did you not?
If I did say that, that was wrong. But also have to understand the climate that I was in. I was being attacked by a lot of physicians, viciously attacked, them accusing me of things I never did, like being a wife beater, things like that. And like it was a very vicious social media environment. So if I spoke like that, like also examine what a lot of people put underneath my tweets with things that I never did, and like then take that into context as well.
That's fine. I wanted to give you a chance to defend that. Look, it's crazy stuff, but just, look, I think in the end, we have to just adhere to constitutional principles, guys. You can never go wrong if you stand up for those. I don't care. It could be that masks are 100% efficacious. It means nothing. It does not mean that you need to absolutely mandate it, right? There's the science, and you can debate the science all day long. The application of that science into policy and how that counters our foundational principles of our Constitution, that's where they cross the line. That's why this is political. It's not because it became political. It's because the government intervened and tried to take away our rights. And I don't care if it's a major emergency. Going forward, that should be the rule of thumb. It matters not if these vaccines could be 100% perfect. You should never mandate it. These are things that are just basic principles.
Anyway, can I speak? Yeah, I was going to say, Eugene and the other doctors that are on, this is Dr. Emmanuel. There are a few things that we missed here. And sometimes I look back at everything I said, all of us in a way are the prey. We all fell prey to whoever was putting together this whole pandemic or whatever it was. But I'm just saying that I'm thankful that, Eugene, you toned down your rhetoric to ask my license to be taken away and stuff like that. So it's good. But this is what I asked earlier, and I wanted, because if we don't, you cannot conquer what you don't confront. And if you don't look back at if you don't identify the mistakes that we made as humanity, as physicians, then we're apt to make them again. Because if you look at it right now, there's already some document about another pandemic that's going to be here in 2025. So this is what I want to ask is, I asked earlier.
Sorry, so what pandemic in 2020? Sorry, what was that? About 2025?
I'll send you. Oh yeah, there's a pandemic. It's going to be an enterovirus. Just that they already talk about. It's a pandemic. It's going to be in 2025. What
do you mean? How can they talk about a pandemic that hasn't happened from now?
I'm
not an expert in this stuff, so I have no idea.
Oh no. Eugene, they actually talked about this. I don't know who asked the question. They actually talked about COVID in October of 2019, and it came out exactly the way they said it. They did
2017. They started talking about
2019. 2019, they had a whole this. They called it. They had a whole this. They talk about how COVID was going to come and
Event 201.
Event 201. So they have another event scheduled already. I'm saying this so that we need to know this, that to an extent, we as human beings, we as physicians, we have to be in the front line of standing between the people and any nefarious activities, whether it's from big pharma, from the government, or from wherever this is coming from. But we're not going to be able to do this if we don't start really looking back at what we evaluated wrong in the time of fear. For example, I asked a question earlier, and we have taken care of diseases. I've worked ER for years. If somebody came with the flu, you were able to give them a steroid to help with the inflammation. You gave them a breathing treatment. You gave them something if they were developing pneumonia. You gave them, you gave them if they were blood clotting. We know how to treat blood clots. We know how to treat pneumonia. We know how to treat respiratory distress and everything. But in the situation of COVID, physicians supported the idea, which does not make sense because it's way past a Hippocratic oath. It's that people should be sent home with nothing. No intervention, no supportive treatment. They should be sent home with nothing and come back when they are almost dead. I want every one of you that is making this a left or right issue, because, when I came out and spoke in 2020, they immediately connected me to Trump. I've never met Trump. I've never spoken to Trump. It became I was a Trump operative. I mean, it's crazy because regardless of who I voted for, I was not speaking as a Republican or a Democrat. I was speaking as a physician that was taking care of patients and was concerned about the life of people, because we can debate now, but there are people that died because of mistakes that physicians made. There are people that died because we did not ask questions. There are people that died that are not going to raise up. I traveled to North Dakota, I met a guy sitting on drinking himself to death and saying they killed his sweetheart. He begged for them in the hospital to give them ivermectin. He begged and they refused to give it, and they killed his wife. His wife died crying and begging for ivermectin, which I know is efficacious. So what I'm saying is that if we don't address the fundamental of what happened, look at masks. Putting on these face diapers that we put on our faces to prevent COVID is like putting a chain link fence to prevent the transmission of a mosquito. It does not work. So, but we did it anyway, and we still support it. Instead of, well-fitted N95 mask. They did not tell people out there to wear a well-fitted N95 mask. Something went wrong that disturbed the medical system. And the reason why this went wrong is because doctors did not stand in the gap for their patients, for their people. We got caught into this, and then we started fighting each other. We did not look at what I was doing or what anybody else was doing, and we made it political. Medicine should never have been political. I do believe that the medical community failed humanity, and if we don't dig into to find out exactly why this happened, we're going to be apt to make this mistake again.
I got to respond to this, Mario. Is that okay?
Yeah, just to balance it out, and then we'll go to Barry.
Yeah. So, number one, the data is very clear now, and I'm happy to debate this in a separate space around ivermectin. There are other early intervention medications that have much more clinically and statistically significant impact. So I'm sorry that person lost a loved one, but there's no current randomized controlled trial data that shows effectively that ivermectin would have saved his wife. That's number one. We don't know that.
Many.
Hold on. We can talk about it separately. I heard you speak the whole time as you vilified all of your colleagues. Now it's my turn to kind of make sure that it's clear to you. We were learning what was going on in the moment. I have colleagues that lost colleagues. To try to say that the medical, quote unquote, establishment, whatever that means, public health is very, very different than the fog of war. When in New York, our colleagues were working day and night trying to save patients. They figured out that putting patients prone was better. They figured out that ventilators didn't always actually improve outcomes. They figured out that steroids actually had data. They figured out that azithromycin did not. And this is what happens when you're working with a novel disease. I think it's incredibly inconsiderate to think the doctors out there are making decisions based on pharmaceutical companies and so on. The doctors that were at the front lines in the ICUs taking care of those patients had no reason to not give them ivermectin. In fact, you know this, and I know you know this, that in the beginning we were giving them hydroxychloroquine. It's just the data didn't pan out, and that's okay. We have to, just like anything else, healthcare and medical care evolves. We now know that there are good early intervention treatments. And again, talking about face diapers and all, it sounds really good in a talking point. But ultimately, the one thing we have never talked about, Mario, and the rest of the people, is what about all these people that have long COVID? If we are not going to put masks on, we're just going to let it rip. What about all of the people that have long COVID? And I'm happy to share 1 million papers showing that long COVID is having long-term effects on patients.
Dr. Dinesh, listen, I hear what you're saying, but here's the bigger problem. What you're talking about certainly may relate to how doctors are going to work with this, as Dr. Emanuel so rightly talked about, in this more apprenticeship thing that we grow people into, and then we keep talking within the medical community thereafter. But the problem you're not addressing in everything you said is that that reaction turned into a massive assault on individual liberty throughout the United States and in other countries as well, that was not scientific, that took us down paths we never should have gone down, and quite frankly, with all due respect to what you said, also politicized the medical information that was coming to us. That is a key issue in what we're talking about here. And I want to respect scientists every way I can. Let me finish up real quick. I want to respect scientists. I want to respect doctors who are scientists of a sort, and actually in practical terms. But here's the problem. The scientist, and I talk about this a lot, the science is one thing where you're inductively looking at certain things. There's the deductive side that is not primarily or not exclusively the realm of scientists. It's the realm of all of us who are looking at everything that happens. And we've got some problems with how that reaction is going. And it's not incumbent upon us, because we're not doctors, to question the conclusions people come to. And that's something I don't think you're giving enough credit for.
Everybody, if I can
jump in.
I'll go. Yeah. Barry, jump in, and then Viva right after. Go ahead, Barry.
Okay, thanks, Mario, Tara, and Ian. I really appreciate the opportunity. Well, first, real quick, before I get to my point, which I think is extremely crucial to the foundation of this whole topic, is when I thought I heard somebody say that a vaccine stays in one part of the body. I don't have time to debate on that, but that's absolutely not even physiologically accurate at all. Secondly, Dr.
I would love to hear how you think vaccines work.
Please, I have the mic.
Well, the liver study showed it transcribed, right? You did read that study about the liver, right?
It transcribes into the liver, Danish. It transcribes into the liver. It doesn't stay in one spot. You need to look for the study. I'll send it to you. I'll tweet it to you.
Secondly, it was actually in 2017 where Dr. Ashish Jha, who's now Biden's COVID-19 coordinator, said that whether he liked it or not, the Trump administration is going to have to look at pandemic prevention and preparedness as a top priority. So let's just let that sink in for a minute. But I think I was so glad to hear somebody mention consensus, because if you understand where doctors get their information, it's either through anecdotes that they see inside their clinical practice, which unless you're an independent physician, as Dr. Aaron mentioned earlier, you're largely really not able to practice using any of that data. You have to go by basically what your the HMO or the organization you work for now. And that's now governed by the AMA, which used to really be an organization to help individual and private doctors to sort of help them, as an organization. And that has changed. It's now an organization that is in bed, and I hate to use that term, but in bed with the CDC, the WHO, the FDA. When the AMA, when health insurance, for instance, was first starting to have the government interject into it, the AMA, which again was for private physicians, had a huge ad campaign saying, hey, this is going to get in the way of the doctor-patient relationship. And it has. So let's go back to where doctors get their information. So it's the anecdotes, or it's through the literature. Now, everyone on this panel keeps citing the different literature they like to agree with. But what we're not talking about is all the data that doesn't get published. And why? Because it's not part of the consensus. Consensus has taken over science. And so the only data that is allowed, in parentheses, to really be considered true and accurate is that's published in high impact factor journals. Now, impact factor has become almost like a social credit system for medical research. So basically, impact factor is not based on how valid science is. I see you laughing at me, Dr. Danish, but I don't know. I was a publisher for 17 years, actually. So it's basically a social credit system, which is based on how often your journal is cited. And who decides what journals are cited? Well, we've got the mainstream media, we've got NewsGuard, we have GARM, and even the ADL, all these organizations that are part of the censorship organization. So I have spoken with over 2,000 doctors and helped them get articles published that could not get published in high impact journals, not because they weren't scientifically sound, but because they were not part of the consensus. And the consensus isn't even chosen by the actual scientists and the doctors. It is chosen by organizations. It's chosen by the money, really. The other way doctors learn is through continuing medical education. And unless you abide, and I used to own an organization that did continuing medical education courses. And if you don't abide by the consensus, it is impossible to have the AMA offer credits. So basically doctors are constrained, especially if they're not private doctors, they're constrained into education that is only part of the narrative or the consensus. And so this is a huge problem, which leads to the fact that we need to try to find a way to decentralize some of these organizations. And doctors need to start to create parallel organizations, which right now it's only naturopathic and integrative doctors that are trying to do this, and the frontline doctors as well. So I think that the other aspect is that there's another type of mandate that we're not talking about. And that is when the CDC recommends a schedule. If the CDC recommends a schedule, it is really hard for a doctor to keep their job if they don't go by those recommendations, whether it's a government mandate or not.
So, Phenom, why do you... Go ahead, Prodigal. Go ahead.
Yeah, because I'm going to leave. I just wanted to touch one point. I see Tracy's down there, so I'd rather free up my slot to get her up here so she can speak more intelligibly. But I think what people aren't realizing is the amount of distrust and anger. I mean, you tried to starve people into submission. You kept kids out of school. Look at the alcoholism death rate. We're at multi-decade highs. I mean, the damage is monumental. I'm from the tri-state area. You bankrupted a third of small businesses. I couldn't bury my dead. Yet people couldn't visit their relatives in nursing home facilities. You made the decision for them. Let me tell you something. Some people would rather see their loved ones with the last days of their life than live in solitude with strangers. So, I mean, to look at this and say, well, we need transparency. No, we need accountability. I need to know why the people who have destroyed so many things, why does Bill Gates have so much power? He screwed up on Common Core. You look at his green tech revolution in Africa, it was a failure. Everything he said about the vaccine was a failure, and he still applauded and celebrated. Why does he have this type of control? Even going to the masks, you might not have been involved in it, but I had some friends involved with it because if it makes money, it makes sense. The gray market for PPE equipment, I cannot tell you the write-ups that people were getting to secure this equipment overseas, masks, etc. And the players involved that I was seeing on some of these slips are, I can't name them due to confidentiality, but they're the same players who were involved with every step of this pandemic. And when we talk about the lab leak and everything else, it was known. I mean, it came out. How's there accountability when in the UK, Jeremy Farrar said that this wasn't a lab leak, and in the emails revealed he did think it was a lab leak, and he's promoted as the chief scientist of the World Health Organization? How's there accountability when everybody, regardless of the DARPA project, recognized what Equal Health Alliance and Peter Daszak was doing, and he's named as the only American to investigate the origins of the virus? There is no accountability. And this isn't some psycho, right-wing conspiracy theorist. When Robert Redfield, the former head of the CDC, comes out and says, yeah, Fauci perjured himself. This is the same people who controlled our response to the pandemic, controlled the vaccine mandate rollout, controlled all this stuff. So I think you people are really underestimating the amount of anger that's going to bubble up. And regardless of what they say about strokes, et cetera, we really don't know the long-term effects of what this is going to be at all. It's mandated on children and the people who are healthy. Oxford just did a study. They said the net benefit for people under 30, there is none with the vaccine. It actually is a net harm. So, I mean, you could stand on your high horse as ever as you want. Time will tell what it is. And at that point, we can try to move forward. But there has to be at least the mea culpa. At least, okay, let's move from this. Because what we're seeing and the backlash and distrust that has been caused, not just in the U.S., across the world. This is my most final point. In Australia, the head of their the former head of their medical association is by no means a right-wing person, right? She's lesbian. Her wife is lesbian. She came out and said, and she used to advocate for the vaccines, that both her and her wife have long-term and continuous side effects from this vaccine. And to still say we're going to mandate this on children, when we all know that the average lifetime that the average age of COVID death was, in most cases around the world, higher than the average lifetime expectancy in these countries, is literally insane. I mean, look at the data, look at these points, and decide. We don't know yet, but it's a little weird that the excess death data out of Germany and the UK and France is not looking good. It doesn't look good that here in the States, insurance companies, life insurance, only care about money. Their actuaries are saying, yeah, we're seeing a lot of signals in our data that we're going to have to pay out, and this is a problem. These are questions that haven't been discussed, that have been silenced after billions have been injected on this, after they said you're going to take this every 6 months. And look no further than the European Medicines Agency, which came out in January, I believe, in 2021, and said, essentially, we really don't know what neutralizing antibodies are doing. We don't know which levels are responsive in regards to combating this virus. And there's a real risk of tolerance developing through multiple injections. Like, these are questions that you're going to have to answer yourself. At this point, I don't care to convince anybody. At this point, if you want it and you like it, please take it, because there's more of you than us, and I need to thin the herd. So everybody have a good night. God bless.
What a way to end it! Like just
Yeah.
Prodigal giving out a passionate speech.
He's like, we need to thin the herd.
Coming to it. Exactly.
I was like,
we got to thin the herd. I'm like, okay, someone needs to reply urgently to balance it out, and then boom, the space crashes.
I mean, I was enjoying his speech, so I didn't do it. It was all Prodigal's
He's such
fault.
a good speaker.
Oh my God. I'm just really excited. You know, Mario, while we have this moment, can you please put on the schedule one space where you talk to people who have long COVID? I think that will be really helpful for some level of balance and context. Having, been around these patients, you have to talk to them. What they're going through is unreal. And the medical establishment is actually treating them really poorly. And we're going to have an entire generation of people with long COVID. And so, I think that gives the other side of the argument.
Is long COVID real?
Yes, 100% it's real, man.
Is it documented to be real?
Yes, very much so. So there's a really good Lancet Psychiatry paper where they actually did MRIs of patients with long COVID, specifically brain fog, and they saw that they had neuroinflammatory disease, and some of them were having microvascular strokes. And we have a lot of data around that. I'm in ear, nose, throat, so anosmia
If you don't mind, can you share that data with me? Because I've not seen that, and I've been under the impression that it's made up, right? I mean,
no,
I don't
not at
know,
all.
right?
Yeah,
I can't make the distinction. Yeah.
So there's and I'm not going to go. I know there are people coming, so maybe there's a moment to tell. But I'm happy to share that study with you. But specifically, neurological manifestations are very, very real. The cardiovascular manifestation with POTS. Or postural orthostatic tachycardia syndrome is incredibly real. Actually, one of my colleagues, she was a cardiologist, marathon runner, very well known from really UCLA, I believe, at the time, but now she's in private practice. Or actually, she quit because she can't walk anymore. She literally can't walk anymore, and it completely changed her life. And she speaks very, very much in these spaces about that. So I think it will provide a very, as we talk about mitigation measures, if you don't believe that COVID can have long-term side effects, then I can totally understand why some, not you specifically, but some people may think, well, the treatment is worse than the disease, but you've got to see these long COVID patients. It's absolutely awful.
Do we know if, and you probably can't answer this because there's no way to know, but do you know, is there anything to indicate that perhaps taking a vaccine might stop something like long COVID from happening? Or,
so there's some data. No, there's actually some data talking. So long COVID usually manifests within the first 6 months of the disease, right? And so there's two different formats that you see. And again, there's a million different formats, but the two common types are people get super duper sick and then have long-term disease, long-term sequelae of that super sickness, right? Like they were really, really sick for a few they were hospitalized and so on, and then they remain sick. And then the other one is, dude, it was like an asymptomatic infection, and then 2 weeks later they can't walk, and you're like, what the hell is going? We don't even know why it's happening. I just want to be honest with you. It's like one of the scariest things to watch, especially amongst colleagues. I have now 3 different colleagues that have it. A lot of healthcare workers, unfortunately, nurses and doctors.
Is it related to the viral load, perhaps? Because like if you're in the medical profession,
there might be some relationship. It's too early to tell. We're still learning about it. What's really sad is all these patients are going and joining long COVID clinics, and we don't have any real treatments for them. And the thing that I thought people would do is, hey, maybe, so the one area, fluvoxamine is an early treatment that has been related to reduction in long COVID symptoms. So that's another important early treatment could actually be used to prevent long COVID. There's some data around that, but very, very early and very low quality. And so, but anyways, I just wanted to bring that up, Mario, before we all get started, because I feel like that's one part of the conversation that never gets talked about. I'm sorry?
No, I was thinking to Mario. You want to get this started or you want to end this?
No, we can. I can keep it going. We'll ask the audience kind of decide.
Yeah, the audience can decide.
The audience decides.
Yeah.
And we just kicked it off.
Are we slaves to the audience now? Hosts' lives matter. Okay. Wow.
I've been the slave of the audience for 2 months, and you've just got to learn to accept it. Do not fight it. Trust me. Do not fight. You've got to accept it and go with it.
God.
Be
just
free.
Lay back and think of England. Okay.
Yeah.
But I listening to all these spaces. I just don't know what. I just don't know what to believe. It's just, and I think this is normal because the studies are very early. Everything's very polarized. Things are getting politicized. So it's just really hard. If someone has a if someone has COVID, should they be worried about long-term effects? If someone has a vaccine, should they be worried about long-term health effects? Do masks work? Do masks not work if worn properly? It's just that even the smartest people disagree, and they've disagreed time and time again. I hope that the balance of these debates, like Stella, have you noticed that at least now the discussions are being had? Before it was just, everything was being rushed, everyone's just going crazy, so we didn't have the same discussions we're having now. At least that's an improvement there.
Yeah, I'm actually glad that we were able to talk with Eugene, with Dennis, and I mean, Dennis is different. Dennis kind of like, let's look at it medical. Eugene was wishing death on me or something like that. But I'm glad that we're able to talk now, because that's why I said we need to look back at what happened in the past 3 years and have these debates, because this is a battle for humanity. And there's a nefarious thing going on, because everything that has happened showed that this was nefarious. And I'm sure a lot of you have heard about the gain of function studies.
So,
you know what I'm saying? And
what do you mean? Can you define, Stella, can you define nefarious?
Nefarious.
Yeah, what do you mean? It's a very, very loaded word to use.
Okay, let me say why I think it's nefarious. Because if you look at the masking, if you look at the lies that were told by Anthony Fauci, like mask works, masks don't work, then it works, or hydroxychloroquine works, doesn't work, or it works, or vaccine works and it doesn't work. And then with Operation Warp Speed, everything that has happened with this COVID, and of course you listen to all the when they did in the Senate, where they held hearings about gain of function studies, whether it's a bioweapon, whether it's gain of function, whether it's a lab leak, or China allowing the virus to leave Wuhan and go everywhere else. There are many things.
So my question there: does confusion mean nefarious intentions, or could it just be incompetence?
No, I actually think it's nefarious, because I do believe that to some extent the leaders, whether it's from, I don't know who were involved in this fear and there's so much that was done wrong to just look at it and say, well, you know what? It was just confusion and they didn't know what they were doing. There's so much that was done wrong, number one. And number two, they got away with it and they are still getting away with it. For us to just think that, well, this is just something that just happened.
Nefarious means that they have bad intentions for bad outcomes. But what they could be doing is basically, but what they've done, in my view, is they've done, I think, wrong actions. I think bad actions in terms of censorship and taking away people's choices. But their reasoning behind it isn't necessarily to hurt people. They might think that they're doing good things to people. They may be wrong, and the outcomes might be bad. But it doesn't mean that their inclinations. I mean, people throughout history often do things thinking that they're doing it for good reasons. And that's the problem. I mean, when we look at people through the lens of this person is a villain, I mean, very often people don't see themselves as villains in their stories. They see themselves as heroes, as saviors, and they do terrible things to other people. That's the problem that we see. Very few people see themselves as doing bad things.
Well, one thing about that, medical community. Let me just say, I think the medical community was caught up in something that we could not control. And I think a lot of doctors that made decisions, good or bad, did it out of fear, out of data, out of whatever. But I'm not talking about my colleagues. I'm not talking about the people I'm not talking about my colleagues. I'm talking about the fact that this stuff went down until today. Nobody's held accountable. Until today, we are still confused. 3 years later, with so much data on both sides. I'm just saying, I know a lot of people want to just say, well, this was done in error. I do believe it was nefarious. And I do believe that until we dig deep to find out why this happened from both sides, whether it's those that believe or did not believe, until we dig deep and get all this information. And I love this. I love having these discussions with people that did not share my idea of what to do about COVID, because we learn from each other. And it is this learning, us as humanity, that will save us from making mistakes again. That's what I'm saying. You understand? I'm not talking about my colleagues. My colleagues, a lot of them, they did not know. They just went with whatever was going on. But I do believe there were nefarious actors behind what has happened to humanity. That's my opinion.
One thing to keep in mind here, and Catherine, I think your points are well taken, but one issue here, motive is not the best, in my opinion, the best or most reliable way to determine the nefarious nature of things. Because there are many motivations that go behind the decisions people make, particularly in situations like this. So the extreme example of reaction from those who were imposing this or that is the whole trucker rally up in Canada, for example. It was highly inconvenient for people. They didn't like it. It shut down the capital city. And Justin Trudeau went after him, went after their bank accounts, went after, so many things. Even if Justin Trudeau's motives were to save lives, that was absolutely a nefarious act, period, because it took away people's fundamental human rights. That's the end of the spectrum of this. But even when you get down into what takes place with Dr. Fauci, with Biden, with Trump, and other political actors, or whoever you want to choose, governors in the states in the United States, folks in Europe, Boris Johnson, whoever you want to choose, again, there might be sincere intentions to do good, but when basic fundamental principles are put to the side for the benefit of some government action, that by definition is nefarious. And this is what we've seen in all the Twitter files dumps. And it's an important thing to keep in mind. Sincerity is not a good indicator of good actions. Good actions are an indicator of good actions.
Well,
that's what we're looking for.
Well, when you're talking about actions, yes. I mean, you can have nefarious actions. All these things that you described, yes, you can describe the actions as nefarious. But I think I think maybe where the confusion can come sometimes when we're talking about this is, are the intentions nefarious or are the actions? The actions are, the underlying intentions may not be. And so, okay, so how then we look, I mean, I think something that Stella brought up that I think is important to look is like, okay, where did we go wrong? And there are some actions that weren't even nefarious at all, but have caused consequences that were. Something that I was digging into a little bit last night. I'm writing on this topic, and so I've been talking to scientists. So one of the issues that was happening that is not even nefarious, but it's just a challenge in the field of science, is that, for example, scientists, when we're dealing with something complex like COVID and immunology, scientists, especially as we gather more and more knowledge, they specialize in more and more smaller fields. So they might be studying something very specific for a very, very long time. So what happens is, they'll study some very, like a small atom or something, a very specialized field. And then somebody, when something like this comes along and their colleagues say, well, this is the consensus, they sort of tend to adapt the consensus because they don't have time to sort of read the literature to really understand and get a thorough understanding. So there's this idea of consensus that doesn't necessarily exist because all these so-called experts speak on things that they're not necessarily experts on. And that's something that we need to figure out how we navigate with that, because it seems to me that there was a lot of that going on, a lot of people speaking on topics that they didn't really have expertise in. And then we getting to sort of the media side of things, and, media was being sort of influenced also by these sort of experts who might not have expertise. And then they have, and then there's the financial incentives. So there's a whole web of things that are also part of the system. And then there were also people who are afraid of maybe speaking against the mainstream narrative when they weren't really sure for themselves and they were afraid of losing funding. So there's a lot of areas that weren't even necessarily fully nefarious, but had nefarious, let's say, consequences.
I guess struggle to unmute. The question that I have, though, that really, Danish, are you there? I knew
yeah,
it's glitching. Oh, you are. Okay, it showed that it showed that it was glitching for you. My question is how it's crazy to see doctors praised as heroes 2-3 years ago. Now called cowards, and there's reasons for both points, like for being called heroes and being called cowards. But the sudden shift, what do you think caused it? Is it politicization? Is it censorship? Is it
the mistakes that were made, or whether nefarious or not? What's your take on it? And how does it make doctors feel? How are they feeling after the last 2 years?
I'll give you
How's
a really
the
simple.
like
I'll start with the second question first. In the fourth quarter of 2022, 117,000 American doctors quit. Out of 1 million, there's only 1 million in America. 117,000.
More than 10. You're saying more than 10% quit?
Yes, at the end of last year.
Is that a record within 1 year?
It's a record of 1 year.
But how big of a record is it compared to other, the previous record?
It's up by like 70% ever. Like that's the largest quarter of all time, and it's being swept. I was actually going to write an entire article about this and submit it, but one of the things that really irks me is that the current model of business, at the end of the day, the doctors are the ones that are getting completely annihilated by the system. And it's funny because the reason why people are upset is because public health has become, quote unquote, synonymous with doctors. People look at their doctor like as if I'm getting paid by Fauci or pharma, neither one of which is true, right? And so ultimately there has been this, false equivalency of, hey, you're not talking to the doctor, you're talking to the health system, and the doctor has just become the face of the healthcare system, and that's really made it very difficult. And so these healthcare heroes, it's like, and I will respectfully say that, while Catherine is correct that there is some concern around physicians not being able to speak up, and I know there are some physicians that have had that experience, I think across the board, one of the biggest challenges that we have is that reproducibility of data, especially when it comes to lower level evidence, is a big issue. Even the best quality evidence is hard to reproduce, right? Because you'd have to go out, raise money, get grant funding, and get it to show it again. And that has become a real issue, which is why I think I myself and a bunch of different doctors are asking for the data to be open sourced. Why can't I see the original COVID trial data and be able to see for myself what the actual data showed? That is what needs to happen. We should start ranking. She was mentioning about impact factor. I disagree significantly. Impact factor is largely driven by other scientists citing your papers, not by news organizations citing your papers. But anyways, the problem is that ultimately we are putting, and this is kind of crazy to imagine, the scientists that are doing the studies look at the data of those studies as their intellectual property. That should not be the case anymore. If it's publicly funded, if the government's paying to fund a study through NIH funding, it should be open sourced. Anyways, going back to your question about Mario.
Before you go back to the question, man, like with such record number of doctors resigning, what does it mean for the system? Like, how is that going to impact society or the system in the next 5-10 years?
The system is actually breaking down right now. And by the way, that's actually what's happening
due to lack of trust on both sides.
So the doctors are now
what's causing the breakdown?
So how do you build trust between you and your doctor? Time is what builds trust. Now the doctor who is already seeing you for unless you have a concierge doctor, your doctor is seeing you for like 15 minutes, maybe 10 minutes. Right. And so maybe 5, and so now that time is going from 15 to 10 to 5. And that trust is getting worse and worse. And by the way, this is a really sad thing that most people don't realize. The patient doesn't just benefit from those moments with the doctor. The doctor actually feels a closeness to their patient in that time. And so doctors are feeling, if you look at the top 3 reasons why doctors are quitting, one of them is administrative. It's a ton of paperwork, you're not, all of that stuff. But the second one is gratitude. Doctors don't feel like they're having that. And the third is relationship. So number 2 and 3 are about the doctor-patient relationship and patients feeling like doctors are taking care of them, and doctors kind of getting that negative energy and internalizing it. And I think that, we can, I'm not trying to say, oh, woe is us, right? But I think that we are in a very scary time. A lot of people are talking a lot of shit about doctors, and I would caution you, what the hell are you going to do when we're gone?
One thing I want to throw into that, I think it's important to note, I think the COVID situation really contributed to all you're talking about, Dr. Dinesh, but I think we cannot underestimate, and it's not the only factor, but I think it's the major one. We cannot underestimate the intrusion of government edicts into all the process, insurance, hospitals, doctors, everything, that is really making it difficult for doctors to treat directly. So, for example, getting an insurance plan when you're young that just takes care of the fact that you can go to a doctor anytime you need to or whatever. I mean, these kinds of things can set up, but no, we can't do it. We got to do it a different way. I think that may be the biggest contributing factor that COVID just exacerbated that was already developing.
I want to go quickly. Grant, you had a lot of critiques in the last time we had a space together regarding how doctors handled this in the last couple of years. What would it take for you to regain trust in the system? You there, Grant? I'll ask the same question
sorry
to
about
you.
that, guys. Sorry.
All good, man. All good.
Yeah, I just want to say that, I know I keep hearing about the nefarious ones. I worry about the ones that just get along and go along. And I'm one of the people that the other night said the doctors have been cowards. And if it offends you guys, I'm sorry to say that, but I haven't heard any of you stand up as a group. If 112,000 people quit, I mean, why didn't somebody organize putting those 112,000 people to protest? Why don't you guys group together? They got to be upset. Those 112,000 got to be pissed off. They didn't quit because they were happy. Why didn't somebody organize that? Stand up against these people. Because I'm not blaming the doctors except for the get along and the go along and the not question.
Stand up against their patients? Stand up against the system? Like, stand up against who specifically? Because they quit.
Stand up against the broken system you guys complain about.
Yeah,
but the problem...
If I may say something on that. A lot of doctors, I know, because the reason why I survived is because I was a private practitioner and I had a cash pay practice because I had just started the practice in Houston like 6 months prior. I was trying to get Blue Cross Blue Shield and other insurances. I had been approved for some. The minute this came out and I went public about this, most of the insurance companies dropped me. And I survived because initially my practice was cash pay. So doctors were actually squeezed. And that's why I say that to some extent, you need to understand where my colleagues are. There are many doctors that even got COVID themselves and they were scared to call in hydroxychloroquine or ivermectin for themselves. And they will call me crying, and I told them, I said, well, you can do this for yourself. Oh no, it might affect me, my people. So there was a lot of fear. When they came after us, they made it so public that many physicians were scared. And we live in a time when we live in a very litigious society, and most of us doctors have always protected our licenses against litigation. So the majority of doctors that went along, I will not just say that they did it because they were nefarious or they were evil or something. It's just because it's a situation. There were doctors in hospitals that could not prescribe anything because hospitals work by formularies. There were doctors working for groups that could not do anything. So that is why I say that we need to 100 and something doctors quit. That is not acceptable. We need to put a space where physicians can talk, and then we can create a situation. That's why I keep saying that we need to do a post-mortem. If we don't do a post-mortem of what has happened, then patients are going to not trust doctors. Doctors are losing business. There are many doctors that are actually losing business, even private doctors, because their patients don't want to go to them. And I'm here and patients want me to be their private doctor and I can't because I can't take care of everybody. So we need to do a post-mortem, and in that post-mortem and get back to trust in medicine and take medicine away from the hands of politicians, the hands of big pharma, and get back. The only way this is going to happen is if doctors on both sides start talking and doing a post-mortem that this happened and how did we get caught up in this? How did medicine get politicized? How did medicine become something that we lost our autonomy as doctors to big pharma or to the government or to whatever or to WHO? This is something we need to do. So I still go with the same thing. We need a post-mortem. And as we do a post-mortem, doctors will agree with each other, will discuss, will look at data. There's over 300,000 or 400,000, about 300 articles that show different things that work. Like I say, fluvoxamine, ivermectin, hydroxychloroquine. COVID is completely treatable and preventable. So we need to get together as doctors. I don't know. I think Mario or whoever will do more spaces on this. You know what I'm saying? Tonight we're doing a space on early treatment. If any of you want to join, you can join. We'll let you speak. We need to do a postmortem and come together as the medical community, because we are going to be what is going to stand between humanity and other things that are going to happen. That's what I say.
So Dr. Dinesh, I'd love to ask the same question to you, if possible. How do you believe that we restore faith in the healthcare providers?
I think I agree with Stella in the sense that, look, ultimately, off-label use of medications should never have been even in question. I think that's nuts. And if a bunch of patients started having adverse events, those doctors would have lost their licenses. And Stella's right that ultimately, even though I don't believe in the efficacy specifically of ivermectin, but I do of other early intervention treatments that I mentioned, specifically metformin from the New England Journal of Medicine paper. Off-label use is still between the doctor and their patient in that specific clinical situation. I think ultimately we're going to have a really deep conversation with what do we value as a healthcare system. And I think my opinion is that we need to restore the doctor-patient relationship. I think we need to make it easier. The reason why nobody trusts the doctor is because, people see the doctor as being inaccessible, unavailable, too busy, too rushed. And when they do get their time, they don't want to listen. And it's, honestly, for a lot of doctors, especially to Stella's point again about primary care, in a lot of countries, like 90% of people have a primary care doctor. I bet you if you poll the audience, less than 30% of them have primary care doctors. It is you don't have a doctor you can trust. Most people should have a relationship with a doctor they actually trust. And if they don't trust that doctor, they've got to find a doctor they can actually trust. And that's how you have to build a relationship with a doctor. The relationship needs to come back. And as far as the system, I think we need to move away from this addiction we have to something called fee for service. It's the business model of healthcare, which is the more we see a patient, the more money the system makes. So the sicker you are as a patient, the more valuable you are to the healthcare system. If we change the unit economics and the business model, and we switched it to things like subscription and other ways where not me specifically, but a healthcare system did not treat people differently if they were sicker or healthier. And ultimately what you would see is people would start actually managing patients' health more than sickness. And that's been a huge issue in healthcare, the fee-for-service addiction that is going on right now. We're just managing chronic diseases instead of getting people healthier. And I mean, I have a lot of other political beliefs, but I'm going to hold back on single payer, that we should have universal healthcare. The reason why nobody trusts healthcare is because healthcare is seen as a profit-making machine by quote-unquote non-profit giant healthcare systems. They're sitting around just, if any of these non-profit hospitals want to keep their tax exemption status, they need to forgive all of the medical debt that's owed to them. I mean, these are all critical systematic issues that exist in healthcare in America. When you talk to people outside of the U.S., they can't believe that our system that we have made healthcare capitalist. I mean, it's crazy.
Right. So, Dr. Dinesh, I'll ask you one more question on that just to clarify something. So you believe that we need to move away from a fee-for-service type structure for healthcare, and that's sort of the way that we are going to be able to make doctors more accessible and make them, let's say, I'll give you an example. I can hardly get an appointment with a doctor. Right.
Exactly.
I know it takes a while, but is that not something that is more difficult in countries that have single payer healthcare?
So that's not completely true. So it depends on the country. So Sweden is a great example of a country that has healthcare that is covered by the government, but also they have same day access because the doctors actually have smaller panels of patients or smaller number of patients that they manage. And they've actually fixed the problem of the supply and demand issue with healthcare. And so, right now, people are mentioning the AMA. The AMA has been an institution that has supported the inability for medical schools to expand the number of people that they have because, and people don't know this, do you know what actually is used to expand the number of residency spots in America. They have limited number of residency spots in America because residency is not paid for by the hospital. It's paid for by the government. And that is actually insane that a hospital in one side of the country can't pay residents differently than another side of the country. And it's because they are trying to limit the number of total number of doctors, even though you, Nick, can't get, and I bet you have better access to resources than most people, you can't get in with your doctor immediately. That's kind of the problem. You know why? Because your doctor is thinking about, hey, I work for a big health system. I need to see more Medicare patients because they need total knee replacements, which will then increase my ability to support my other patients. And I've just got, they're triaging. Imagine doctors feel like they're in the middle of a war and they've got to triage the super sick patients, right? The healthcare system just throwing patients at them all day. And they're like, hey, this patient's really sick. I've got to spend more time with them. Nick looks all right. I don't want to spend time with him, because the healthcare system needs to churn through a certain number of people so they can make their money.
Well, I live in Canada and we have the same issue.
Hey, hold on, Catherine. Hang on 1 second, Catherine. Stella, chime in, and then Catherine right after.
Danish, our healthcare system has been broken for a while, I know. But I think the current distrust in the healthcare system is just because during this pandemic, think about it, about half the population, or maybe a good 40% of the population that believe that they were being deprived of the right medications, went to their doctors and their doctors will not take care of them. They don't trust their doctors anymore. That is why, so yes, the healthcare system was already broken, but there's a big distrust that happened during this pandemic because, like I said, a lot of doctors did listened to the narrative, or they did not follow their own instincts, or they did not care for their patients. Even when patients came and said, okay, Liz, this is, I'm bringing you this information, I'm bringing you this articles and they didn't want to hear it. So the distrust that has really happened among doctors right now, and a lot of doctors are losing patients, and even in private care, is just because they were not there during the pandemic to do the right thing for their patients.
There's a lot of different specialties outside of just primary care, right?
No, I'm talking about primary care. I'm really just talking about primary care.
Okay. All right.
Many specialties that require their patients to get a vaccine before they can be seen or have surgery. There were many things that were done to patients that were not made patients not trust their doctors anymore. And like I said, I keep going back to having a post-mortem because we need to, as the physicians, take back medicine from the AMA or whatever. I used to be from the medical industrial complex. I'll say that. I used to be part of the AMA, and then AMA started threatening me. I told them, I said, listen, you can't threaten me. You don't determine how I practice medicine. Even one Colorado board sent me a crazy letter. I said, listen, you don't determine how I practice medicine. CDC doesn't determine how I practice medicine. They can just give suggestions or they can give recommendations. I had to stand strong and said, no, you can't push me around. After a while, I said, if you don't stop, I'm going to get my attorneys to come after you. I spent a lot of money paying attorneys and everything, doing a lot of dig up to make sure that I could do what I had to do without people attacking me. You know what I'm saying? So many of our doctors did not have the strength that I had, or they did not have the conviction that I had. So that is why I'm saying for us to get back people to just trust doctors is that we need to, and for doctors to also look at what happened. I keep saying this because it's so important, because if not, going forward, something else would happen and we will be caught again like we got caught before. And I'm not saying this out of what I believe in or not believe in or what political spectrum I stand in. I'm just saying that doctors need to talk. Listen, medical practice has always been an apprenticeship. We've always been able to share with each other what our successes are, and with those successes, other people duplicated them and they did well. And we need to start having those conversations.
And
if we're going to get trust again.
And may I chime in as well? This is Dr. Lindley.
Sure, go ahead, Dr. Lindley.
And
then Catherine after you.
I actually done work on in DC before the pandemic on this issue, because what people don't realize, I'm just going to speak about the United States, we do practice a form of socialized medicine. It's a corporate practice of medicine. A lot of physicians are employed by big corporations or medical systems, and you have to work within the system. You have to send referrals within the systems. There's a formulary and things like that. And like Dr. Danish was saying, you in a fee-for-service payment model, you only get paid if the patient comes to see you in person. So if someone calls and says, hey, I have allergies for 2 days, I'm not sure what to do, the front desk is going to say, come and see the doctor in 2-3 days, whatever, because that's the only way they get paid. What I do, actually, I'm outside of the system, and I've been advocating for this before COVID. I practice direct primary care, and now we also have direct specialty care. Patient pays a monthly membership fee, and they have something called like VIP care where they pay thousands of dollars to be VIP patients. Mine is very affordable, and I can go over the pricing. Actually, I'm glad Grant Cardone is not on the line because he would tell me that I'm not doing a good business model. But anyway, it's a monthly membership fee, and patient can see me as many times as they want to. They can call me as many times as they want to. They can text me. They have my cell phone. And Dr. Dinesh is correct. The goal for me and my patients is for me not to see them. So the goal is to keep them healthy and out of my office, because that's how they get better. They don't need, if someone has diabetes, you don't have to start giving them insulin and metformin right away. You can figure out what their lifestyle is and change the lifestyle, help them out whichever way you can. And the assurance to be able to call the physician or text them and say, hey, I think I have this. What do you think? It makes it so much easier. And that's how you restore patient-physician relationship outside of the broken system that we have, because the broken system worries about CPT codes, Medicare rules. Do you know how many in EHR, and I have Dr. Bernard here on the call as well, so he'll tell you. Well, he's, I think, outside of the system too. But if someone, do you know what they have to do? They have to click so many boxes just to get their billing department off their backs, because if they don't click smoking cessation or annual influenza or this and that, they don't get paid as much money. So that's how you fix this. It's right. A physician and patient in the room and no one else.
Right. So, Dr. Danish, I want to get your opinion on that, and then I want to go to Dr. Bernard, because he just joined the panel again to get back on the COVID topic. So, what's your opinion on Kat's model?
So I actually speak. I'm speaking next week in New Orleans about advanced primary care, but also direct primary care. I think that's the future. That's where things are going. There's no doubt in my mind that the primary care model, the way it's set up right now in the U.S., is incorrect. And honestly, I'm going to say something, and some of my medical colleagues, I know, not Kat, but other medical colleagues may not like this. But if you're going to find a primary care doctor, try to look for an independent primary care doctor, because the primary care doctor that works within the large healthcare system has actual push from the administrators who, if you have to point to someone to blame, I think insurance companies have issues. I think some doctors have issues. I think some, other healthcare workers have issues, but there is no one that is more to blame for the broken system that we have in America than the administrators that Kat was referencing. They are the cancer. They are the tumor that needs to be eradicated. And a lot of that is made, has been done on purpose. The system, everything you hate about the system is actually how the system was intended and designed to work. Direct primary care or advanced primary care or any of these new models that are emerging are the only way we restore not only access, but trust. And I wanted to say one last thing about what Catherine said about Canada. Catherine, I agree with you that access to care has some issues in Canada. And there is another issue around narratives and government control. I know in Ontario, all the awful stuff that happened. But I have to also say that at least people have access. In the U.S., we have people that are going completely medically bankrupt. And I've seen many of these patients, somebody who's trying to take care of their child and literally lose their livelihoods because they're just trying to take care of their child. I mean, it's a crazy system. So I false equivalency, in my opinion. That's just my only.
Oh, point. No, I wasn't. I didn't really make I think the problem in Canada is, I personally do believe in socialized healthcare. So I think there are better ways to restructure it, but we do have the same issue in Canada with getting access to doctors. So, I actually thought that was better in the US because you have more doctors or more, it's just that you have issues with cost. And I don't think anyone should have to think, hey, I have a pain? Can I afford to go see a doctor? But
I was just saying,
I'm sorry, I just want to comment on the cost. It's not true. That's what the system makes you believe. I have my patients pay $35 to $100 a month. Like I said, they can be seen anytime. I can get blood work for them for $3.25 for a lab, X-ray for $40, CAT scan is $150, MRI $400. So that's a lie. That's what system wants you to believe. Medicine is not expensive. Healthcare is a bureaucracy. Just remember that.
You're so right. Kat, about that. One more thing that I want to say is that as physicians, there's something else that we need to do, which I have learned in the past 3 years. For years, all I did was take care of, seek care. One of the things, and Kat, you were talking about, is keeping our patients healthy. One of the things that I've really, really got into the past 3 years is like, you know what? We need to keep our patients healthy. We need to build their immunity, and many of us were just programmed, and the pharmaceutical company comes into your office and gives you a bunch of studies. You look at the studies, you start prescribing their medications. You don't ask any questions. And so I do believe that we've learned a lot in the past 3 years, and we've learned that we need to get medicine back to being independent. I'm glad what you're talking about, Kat, about primary care. That's what we do. We're cash pay with primary care. And even specialists, they can do that, and that's the way we're going to get back trust. We're going to get back control of medicine back into the hands of the doctors that spend gazillion years in medical school.
So Justin, I want to give you a chance because you were trying to jump in there, and then I want to go to Dr. Bernard right afterward.
Yeah, I mean, look, there are trade-offs. It's kind of like, democracy, as we say, is the least worst government that you can have, right? All these things are trade-offs. So, for example, in Canada, I mean, there are more MRI machines in the city of Philadelphia than there are in the entire realm of Canada. When you break your arm, if I break my arm right now, I go to the ER, I can pretty much be guaranteed that I'll be under an MRI X-ray machine within a couple hours. Within Canada, that's not the case unless you can make the case for it. So those are trade-offs. I understand that. I will tell you, one of the benefits that we've had of sort of single-payer healthcare, though, has been
your mic, Justin. It's a bit closer to your mouth. A bit closer to your mouth.
Sorry.
Go ahead. There, Justin, you're muted.
Sorry, I'll just take you off and speak. One of the things, the benefits that I have single health.
Hey, Justin, you're going in and out. Could you fix that?
Yeah,
we'll go to Dr. Bernard first. And then...
Go to Bernard, yeah.
Welcome back to the panel, man. Dr. Bernard?
Hey, how you doing?
I'm gonna start kicking people off. What's up, man?
I'm good. Sorry, my little man just got here. So basically, I appreciate everybody's perspective on the direct primary care model, but to be clear, there's no silver bullet. Okay, so that is not the only way to slice a whatever. I don't know what the saying is, but I'm getting at. Essentially, you got to take a more comprehensive approach and really understand this from all perspectives, because the direct primary care model does not solve the issues with affordable prescriptions, does not solve the issues with regards to surgical care in a hospital, because these stakeholders are powerful as shit. And we can operate better within the system, but that still doesn't change the global nature of the problem that we're dealing with. So in my practice, for instance, I agree that a big problem is that we do care in discrete visits, and that's how we're paid. However, because of the pandemic, we switch over to telehealth, we switch over to remote patient monitoring, and I provide better care, more continuous care. And I'm able to bill for multiple things while taking care of my patients. So if they call and say, hey, they got COVID, which happened today with the patient of mine, I immediately did a telehealth visit with that patient and was able to bill for that. However, compared to other cardiologists, I probably get paid less based on what I do, but I feel fulfilled. And I left the institution because of the corporatization of healthcare and the fact that everything that we do was so driven towards making a profit. And, we can have a full debate separate and apart from this COVID-19 debate, but I think it's important not to oversimplify the issues that we're facing. And as far as the COVID and truth, the financial incentives, the big stakeholders who are dominating and controlling our policies, dominating our education. Dr. Emmanuel, mentioned earlier that this is it. It goes down to our medical education, the way we practice medicine, which is really, again, sick care and pushing medication as opposed to focusing on the environment and lifestyle, is something that we're not even taught. We're not taught about to the degree that it should be. I mean, it's only a fraction of our education when we talk about nutrition and environment. And it's a huge blind spot in our healthcare.
Bernard and Danish, just quick question for both. Bernard, Danish, quick question for both of you. The healthcare system was being criticized years ago, well prior to COVID.
Correct.
Now we saw 10% of doctors, of people within the industry, more than 10%, quit. And we were talking earlier, I think Stella or someone mentioned, preparing for the next pandemic, and that being one of the biggest risks for civilization. How unprepared are we, or how prepared are we? Because I know there's pros and cons. We learned a lot from COVID, from the manufacture of the vaccine to dealing with the pandemic, policy, etc. Yet the system, as Danish, I think you said, I think it was you, Dr. Danish, the system has never been more broken. So how would the next pandemic look like? Let's say it's in 5 years' time.
We are in the worst. I am hoping that we get into a much stronger position over the course of the next 10 years. We are in the most vulnerable position we have ever been in. If we are hit with any other public health issue, I don't think the trust is so broken right now that I don't think we'll be able to put ourselves together fast enough to be able to deal with another one of these. We are so
the main issue is trust, in your opinion. That's the main problem.
Trust, and
which is a serious problem.
We, like I was saying, of the 1 million doctors, 117,000 quit in one quarter, right? And that's never happened before. And so to have that level of, you talk about quiet quitting, this is like very clearly quiet quitting.
Where did they move to? Quit to do what mostly?
To literally, a lot of them went into early retirement. So the average retirement age has now gone down to 53 years old. That is insane. Think about a doctor.
That's crazy, man.
It's crazy.
That's crazy.
And that's where we are as a healthcare system. And by the way, I'm talking about doctors. When people say we're running out of beds, there's no problem with furniture, just an FYI. The furniture is not the problem. The problem is that we don't have nurses, we don't have medical assistants, we don't have we don't have doctors now.
So what's the solution, man? Like what's the solution? Is it technology plus? So obviously it's multifaceted. So it says technology is one, it just increases efficiency. Less red tape could be another. Better incentivization and better treatment. And the way you can get better treatment is by fixing the core problem, which is probably more transparency and better incentive alignment. Just so many things to fix. I don't know where the hell to start.
We have like,
and that's me as an outsider,
years,
man.
Right? Very, very simple. We've got to expand medical education at the most rapid pace we've ever expanded. I think we need more medical schools. We need more residency spots across the board. We will need to recruit international medical grads at a higher rate. There are some incredible international medical grads across the world. We get the cream of the crop. We have to have a cream of the crop mentality again. And we need to return to, while I disagree with Stella on so many things, and Stella knows this, I respect her point about autonomy. I think physicians need to feel like they have autonomy again. And I think that if we don't feel like we have autonomy again, you're going to continue to see this decline. This is, by the way, this is a sort of what we would call, Bernardo, a sentinel bleed. It's like the first sign. This is just the beginning. I promise this year is going to be worse than even 2022. It's I know so many of my colleagues that are quitting, and it's the narrative needs to change. I don't need anyone to call me a hero. I find that absolutely patronizing. I think what doctors need to feel is, hey, we have a relationship with our patients again, and that we have autonomy again, and we have help when we need it. I agree with the administrative work. The technology will help reduce the administrative bloat potentially, but we are in a very, very
I disagree with the technology. Don't you think that the EHR, the electronic medical records, have ruined medicine? Because all the doctor does is look at the stupid computer and check boxes instead of actually paying attention to the patient.
So I will push back on the
EHR
commentary. So the technology means a lot more than just EHR, right? EHR is one technology that was forced on us through meaningful use legislation. By the way, you talk about hurting the doctor-patient relationship. What most people don't know is that during the Obama administration, when they brought meaningful use, the head of the largest EHR company in the world, she was sitting in the same room making the policies that had led to so many doctors quitting, which is meaningful use. And so we don't talk about that part, but that technology, I agree with you, Kat, has been negative. But I think telehealth across the board has been incredibly beneficial for patients and for doctors. I think remote patient monitoring, which Bernard spoke about, has been incredibly valuable for patients, especially high-risk cardiac patients. I think, we are just at the beginning of the use of AI to help augment some of that documentation issues, with large language models now being used to reduce the paperwork so that doctors can focus on patients over paperwork. This is a very exciting time in terms of the technology that's coming to help augment the doctors. But I think that ultimately technology, I agree with you, EHRs were not good, but I have to say that we can't become Luddites. We can't become scared of technology. I think it would be incredibly, in this moment of AI, if for us to sit here and be like, we don't want any technology, I think that would be a bad decision.
Yeah, and I just want to piggyback on that and say that healthcare as an industry is in the Stone Age. I mean, we are fossils when it comes to technology, and our resistance to embracing technology at all levels, and even within the clinical trial space, has hurt us and made us less dynamic and unable to respond to things like this pandemic, but also other therapies that could potentially be beneficial. And so, my practice, I fully digitized my entire practice. We're completely paperless, and you cannot find a practice in Miami that does that. I mean, people are still doing notes on paper for crying out loud. And so that impedes our ability to acquire quality data and analyze it to not only respond to our patients, but also to be able to predict when patients are going to be in a bad state, rather than waiting for them to develop that pneumonia or heart attack and then react to it. I mean, the entire system from the clinic on up to the public health infrastructure is based on a lot of reactionary care, reactionary methods. And so we've seen that throughout the pandemic. So to answer Mario's question about where we would be if we had another pandemic, it wouldn't change. We're still piecemeal, we're still fragmented, and we're still reactionary.
Something that I would like to add about our healthcare system and the brokenness. During the pandemic, of course, telehealth became a thing, and I'm really glad that I think telehealth and remote monitoring can really help to increase the availability of physicians, because you might be in a little town in Iowa or something and you don't have that many patients, but you can reach out and take care of patients in other parts of the country if they allow telehealth and remote monitoring. The main thing that has gone, the system that probably need to be fixed too, is the cross-state licensing, which is one thing that happened during the pandemic. They were able to, with the emergency declaration, you're able to see patient cross-state. The cross-state licensing is so crazy. And with doctors quitting, that is one thing that they have to do to fix the system. If you're licensed in New York and you're practicing in New York, you have to jump through hoops to be licensed in California. So if there's something that I think that we can all agree and work towards, to me, it's all about, I mean, I don't agree with Bernard and Danish on many things, but we can agree on fixing the system. And I don't know how we're going to do this, but I think as doctors talk more and we come together, and probably doctors need to have lobbying past AMA and everything to get things done. Because if we can get cross-state licensing, it will be amazing to be able to provide care for patients across the state.
And Stella, like having you and Eugene speak on stage earlier in the space that crashed, is that just because things are less crazy now and we have time to speak, or is that probably we've learned our lesson that censorship doesn't work, communication is important, and this could show a shift? Am I just being too optimistic? Am I being too naive here?
You weren't, and at least Eugene and I spoke without being adversarial. That's good. And I really do believe that we need to stop the adversarial attacking each other and look at the places where we agree and look at the places where we disagree and understand that we might disagree, but the other person has a point. You know what I'm saying? So it's all about coming together as humanity. This is my take. As humanity, our survival is based on us coming together. For so long, we've been divided into warring factions, whether it's black, white, young, old. We've been divided into warring factions, and we don't need to be in warring factions because most of the things that are happening affects all of us. Whether it's vaccine, whether it's early treatment, it affects everybody. And coming into a place where we can talk, disagree without vilifying each other and trying to choke each other or promise death on each other is a very good thing. So I'm glad about that.
Amen. Say no to choking each other out.
Yeah. Before, so I see Barry, Nelson, Michelle, and Kat with their hands up. So I'll ask you, and any of you could jump in for this question is, if you haven't answered this question already, just for the audience, because it's a very common question we get. If they've been vaccinated, should they be concerned? I know it's not related to this particular topic, but I like to ask it for every panelist that's been on stage moving forward. If they've been vaccinated, should they be concerned? How concerned, and for how long? Because usually, I know we don't have enough studies, but in the first 30 days are more concerning than the next 30 days, and it generally gets less concerning over time. What's your position? Maybe you could go first, Dr. Kat, and then Michelle or whoever, or Barry or Nelson.
Thank you. So I would say for anyone who has been vaccinated, based on data that we have.
Your mic, Dr. Kat. Do you mind? I'm gonna go to Michelle. And you can go after Michelle just to fix your mic. Yeah, because your mic is really bad. And Michelle, do you want to go first on this one? Welcome on stage.
Absolutely. Dr. Emanuel, it's a real privilege to be in a room with you. I don't think I have yet. I'm one of the many nurse practitioners across the country who treated COVID during the pandemic. And Mario, to your point, I think we don't really know yet. And Dr. Lindley would tell you this as well. I don't want to speak for her, but we don't know yet how long this may be expressing spike protein. We don't know how long we may be dealing with levels of inflammation that could cause problems. So, I mean, I think it's great. I mean, I want to mention very quickly that Dr. Emanuel is going to have a space tonight. I'm going to have a space on Saturday night that deals with expressly that. What can there be hope for those who might have some vaccine side effects and illness? And can there be hope? Can there be something they can do? And I think we have some answers potentially in intermittent fasting, in functional medicine. I know FLCCC and Dr. Merrick, Dr. Corey have put together some wonderful guidelines that many across the nation, like I said, many NPs like me are using across the nation. And I would point to her for a little more information, her space tonight.
Yeah, and just for the audience, with this question is kind of implying that there should be concern. We've had doctors say there shouldn't be any concern, like Dr. Liza and
me. I'm happy to say that, if that's okay.
Yeah, Dr. Danish. Yeah, I think you've. I don't think you've never answered that question. I've never asked it for you.
Yeah. So no, I have not.
Oh,
but
okay.
I'm happy
Cool.
to...
I'll let you answer. Yeah, I'll let you answer it before Barry, because I've never asked you that question, so you could balance it out.
Okay. So, I would actually answer two questions with that really quickly. One, we don't have any evidence, right? Like, I mean, there haven't been any long-term studies yet. People can talk about anecdotal data, patients that have had, some sort of event 6 months, 9 months after. But across the board on a population level, we have no data to show that there are long-term side effects that present later. So people that have had vaccine-related injuries like myocarditis and others, a lot of that has occurred, within the first 6 months of receiving the vaccine. There's been some talk around sudden death, but there's actually no clear, large-scale studies that actually prove that there's any correlation around that. One thing that people should be worried about is currently there's some signal showing that with the bivalent COVID vaccine, which is the newest booster, there has been some enough concern that it has been cited as having some connection to increased risk of stroke. But again, the system is we have systems to monitor this. It's not perfect. There has been suppression. I'll be the first one to say that. But overall, amongst the colleagues and the general medical, our current understanding of COVID vaccines and the way that this vaccine delivery system is set up, I would not lose sleep worrying about whether, 30 years from now, you're going to develop something related to this if you have no symptoms today. If you do have symptoms today, it could be related to the vaccine. And I think that needs to be studied. I will say that there's also the other side of it, which is, any sort of, we don't know what the long-term impact of COVID itself is. I think if that's with 94% of people being seropositive, I think we should also be worried about the fact that a lot of people have been exposed to COVID and we actually don't know what the long-term impact of that virus is, since we know that virus would affect many, many, many cells all over your body. And so it's a very, very different mechanism than the vaccine. The vaccine exposes your body to the virus, and then your body develops that immune response, just like Michelle was mentioning, which is, ultimately your body does start producing antibodies against the spike protein, and ultimately will also, hopefully, if you're lucky, develop T-cell mediated responses to the virus so that you don't, unless the variants get have too much immune escape. And so ultimately, I want to be very, very clear. If you are one of those people that has received the vaccine, sitting there and worrying about having some really weird reaction to it 6, 10, 20 years later, it's just, there's no data to support that hypothesis.
What about people who have already had the reaction?
So people that have already, depends on the reaction. If it's myocarditis, people, a lot of my doctor colleagues will say, oh, the myocarditis is very self-limited. Yeah, until you're the person that had that chest pain, right? And so and ultimately some of those people have had pretty adverse reactions. People aren't taking those seriously enough, in my opinion, in the medical community. I think we should have conversations around it. I think with the AstraZeneca vaccines, there's a global, there's people outside of the U.S. that are listening. Some of the AstraZeneca vaccines have been related to different types of strokes and DVTs. Those are real issues that need to be addressed. But
are you worried that data is still being suppressed, Dr. Danish?
I think that the data on the short-term impact has been downplayed. I don't know if it's truly been suppressed. I think that our reporting systems are ineffective. I think that a lot of people have been given, they've not been, this is my opinion, because again, there's no evidence to prove one way or the other. But I do believe that a lot of doctors believe, and I can't speak for all of them, but a lot of doctors believe that, not everything that's happening to patients is being reported back to the healthcare system. I think that's completely not an unreasonable thought.
There are people who have died, and they're, the cause of death is unascertained, and it's, within 30 days of getting the vaccine or the booster.
Well, again, people die of cardiac arrest all the time. I just don't think that.
I'm talking about a 17-year-old male who played hockey avidly. His dad's frequented the spaces and has gotten zero answers in regard to what killed his son. And he wants answers. And it was 33 days after he was vaccinated. Those are the cases that I'm talking about. So and also really quick, if you don't mind, Dr. Stella, I also wanted to bring up the fact that the CDC is now admitting that 80% of COVID cases are going undetected. So I think it's a little bit difficult to determine. You know what I'm saying? Like to determine okay.
This is, by the way, I want to say this last thing, and I want Stella to obviously, I know you disagree with me, so that's okay. What I was going to say is one of the biggest things that we have done that I'm actually ashamed of is that no one in the establishment said, hey, I wonder why we're sending all of these home tests to patients when a new regime comes in, when a new government comes in. Did anybody wonder why we were doing that? Maybe it's because we want to underreport cases. So everybody does home tests. By the way, those home tests are not reported to the government. Suddenly case numbers go down, quote unquote, in the regular data, but we're not talking about that. And I've got to bring up again, long COVID. I know it's hard for people, depending on which side of the narrative you sit on, right? Because narratives are so powerful, to believe that long COVID is not real. I have seen patients with long COVID. My colleagues, I'm sure on the stage, have seen patients with long COVID. It's, some people were texting me. Some people were messaging me. I have to reply to this, Mario, really quick. There is clear data on people that are unvaccinated that got long COVID, and there's clear data on people that got vaccinated that got long COVID. So long COVID is independent of your vaccine status. There is some very, very poor quality data, in my opinion, showing that vaccine can reduce your risk of long COVID.
Can you define for the audience very briefly, anyone that doesn't know long COVID?
Yeah, so long COVID is, so it depends on which definition you're talking about, but usually it's 6 weeks post-infection having persistent symptoms. So that's a very broad definition of long COVID. But we do that because, unfortunately, similar to chronic Lyme and CFS, people have not been taking this seriously, and it's a real thing that people are suffering from. And so, I wanted to put that in there. That's like the most broad definition that's used for studies. And so I wanted to bring that in.
Okay, can I speak? Dennis, I disagree with you on a lot of things, but I agree with you about long COVID, and I do take care of a lot of long COVID patients, and we treat them and they get better. If you want to get more information about it, I'll send it to you because it's a whole protocol. Here's something, there are a few things that Dennis said that I think are not correct. Number one, the vaccine itself. I am a trained pediatrician. Like I said before, I worked in the emergency room. I've given a lot of vaccines. I was not an anti-vaxxer. Regular vaccines you injected in the deltoid, it stayed there, or in the thigh of the child, it stayed there. It produced inflammation. The body responded, and then produced immunity, and then sends memory cells into the system that would, let me put it in layman terms, sends chemicals in the system that remembers the virus or the bacteria or whatever, and then whenever you are introduced to it again, then your body says, oh, I know this guy, and then they can mount up an immunity against it immediately. That is how vaccines were created. Vaccines were created to use a piece of the bacteria, a piece of the virus, inject in your body and then bring this immune response. And these things, they stayed in your deltoid or in your thigh where it was injected. The mRNA vaccine is not technically done like that. The mRNA vaccine, you guys, let me put it in layman's terms. You have your DNA, you have your RNA. RNA produces proteins, which is the building block of what all of us are made of. The mRNA vaccines, basically, it's like an operating system. And I'm not saying this is not my quote. Listen to Google, the CEO of Moderna, Tyzac. He said they are hacking the software of life and introducing a code. It's like a code or an operating system. They put a messenger RNA, tells your DNA, gets out of your DNA and tells your system what to produce. So they are not giving you a piece of the virus. They are giving you a code to produce the spike protein, which should not even make sense, because if the spike COVID sickness is a spike protein disease. So for them to give you a code or an operative system to produce a spike protein disease in you does not make sense. But that is what the vaccine is. And there's something else about the vaccine. The vaccine is coated in a lipid nanoparticle, and you can read in the Moderna, a lipid nanoparticle. Why? Regular vaccines stay in your deltoid. It doesn't cross into the rest of your system. This vaccine was coated with a lipid. What does lipid do? Lipid crosses into systems in your body that are usually not supposed to cross, like your blood-brain barrier, your placenta barrier, or crosses into your endothelium, which is like the inner lining of your blood vessels. They are not supposed to cross into things like that. So this vaccine does not stay in the deltoid, as Dennis said earlier. These vaccines actually cross. There was a study actually done in Sweden that the vaccine actually reverse transcribes into the liver cells, goes back into your DNA. So they did not give you a piece of the virus the way vaccines were made in the past. They gave you an operating system. They gave you a code. And that is what Moderna and Pfizer, they're all telling you about. This is not my opinion. If you want to, like I said, we have a space tonight and we can address all that. That's number two. The second thing that the vaccine does is that it does not stay at the delta. It goes into your system. It crosses into places it shouldn't cross. So what happens when this spike protein is produced by your body? They
put the vaccine in your system, there is no turn off. There's no switch that says, okay, good, you've produced enough spike protein, switch off. Because of that, we don't know how it's going to affect your system, not today. We don't know how it will affect your system in a year. We don't know because there've not been studies on it. What happens? The spike protein, when you have COVID, it lasts for 10 days and your system flushes out this virus. And if you get treated early, like for us, proponents of early treatment, you don't get into the cytokinin storm, which is the later part of the disease. COVID is initially a viral infection. Then it comes to a place where it becomes like a systemic illness. If it is caught in the part where it's a viral infection, we can treat it. And then you don't go into the sick area that now brings the COVID long symptoms. So if they give you a vaccine that is supposed to produce the same spike protein that causes the disease and there is no turn off switch and we don't know what it does to your system, we just don't know because there's no studies. Now, what happens when this spike protein crosses into your placental barrier or it crosses into your endothelium? What does it do? It causes the same inflammation that COVID would cause. The only difference is that COVID will last for 10 days. This one is in your system. So if it causes irritation in your endothelium, it can throw a blood clot. If it goes into your heart, you get a heart attack. If it goes to your brain, you get a stroke. If it goes into your lungs, you get pulmonary embolism or any other part of the body. And then now, we don't know. They've not done studies. If you look at the VAERS report, there's been a lot of report about death and destruction caused by this vaccine. Usually, if there were 50 deaths from the vaccine, they should have stopped it and not push it on people and not force it on people and tell people these are the side effects from this vaccine. These are the treatment options for early treatment. These are the side effects for early treatment, hydroxychloroquine, ivermectin, or whatever, and let people make an informed choice. They didn't do that. So technically, this is not like this mRNA technology is not it's not like the regular vaccine. And to make things worse, the CDC has actually changed their definition of vaccine to be more of a therapeutics. So they started with take this vaccine, you're going to stop spread. They know it's not going to stop spread. No, you can still get sick. No, you can still transmit the disease. When you take a vaccine, the reason why it used to be as a pediatrician, if somebody did not take a vaccine, and there were one or two people, we knew that herd immunity happened in the community. Why? Because people that have taken the vaccine are protected. And because of herd immunity, they will protect those that did not take a vaccine. It has never been in science where you took a vaccine, I didn't take it, and it was a problem because I that didn't take it had to protect you. So there were many things that were not scientific. And I think that doctors need to go back and look at these very unscientific things that were said and look at what the vaccine actually is. Go and read what Moderna says, what Pfizer says, so that we can know the truth.
There were so many commentary there. I need to respond to some of it. I'm only going to respond to the ones that are very factual and very clearly defined. So number one,
I'd like you to respond to as many as possible because I'm really trying to understand.
And so I'm trying, Mario. Points. There was a lot of comments made, right? And so I was writing it down. I'm not kidding. And so I'm going to go one by one. Number one, around mRNA. So Stella, you know this. I don't know why you said otherwise. I'm not sure if I misunderstood. mRNA lasts in your body for a very short amount of time. There is multiple studies showing that the spike proteins that are produced by the mRNA, I'm happy to share, I know personally because I put a list together of over 20 studies done by many independent institutions that showed that it does not last. The longest was 3 weeks. Spike protein produced by the COVID mRNA vaccine, specifically the BioNTech one. There's data
not
showing,
true, Danish. I'll send you data.
I mean, I'm sorry if you don't want to believe it, but the data is there by independent institutions. I apologize.
I will send you data too.
No, but the thing is, these are high quality studies. I mean,
what we say are high quality studies too.
How many?
So Stella, how many? I'm talking about the world's best institutions. Anyways, that's one.
So Stella, just quickly, Stella, what are your studies as well? Like, how many studies do you have? Just so I
actually just you know what? The first thing about it, before you even look at high quality data, actually look at what Moderna itself talks about. Just go back to the Moderna's website and read about their vaccine. They are the one that's talking about. It's a Moderna CEO that said that they were hacking the software of life. It was not done by Stella. I can send you this information.
But that does not mean anything.
And there are many studies. I can send you many studies. I don't have a list of them, but I'll send them
with
to you.
due respect, complete respect. You're using a commentary that he made during one interview to counteract tens of studies where there were independent institutions across the world. Unless you all think that every institution across the world is colluding to try to build some narrative, it's just that there's no doubt about this specific point. I'm sorry, at least in the medical literature.
There is a doubt.
There are studies even from...
There is a doubt for people that don't want to believe data. I'm not...
There are many... There was a study from Sweden. There was a study from Sweden that actually talks about this thing reverse transcribing into your liver cells. There are studies, Dennis. You just don't want to believe them either.
I have not read that study. I'm happy to review
I will send them to you.
But the studies that I have reviewed across the board, specifically, I'm going one by one. I'm so sorry. We're kind of jumping. Reverse transcription into liver cells. I have no... You would need reverse transcriptase, which I believe the liver cells have, which is what makes them regenerate. But the point really being, ultimately, mRNA does not last in your body very long. And the spike protein that's generated. And so, part of the commentary on software versus... So the distinction is your genetic code is your hardware. The mRNA it produces, but just so everybody knows, your body already produces mRNA. Just like Stella mentioned, actually. So when your body wants to make a protein to, like something like insulin, right? Your body wants to make something. It makes a mRNA that then gets translated into a protein. So think about your insulin spiking, your insulin coming down all within one day. That's actually done using the same technology that she's talking about. Now, I agree with you that this is potentially a newer technology. So it's not like other vaccines. So applying what's happened in other vaccines is not a clear one-to-one. And I agree with that. And I also agree that there are tons of people out there that have had myocarditis, young men that have had myocarditis, and also DVTs using the AstraZeneca. I mean, I'm not disagreeing on everything. What I'm disagreeing on is when you're making commentary around, hey, your body's going to be making spike proteins for the rest of your life. It's just like not the case. We don't know that. And there's no data to prove that. If I can see high quality data that shows...
I'm glad you said we don't know that.
I'm sorry.
I'm glad you said you don't know that.
No, but the data clearly shows otherwise. So medicine is evolving. I think if anything, we should have some humility around the pandemic. Ivermectin didn't pan out. Maybe if you would be willing to say that, that would be helpful. You've seen the studies.
No, it works. I have over 300 studies that ivermectin works. And personally, we've seen over 100 and something thousand patients that it works, Dennis. You need to listen.
Again, this is a great example. We're seeing it just like people are clinging to ivermectin in this way, even though there are other early treatments that have actual data that prove that they work.
All of them have data. Fluvoxamine, ivermectin, hydroxychloroquine, they all have data.
I'll stop talking after that. I promise. I'll let other people. I just think I want to be the counter argument because I think that a lot of people don't agree with me, which is completely fine. I don't care if people agree with me. I just want to speak from the science, from my perspective. All I was going to say was that there is this weird narrative-based zealot, like this is my camp versus your camp. And it's just not the right way. I have to tell you, when we didn't know what was going on, a lot of us were using hydroxychloroquine. Now the data shows it did not improve outcomes in multiple studies done by multiple. Hold on. The data says what it says. And I think there's general understanding that hydroxychloroquine did not improve outcomes in patients that were severely ill.
That's not true.
Again,
how many patients do you see COVID patients?
I'm not sure.
I know. No, let me ask you, Dennis. How many COVID patients have you seen? Let me ask. Let's get back to the nitty gritty. I'm a primary care physician, and we've seen over 100 and something thousand COVID patients. How many have you seen?
Well, I don't know how you've seen over 100,000 patients. How many patients are you seeing a year?
Oh, my team.
So it's not just you.
We have data.
So my team has 24 doctors, primary care doctors. I lead that organization called Resilient Health. We have seen hundreds of thousands of patients as well. Primary care. You can Google it.
Have you treated COVID patients with ivermectin and hydroxychloroquine and it didn't work?
We have no. I have not.
Why don't you come and look at my data? Why don't you look at my data?
This is so confusing. You're telling me,
Dennis, it is not confusing.
It is the medication that doesn't work. Then you don't know
Dennis,
whether it works. It's like
why don't you look at my data? I will give you access to my data and you look at it.
Again, multiple studies have come. I'm happy to look at it. Thank you so much for offering. My point is, multiple studies have come out that have shown. Again, this is. I just want to comment on the space in general. There is this like zealot nature, which is like, no, I've done this thing and this thing, just like that. There are some crazy ass doctors that are like, no,
Dennis, you hold on. No. Don't call me a crazy ass doctor. That's wrong.
I'm talking about that side.
Okay, great. Don't say that.
I can't believe he's allowed to say that to her. That's really unkind.
Can I just
don't say that?
Can I finish before you guys make assumptions?
He didn't call her that. Yeah, continue, Danish.
No, my point was there are some crazy doctors on the other side, not your side, on the other side that believe that even if you're a young man and you're completely healthy, you're a professional athlete, that you need to get the vaccine or you shouldn't be able to play. I think that's absolutely ridiculous as well. That was the point I was going to make. So the point that I'm making is we sit in front of a patient and we've got to have a conversation that's about that patient. You should have one. I don't believe that ivermectin improves outcomes, but I believe in your right to prescribe it. And I think that's the thing that we should be talking about. I think that this whole like zealot nature of like, no, I have to be right because I did all of these things. It's like, it doesn't help anybody. We have to look at the evidence, just like you were asking people to wait on the evidence. Now that the evidence is here, maybe it's time to reevaluate because medicine evolves.
Dr.
I will never say that you're crazy,
real quick, because what he points to is really this dogmatic approach to healthcare on all sides. I mean, people are double down on their belief in one thing, that they're against the vaccine, that they're against ivermectin, they're for ivermectin, and everything that they see is viewed to that prism. And you have to be able to.
There we go. Bernard, it's confirmation bias. I want to ask Bernard before you jump in. I want to ask Danish and Stella. I'll start with you, Stella, and then Danish. What would, and I know a lot of hands are up, so we'll go to other panelists in a bit, but Stella, what would change your mind? Think about it. And what would change your mind on the beliefs you currently have? And Danish, I have the same question for you.
What would change my mind on early treatment? I don't think that on early, because see, I'm a very strong proponent of early treatment.
On early treatment and the vaccine itself.
Number one, I'm a strong proponent of early treatment. And number two, I believe that COVID is completely treatable and preventable. And we should not be forced to take a vaccine that can even cause one case of a stroke.
Understand. But what would change your mind on this belief? What data do you need to see to be like, okay, maybe I was wrong? And I'm going to ask the same question to Danish.
I'm not against this. My issue is people need to have a choice. And I think Danish and I totally agree on that. I'm saying that COVID is completely treatable and completely preventable. And people should not be subjected, especially young people and children that don't even have a serious COVID disease. They should not be subjected, forced to take a vaccine. People can choose to take a vaccine if they want to.
Stella, you're really good at making your point, and I understand your point. What I'm saying, and that's why, so it is a tough question. I do ask it a lot, not only when it comes to COVID, but what would allow you, and maybe Danish, if you want to go first, because it is a tough question, what would change your mind? What would be like,
I will not change my mind about people
not now. Not this point. No, people being forced is obviously very difficult. About early treatment and your beliefs on the vaccine, or your thoughts on the vaccine.
I cannot change my mind on early treatment because we've seen so many patients do well. 80-year-olds with diabetics, 80-year-old diabetics, people obese. We've seen so many people do well. Listen, when you do medical studies, like when you do, if you do medical studies and you have a control group and then you find out that the other group is doing so well, in fact, you are mandated ethically to actually stop the studies if you see that it's doing well. So telling me what will I do to change my mind about COVID is completely treatable and allow people to be treated when I have seen the results of it. It's not even ethical for me to change my mind on that.
Danish, same question for you.
I think as more information comes out, it becomes, I'll give you a very simple example. a lot of people were talking about potential efficacy of fluvoxamine. Stella might remember, there's a very well-known professor at WashU. She's a psychiatry professor. She actually suffers from long COVID herself, actually. But, Dr. Rierson, when she was doing the studies, I was at WashU. And so at the time, and so, we were having conversations around, I was like, Angela, are we sure that there's enough early, hypothesis generating evidence, right? Like, so in the beginning, when you have anecdotal evidence, it should generate a hypothesis. And she was a psychiatrist that was taking care of patients. And she was like, Danish, I'm seeing these patients do better with early treatment with fluvoxamine. And, I remember I was skeptical. I mean, I'm a doctor. I'm supposed to be skeptical of new treatments until there's data. That's actually like how we are supposed to work. Supposed to be like, just like with vaccines, with everything, we should be skeptical. And so, when I saw the data, multiple study after study showing that fluvoxamine improves outcomes, there's no like, what would it take? That was enough. It was multiple studies done by multiple independent institutions that showed that early treatment with fluvoxamine improves outcomes. It became very clear to me that was the medication that worked. There's been a couple of really good studies on metformin, and I'm nearly there where I would say, look, it should be part of our protocols. So, I am very open-minded about early treatment. I also know that for some patients that are super immunocompromised or even mildly immunocompromised, obese patients, vaccines have helped them not have I've seen it with our own patient population, right? Like they were vaccinated, but high risk in any category across age, across other items. And so, we now know that, that the vaccine could have, you're looking at patients that are high risk that got the vaccine and patients that weren't high risk, and hospitalizations were less. And so, look, at the end of the day, my biggest concern about the vaccine is its effect on people that are healthy. Like, do we know if there are certain, a lot of times when you do these really large scale studies, you miss out on personalization by patient, which is why doctors should be having that conversation of informed consent. Do I think the vaccine works? When the older variants, the vaccines that were built against those older variants worked for those older variants. I am not as convinced that the vaccines and the repeating booster affects the newer variants. And so I've also changed my mind on that. So I find myself to be very open-minded. I don't believe in like this fiefdoms, like, oh, it has to be this way. There's no such thing. Medicine is completely not built like that. It shouldn't be.
Yeah. So Stella, I want to give you, or actually, Dr. Bernard, I'll let you respond to that.
Thank you, Nick.
And then we'll go to Stella, and then we'll go to Hans.
Yeah, I actually want to speak to when I changed my mind. So this pandemic is dynamic. I mean, COVID-19 and vaccines and treatment, early therapeutics, it's dynamic. That's how science works. And so I could give you two specific examples where my mind was opened by quote unquote people that were the Looney Tunes, that were the anti-vaxxers that allowed me to actually investigate further rather than shut it out. So one is with regards to natural immunity. It's still ignored by the CDC and FDA till this day. And I think even on the anti-vax side, they ignore that when they do their analysis. But the data is incredibly robust, published by highly reputable journals such as The Lancet and New England Journal of Medicine. You have hundreds of thousands, actually millions of patients that show that it works, and yet people still ignore this. And so that's one example. Another example is gain of function research in the Wuhan lab. I mean, you can't find a doctor that would say that publicly that is part of the establishment in terms of like working for a healthcare system or a university to acknowledge that. But it's plain as day that they were doing gain of function research in the Wuhan lab at the time that this virus was first discovered, and that's being completely ignored, and we're being gaslit about that. So you cannot be dogmatic about this. You have to be open to new information. You have to be able to change once you're confronted with information that's undisputable.
Awesome. Stella, I want to give you 30 seconds to respond to those points if you want to, and then...
I agree with Bernard. And Danish, I agree with you about fluvoxamine, but COVID is not something that is treated with one thing. Like I said, we use hydroxychloroquine, ivermectin, we use budesonide, we use fluvoxamine, we use Z-Pak. So we have in fact, most of the early treatment protocols that were used initially with Zelenko and I, late Dr. Zelenko, is stuff that we put out early, and we found, and many physicians adopted it and they are using it. So I'm not again saying fluvoxamine or metformin. I'm just saying that we as doctors, I am a proponent of early treatment because I saw it work. And I do believe that if we have medications like metformin, fluvoxamine, ivermectin, hydroxychloroquine, budesonide, prednisone, or Z-Pak, that are medications we already know. I think that I would not say let's jump and mandate people to take a vaccine which is not like the regular vaccines. And guys, I wasn't an anti-vaxxer because I'm a pediatrician. I trained pediatrician before I worked here. So I've given many, many, many vaccines. So it wasn't like, oh, I'm an anti-vaxxer and stuff. No, this is just, it happened because I started looking at why are they stopping me from taking care of patients? Why is this happening? So I'm just saying that I'm glad we're all talking, Dr. Bernard, Dr. Danish, and all. I'm glad we are talking, and we need to keep talking more because it is in this talking that we're going to get together things that will help humanity.
Daniel, I got to give you props when it comes to early treatment because that's something that was ignored by the establishment. I mean, anytime there was a discussion about early treatment, all we got was an auto reply vaccine, and patients were literally not getting treated until they presented with ARDS and the ER. So props to you on that. So I want to first acknowledge that point of alignment. But I do have a question for you about other treatments that have emerged during the course of the pandemic, mainly Paxlovid, and do you use that in your practice, and how do you feel about that?
I've not used Paxlovid, and the reason is I looked at the safety profile of Paxlovid, and it didn't look good. And number one, and because I already have a protocol that works in all age groups. I went to medical school in Nigeria. Hydroxychloroquine can be taken in pregnancy, in newborns, in old people. We had medications that were efficacious, very efficacious for the patients that I've seen. And I'm talking about over 100 and something thousand patients that we've seen, my team had seen. So knowing that, then Pfizer, that did everything to make sure that we didn't get it right, brings on Paxlovid, and it doesn't have a good safety protocol. It has rebound, and we already have effective medications that are not that expensive. So I will not go into Paxlovid. I would agree with other things, but not.
Perfect. Thank you, Stella. So before we go to the hands, I want to say, put your replies down there, bottom right-hand corner, the purple. We'll try to get it to our doctors here. But phenomenology, go ahead.
Hey, first of all, Dr. Stella, I also know hundreds of doctors who've treated with protocols similar to yours, so I sent you a DM. I'd love to connect. But I want to say part of the problem and what is kind of hamstrung doctors and put blinders on them to some of these protocols is the hospital system. When we had independent hospitals that were doctor-focused, physician-focused, owned by physicians, owned by churches, healthcare was affordable, doctors were paid well, and there wasn't so much bureaucracy. And so, as you know, doctors spend very little time. They have very little time per patient, and even the nurses are stretched thin. And they can't really, there's really not much autonomy at all to go outside of what the hospital standards of care is. And that demoralizes doctors and it dehumanizes patients and medicine. So it's going to take some brave disruptors, kind of like what Elon is doing here, to disrupt the hospital system and return it back to the patient and the doctor. And I just want to also say the monopoly of the American Medical Association must be broken up. It is just as bad as big tech. You know, it sells doctor information to pharmaceutical companies. Just in 2012, you know, they don't really report this, but there was a report in 2012 that just on CPT code books alone, they made $71 million. And so they have a monopoly on the universal billing codes as well. They have a monopoly on CE credits, which tells doctors like what to believe and what not to believe, what to treat and what not to treat. So we really need to decentralize these associations. There needs to be competition for the American Medical Association, and there needs to be more competition for hospitals.
So I definitely agree that the AMA is trash and completely compromised. I mean, that they're bought and sold by pharma.
We're actually having a space tonight on early treatment. Danish, Bernard, I would invite you to join and You might get something, you might not, but I will invite you guys, Mario, you guys join in about an hour. 18 minutes. I want you to come and talk.
It's been 8 hours, Stella.
Okay, that's
I've got to collapse. But I have a question. Actually, Catherine, I'm going to ask that question to you. Like, why is that question so difficult for especially, actually, I find it more difficult for doctors in politics and medicine. It's probably the hardest. It's the hardest to answer. Is what would have you change your mind? I asked that question to Dinesh, I asked it to Stella, and I've asked it to many other doctors. What are your thoughts on this, Catherine? And then I want to, after you give me your thoughts, Catherine, I want to ask that same question to Dr. Molly and Bernard. What would change your mind on whatever you believe right now regarding the vaccine, early treatment, and anything else regarding COVID?
My answer is simple: empirical data. That's it. Done.
Dr. Molly?
I would say it's clinical outcomes, and I don't necessarily agree that it's all empirical data, because we know that the data has been corrupted throughout this, and it's not been reliable.
Yes, so what?
A newsflash.
Yes, but
outcome.
Go ahead, Bernard. No, go ahead, Bernard.
No, I was just saying, that data outcome is a form of data. So again, the data is the data. The question is it empirical? Like, is it vetted? Is it actually telling you what is actually happening, or has it been compromised? And I think that's a question that we always need to ask. But if we get data that's been vetted and universally acceptable, that's slapping me in the face, of course I'm going to change my analysis based on that information. I think all too often there's too many people who don't change their analysis, and they just double down on their belief. And there's too much of that on all sides, including the establishment who says that they follow the science, when in fact they're not following the science and ignoring quality data just to double down on a conclusion that they believe in.
Dr. Bernard, with all due respect, we all know what you think on this. But what I'm saying is what I'm reading in a medical journal does not correlate with what I'm seeing at the bedside. And I can tell you that the reports to VAERS are considered to be 1% of the reportables. And I'm telling you, in the ICU, nobody was reporting vaccine injuries to VAERS. So yes, there's data and it's published and you can go look it up. However, it is not trustworthy, and that has been proven. So that needs to be a caveat to that.
That is your perspective.
So what is the alternative? Molly, what is the alternative? Sorry, Bernard. I've got to ask this because this has been the challenge. Do we just do as we want? What is the alternative as a community? If you can't believe the data itself, then what do you believe? Just what each other is saying? Like, we just kind of do it as we want?
Danish, I asked you a question earlier that how many COVID patients have you personally taken care of? Because you see, sometimes when a situation happens like this, the reason why we don't believe, like, remember the first Lancet study? The huge Lancet study that was done by two guys in their basement that did a study that said hydroxychloroquine doesn't work. And then they found out that it was a fake study and it was withdrawn. Or the one that was done in the Defense Department or in the VA hospital, that they took patients that were almost dead and gave them hydroxychloroquine and they died anyway. So I'm just saying that there was a lot of, Molly is right, there was a lot of skewed data to go against the narrative of early treatment. So what do we do is, Danish, we listen to each other as we're doing right now, and we encourage doctors to speak, because if we follow the medical industrial complex, it's going to affect all of us.
Wouldn't that, if everyone just relies on their own data and speaks, wouldn't that just be everyone relying on anecdotes?
But
that's how we practice medicine. That's how we practice medicine.
That's not how we practice medicine. We practice medicine based on evidence.
But we practice medicine based on evidence. Like I have evidence. That's how we practice medicine. Like I've told you, Danish, I would gladly give you access to my data. I would put it together, hundreds of thousands, and send it to you to analyze it. If you want to, let's do that.
Keep in mind that one whole side of this argument has been censored and silenced completely. We haven't even been present at the discussions because we haven't been invited to our medical societies because they wanted us to do things we didn't need to do to show up, like get a shot or wear a mask, things that we didn't believe in and we're not going to do. So we've been completely eliminated from this discussion. And I'm tired of people saying that evidence-based medicine comes from places like the New England Journal of Medicine.
clinical observations and clinical experience is relevant evidence. And when I'm treating patients, if I see 100 patients that respond to a medication, that is valuable information. It doesn't have to be published in a journal that's sponsored by Big Pharma to get my approval and be incorporated into my clinical practice.
So Dr. Stella, on that, do you believe, what do you believe the motive is behind these journals to publish these studies? Do you agree with Dr. Molly that it has to do with their connection to the pharmaceutical industry?
They actually are. That is why I said that they were nefarious earlier, and I really say that, like Dr. Bernard Danish and all of us physicians, we are all the prey, and we need to listen to this. I remember a case where they did a study in Minnesota University, that said they wanted to use hydroxychloroquine to see what it stops prevention of COVID, and they said they actually misrepresented the data. They actually said that they took patients and then they gave them this medication, and then they gave them medication after they were exposed, and then immediately they said it didn't work. A few weeks, maybe a week later, they got a lot of money from the Gates Foundation. There are many people that are doing studies that are being funded by Big Pharma or people that want to sell vaccines. We need to look at this stuff. Like I said, we need a postmortem. We need to talk like we're doing right now. I think Molly just said it. I just got released back to be able to even speak on Twitter like a week ago. My voice was silent. I was abused. I was called names just because I treated patients. So we did not have a voice at the table. And now that, God bless Elon Musk, we have a voice at the table, we need to talk more.
Yeah, so Dr. Actually, Justin, go ahead.
Yeah, I was going to say, I think a good framework for this is just understanding that there is science, and science can be debated on several different levels. And then there's the science that rises to the point that it's being considered for policy. And that's why I always think you got to separate these two, because as I always say, it's like when we were, working with Scott Atlas at the White House, a lot of people would demean him and say, well, he's not an epidemiologist. He's a radiologist. But no, he had spent the bulk of his career applying science to public policy. And that's what you needed in that role. And so I think when we look at these things, I have 8 kids. Okay. And I remember one kid we had, this was 2 kids ago, and it was a really weird situation. For some reason, we just could not get this kid out. And so a shift change came, and a nurse who had been there for decades came in and says, why don't we try this technique? And she tried this new technique. Instantly we had success, right? And there was no formal study that she had. There was no something written up about how to do that. It was just her practice, her experience that came into application. And I think what we're saying, in certain states, it was absolutely forbidden to actually prescribe ivermectin. I know, for example, even Amazon stopped selling NAC over the counter because they were afraid that people were using those as treatment methods for, protecting themselves against a COVID infection. That's ridiculous stuff. And so that's where the politics entered. That's where everything came into. We could say this is a viral respiratory pathogen that has a mortality, a median age of death that would be about 29, which is what the 1918 pandemic was. But with COVID-19, it was 80 years old. That should have helped dictate some of the policy, but we treated everyone the same in many ways. It was so ridiculous, right? That was at least my interpretation. But again, science, the data that we get back saying the median age is 80, John, Ioannidis coming out and early in March and just laying out, here's what he thinks the data is. And he's been proven right again and again on this thing. And then the application of that into policy. So I would encourage us to think about things not axiomatically, right? A study can say X, but its application into policy, into legislation now, we've got to be thinking like a lot smarter than we have been.
So Dr. Molly, I want to kind of hit on his point a little bit. So doctors who didn't follow the studies in these medical journals, were you worried about the possible repercussions of that? Such as prescribing ivermectin and using that as a treatment for your patients?
No, I wasn't, because my patients were getting better, and patients who are happy and satisfied and alive don't sue you. So one of the problems is that the immunity from liability, the liability shield, was enacted to cover, quote, approved countermeasures. So the hospitals came out with these protocols, these treatment protocols, because they wanted to evade liability. Well, let me tell you what, the 1,500 plus people I have that died probably wouldn't have sued me if I would have given them ivermectin and they lived, right? Now, they're not going to sue because we're under a liability shield. But this is what drove that policy. But no, I was trained, and so was probably every doctor on here. You do the right thing for the patient and let the chips fall where they may. And if the medical boards have questions for me, I'm happy to answer them. But you know what question the medical board didn't ask me when they were harassing me? They didn't ask me to see my patient outcomes. They didn't ask me, how did your patients do? And that's the most important thing. And the other point I want to make while I have the microphone is that the value of the vaccines are inflated 1,000% because the hospitals didn't figure out there's a viral phase to the illness and there's a cytokine inflammatory phase to the illness. So when we're looking at outcome data, we're comparing this to alpha when the survival was still 99 point something percent for most adults, right? That was before proper treatment. When you go into a hospital now, you're still given remdesivir and you're in cytokine storm, which is an inflammatory condition. It's not a viral problem. And so why on earth the hospitals let people die by undertreating them with steroids? They didn't give the maximum dose of steroids. They didn't give every possible thing they could to help somebody in that phase. And they didn't even give antibiotics in a lot of situations. So the mistreatment in the hospitals is something we need to definitely look at as we do the postmortem on this.
I gotta run, you guys. You're awesome.
One
we'll
part.
talk soon.
I'm sorry, Justin. One thing I was
Thanks,
to respond to one thing.
Yep, go ahead, Dr. Dennis.
Yeah, sorry. What I was going to say was that, in a lot of these conversations, we have to be very, very careful about being callous about the mortality rate. Mortality and hospitalization is not the only effect that occurs with COVID. Again, there's tons and tons of data. Now, I think it's a lot more with the older variants there than they are with the new, in terms of the data and the evidence. But long COVID is real. There are patients out there whose lives have been changed from COVID infection and post-COVID. And again, it's independent of whether they had vaccines or not. I'm actually, as I mentioned, I don't think the evidence is enough to show that vaccines have any effect really on long COVID. There's 1 or 2 studies that do show some impact, but it's not very clinically significant. And so ultimately, to try to say that COVID does not affect people unless you're 80 years old, I understand that sentiment because of mortality data. But when it comes to long COVID data, I don't think we can ignore that.
So I'm not saying that at all because I was in the ICU and took care of 40-year-olds who died. But what we do know when you're talking about long COVID, that's another discussion. And you know what lowers your risk for long COVID? Being treated with early treatment with things like ivermectin and hydroxychloroquine.
Yep, early treatment. Mm-hmm.
Again, I would love to see the
believe
high-quality evidence that supports that. I haven't seen it. I have not seen high-quality. Again, Stella, even if you show me your data would be a retrospective cohort, analysis. It would not be a randomized controlled trial evaluating. Again, specifically for long COVID, fluvoxamine just had it was just published. I believe it was in the Lancet, which I know nobody believes for some reason anymore. There have been some
Lancet
bad
Lancet has given us bad vibes. Dennis,
I know. I
we
get
have
that,
protocols.
But fluvoxamine has been connected specifically with reduction
Yeah,
of long COVID.
fluvoxamine works. Danish, we have protocols for long COVID. If you want me to give you the information, I will. You can DM me and I'll give you the information. If you're interested in,
specifically, I'm sorry. I want to clarify my comment. My comment was specifically for the role of ivermectin in reducing long COVID. There's no, in my opinion, high quality studies that prove that. I have to say that to this point.
Okay.
At this point.
Okay. All right.
Good.
So take some information and then look at it.
Hang on, Dr. Marley. I'll let you answer right after Stella.
Let me say something about, we treat long COVID patients, and long COVID is not just about giving them ivermectin or hydroxychloroquine. Long COVID involves immune support. You understand what I'm saying? One of the things that we do, immune support, high quality vitamin D, vitamin C, other immune modulations like pomegranate and other things that you can use that we used to, as a physician, we used to laugh at we used to laugh at people that push vitamins and stuff like that, but we have actually learned that building our diet in America is like really, really horrible. So we don't get enough of the vitamins that we need. And for example, doctors got vilified for just saying vitamin D can actually help you not get viruses in the winter. So we have protocols for long COVID and they do work, and we've seen a lot of it work. So Danish, if you want, I can
send it to you. If you said no, you can't look at it till you get a study from the Lancet. I don't even believe some of the studies, but we can help you to start taking care of patients for real. And you can try.
Well, I think vitamin D is an example of not using evidence-based medicine. Yes, low vitamin D is associated with poor outcomes with COVID-19. However, replacing that with a pill has not necessarily improved outcomes. And there's a difference between getting vitamin D from a pill than getting it from the sun. And so I think, can you guys hear me?
No, I can hear you.
Okay, yeah, there's a difference between getting vitamin D from a pill than getting it from the sun. They're two very, very different things. And I think all too often people are focused on both sides on giving vitamin D without telling people how to get it the most natural way, which has actually been shown to work in terms of outcomes.
Okay, may I jump in?
Hang on one second. I got to go to Dr. Molly first because she was trying to respond.
Yep, I just wanted to point out that if you
I think
practice
they've crashed
medicine,
this space again.
if
We've
you
been
practice,
arguing all day on a COVID treatment, and
Hang on.
Stella, we can hear you.
Yeah.
Stella. I got you, Stella. I got you, Stella. We've been arguing all day. No, all good.
Oh my
Much
goodness.
love, Stella.
Yeah.
Oh my goodness.
Okay, let me try again. So if
ahead.
basically your practice in medicine is dictated by randomized controlled trials, number one, you're not going to be able to respond in the middle of a pandemic because we don't have time to do trials to treat patients, number one. Number two, you're going to be beholden to on-patent big pharma products because nobody is invested in proving that ivermectin is effective for long COVID because nobody's making a ton of money on this. So there isn't anybody who's going to foot the bill for that. And the people who did foot the bill and do these studies, it got blocked at the last minute. You can listen to Pierre Corey's saga about how all of their journal articles got pulled and, at the last minute retracted. So there's some corruption and bias in what gets published and how, if that guides your practice, then so be it. But some of us want to go with the art of medicine where we combine different sources of information as evidence.
Yeah, I want to follow up on that point too. Dr. Danilo mentioned fluvoxamine a couple of times. I'm a big fan of this medication because it's in my wheelhouse. It's an antidepressant. And when I saw the initial published study on fluvoxamine, I was very excited about it as potential early treatment for COVID. But an interesting fact about that medication is that initial trial for COVID was funded not by the NIH or by any other major public health agency anywhere in the world. That trial was funded by our friend Steve Kirsch, by a private
and I'm
citizen,
aware. It's crazy. Yeah.
Which is crazy. So this is just to sort of drive home the point that unless you happen to have a private philanthropist that very few of them are willing to fund clinical trial studies, maybe we can encourage more philanthropy in that regard. But given the budget of our public health agencies, the fact that the NIH pulled its funding and its plans at the last minute for a randomized controlled trial of ivermectin is very concerning. The fact that it was a private citizen and not the NIH that funded the trial of fluvoxamine. The fact that much of the really interesting research came from outside of the United States in places that are, pretty much on the periphery of biomedical research and therefore not beholden to the power brokers and the stakeholders in our federal public health agencies. Places like Israel and Qatar produce some of the best data on COVID and some of the most interesting studies. Their budgets are a fraction of what we have here in the United States.
Aaron, who's funding those studies? That's what
exactly.
It's a conflict of interest. Doesn't mean the studies are completely biased, but there's risk there.
It doesn't. But I guess what I'm trying to point out is that the studies that aren't done that's just as significant as the studies that are done. So it's all fine and well to say, we have to practice evidence-based medicine. And wouldn't it be great to have a randomized controlled trial of all the important questions that we have to deal with in medicine? But there are currently systemic issues that skew randomized controlled trials in exactly the way that I think it was Molly, whoever just spoke, described. But there's also difficulty once those trials are done, getting that information to the public. And I mean, to this day, I'm still puzzled by the lack of information made available to the public on fluvoxamine. Like, how many people heard anyone recommending that particular medication for COVID? Hardly anyone. And I'm glad
why do you think there is that?
Because there's no money.
Sorry, Aaron,
Go, Danish, go ahead.
Because there's no money.
I wanted to kind of bring this up, which is, what about those studies that disprove a hypothesis? So I mentioned a study. I'm happy to share it. I think I shared it with you, Mario. Feel free to post it if you'd like. Very high quality study that the Together trial and then other studies that were associated with it, but also other studies out of Brazil that did a comparative evaluation, comparative effectiveness research, CER, specifically evaluating the different impact of ivermectin versus metformin versus fluvoxamine versus other early treatment. There was another arm. I'm sorry, I can't remember right now what the other arm was. I may have been just placebo, but please don't come after me, Twitter, if I'm incorrect. And when they evaluated those, the only one that actually had there was placebo arm. That's right. Because the only one that actually had any positive effect as compared to placebo was fluvoxamine. Again, we agree that early treatment has a place. I have now, I hope, proven to the Twitter army that I believe in early treatment when there's data to prove it. Hydroxychloroquine was the other one. Sorry. When we're evaluating this, when the data comes out and it proves against one group, what I'll call one, the problem we went from one central consensus that ruled the world with whether the evidence proved it or not. I'm talking about the general narrative. And now we have polarized into two main narratives. One is that everything with the vaccine is wrong and everything with early treatment is right. And the other group, which is ridiculous to me, which is everything with the vaccine is right and everything with early treatment is wrong. Isn't there a possibility that both groups are incorrect? Isn't it now that data is coming out that ivermectin may actually not be as impactful? Could we look back at our data and say, hey, maybe that was my biased sample where I treated these patients and they had a positive outcome? Because, by the way, that's how science works, right? And perhaps if we did,
absolutely.
I just want to be clear about Brazil specifically. Over 200,000 patients.
I would like to.
So what's
my point?
Aaron, I'll let you jump in, Aaron. Aaron, I'll let you jump in. I want to add one thing as you clarify that point. So what I'm essentially seeing, because every person that's making a point has studies, but it looks the audience doesn't know who to believe. Every person has studies, right. So it just looks to me like a mix of confirmation bias, studies that are either corrupt or biased, or inaccurate in one way or another. So if you mix those two things, then just lack of trust. Confirmation bias is probably I find it to be the most dangerous from what I've seen today on both sides of the aisle.
Yeah. So let me just clarify my position on early treatment. I am agnostic at this point about hydroxy and ivermectin. I have close friends that swear by them. Pierre Corey is a good friend. I've collaborated with him on medical freedom issues. Others on this call, I do respect and listen to their clinical experience. That is a form of evidence. It's not. It's neither the best form of evidence nor is it negligible. But to be honest, I have not read all of the relevant studies on the early treatments, except for fluvoxamine, because it's one I'm comfortable prescribing. And so I am not trying to champion those medications, and I'm not. And I realize what I know about ivermectin, for example, is that there's positive studies and there's negative studies. And I've dug into some of those studies, but I haven't dug into all of them. My only point, the point I was trying to make is, why is the kind of study that you described, that kind of direct comparison, large sample size, not pharma funded, in this case, it was done out of Brazil. Why was that study not done by the NIH? like right out of the gate, right in 2020. I think that's an important question to ask about the system as it's currently configured in the United States, because that study should have been done 2 years ago, after the initial small imperfect studies on any of those 4 treatments came out. We should have had, 2 or 3 studies like this, federally funded, and they weren't done. And instead, what we had was a censorship context and a smear the other side context that set us up for, I think, precisely the kind of polarization that you described, where people got into a kind of all or nothing thinking. The vaccines are only evil and harmful, and early treatment is always good for everyone, or vice versa. I think we set ourselves up for that by our lack of proper systematic response, and early on from our public health agencies. And I think we need to be thinking through the question of why that happened, why the best research came out of Brazil and Qatar and Israel and not the United States, when our resources dwarfed theirs in terms of funding studies like this. It's a really, really important question, because in a sense, the polarization happened in part because people who raised questions, people who pointed to small imperfect studies to try to say, well, we do have some evidence to do this, so why are pharmacists not filling this prescription? They were silenced and smeared, and that's a good way to push people into a kind of let me dig in my heels and fight for the basic right to prescribe a medication, or the basic right to point to the admittedly imperfect evidence that we have as a basis for my clinical practice.
Eric, good to have you back. Eric, what's your stance on the discussion? Because I know I've seen you I've seen you write about it. I've seen you in the space a few times as well.
Yeah, so I mean, my stance is that no one should ever be.
I was asking. Sorry, Aaron. I was asking Eric.
Oh, sorry,
Eric just jumped in. Eric Weinstein. Oh, good man. Oh, good.
Good to be with you. I mean, I guess. So here goes nothing. We say things like, well, that's how science works. And we're not honest with ourselves as PhDs, for example, about how science actually works. Let me say how science actually works. If you hang out in an academic department and you go for, let's say, the department T, everybody agrees that you write a grant proposal based on work you've already done. There's no documentation that that's part of the new scientific method. Let's call it the new scientific method. Maybe you'll have a provision in your grant application that defends your theoretical work with a practical implication. Let's assume you're not in biomedicine. That's part of how science works, or how you flatter a reviewer, a likely reviewer, in their work when you deduce who it is that's reviewing your paper, even though they're supposed to be anonymous. There's an entire science plus culture that has to do with how actual scientists remain employed and advance in their fields that is not part of the simplistic idea of the hypothetico-deductive method. And when we talk about, for example, the Matthew effect, the Matilda effect, the idea that science progresses funeral by funeral, you'll notice that none of those are encoded into the scientific method either. So what is happening is you have a schizophrenic, and I'm using that in its colloquial, not its... I know I'm going to pay a huge price for saying it. We have a theory of multiple minds where we lie about the simplicity of science. We say that science is some simple, beautiful thing. Everyone finds out that that's false. Now we've lied about what science is because we are not comfortable with what science plus really is. And what you're seeing is the intellectual backpropagation from the rules of the EUA. What if ivermectin is slightly effective? Does that mean that you can't prescribe the vaccines because they're experimental? So what people have a clear idea of in Washington is what has to be true so that we can do what we need to do, and how do we make it true? This is also, for example, how you would hire somebody from abroad is you come up with a job description where they are the only person in the world who can fill that job. This is well known to everybody who does immigration law, but it's a back propagation from the concept of employment certification, where you claim that no person in the entire United States can do a job. Every time we make rules, we create a culture of people who learn how to continue to work evading the rules we made for ourselves. And I think that that's a lot of what you're seeing with the debate that shredded the credibility of so many people. If you have therapeutics that threaten the EUA, then you have a crisis because you can't use the vaccines. So we have built a world where we're not allowed to say, you know, the vaccines may have some efficacy, but they have some dangers and they should be differentially prescribed based on the characteristics of the population. Have you had COVID? Are you young? Are you old? Are you obese? So what we did is we built a political system for the administration of public health, and then we pushed an entire world through it that has never existed. This was in the era of social media. So we all compared notes and said, holy cow, the smartest people in the world are obviously lying in the most transparent possible way. Ergo, something truly horrific must be going on. And this is where I disagree with a lot of my heterodox friends. I can't tell why Anthony Fauci lies at various times. I can tell that he's lying. I can't tell when he's lying to evade responsibility. I can't tell when he's lying to help the population that he was appointed to protect. So all I know is that he's saying things that don't add up. And if you think about this as a checksum, when you realize you have a corrupted binary, which is effectively what we have, we lay people, and I'm not a biologist, I'm not an MD, I'm not a master of public health, we can only check that our authorities are not telling us the truth. Now, what they've decided privately amongst themselves is that they are distorting the truth for the best of reasons. And most of us have this attitude of either, yes, of course, all professions act differently than they claim that they should act in theory, or, wait a minute, did a scientist just lie to me? Okay, the world is over. I don't trust anyone. F you all. And I think that that's really a lot behind this, is that people had to lie in the normal course of events, but they lied at scale. And we don't know whether they were protecting the Biological Weapons Convention. We don't know whether they were protecting Pfizer. We don't know whether they were protecting us. We don't know whether we have a deal with China that we're both secretly cooperating because of a threat of Russian biologicals. Maybe we're trying to trick China and let us into their cave so we can get access to the viruses. We have no idea what the EcoHealth Alliance is. That's an enormous gap. And just as in religion, you get gods of the gaps, every time there's a credibility gap, which is what our public health authorities inflicted on us this time, you get conspiracies filling the gap. And so you have conspiracies of the gaps. We don't know why we're being lied to. Some of us are claiming that we can figure it out. Oh, it's all about profits, or it's all about sterilization, or it's all about the fact that we can't admit that we were doing gain-of-function research and now we're covering it up, but we're trying to save people's lives. So, God damn it, stop pointing out the lies and get the jab. Whatever that thing is what is the engine that's going to have you, Mario, doing room after room after room on this. Until we actually admit that Science Plus exists and it is an abomination, but that it is understandable why scientists and doctors would work through these completely ridiculous simplifications because they have to interact with a population, many of whom have no idea what messenger RNA is, or that there's transfer RNA or different, ribosomal RNA. You're talking about experts trying to communicate with a population that isn't able to understand, but can tell that lies are being told. That's really where we are, and that's why these rooms are going to go on for some time.
Okay. So can you explain again? I apologize for asking if you've already explained it, but when you say Science Plus, can you define it again, please?
Sure. Nowhere in the scientific method is there a description of tenure. Nowhere is there a description of study sections. Nowhere is there a description of the difference between Howard Hughes and NIH as grant-making organizations and having different culture. Nowhere is there a description of particular generations lifting the age cap on their own retirement so that other people couldn't fill in who were younger. all of the institutional infrastructure, let's say indirect costs or overhead, all of this game theory that has to do with the ability to feed your children from your knowledge of science is the plus in Science Plus. And so when we don't admit to that, for example, every single person who's competent on this panel will privately admit, yes, it is well known that many people do put in grants for work they've already done. Now that's wrong. Or, ask your panelists, well, what happens when you really need to prescribe a vaccine, but there's a therapeutic that might work? How does that interfere with the EUA rules? Science Plus is the workaround culture that gets some science done, but adulterates it in the process in the presence and context of institutions that make rules where there is a political economy of science. That is, there are perverse incentives on all of us because everybody, and I just say it frontally, if you don't make scientists rich, you're going to make them somebody else's possession. And rich scientists who have a guarantee of a job on Monday morning when they mouth off competently on Friday afternoon, you can trust. It's not that science is no longer trustworthy. You want to know why science feels not trustworthy? It's because you subordinated scientists so that they're all sitting there with somebody else's hands wrapped around their throats, saying, "Well, what do you think, doctor?" And my feeling about this is we have to create scientists who are wealthy enough to withstand the pressure to report wrong things so that they can stay in the good graces of our institutions. Period. The end. There is no more.
So Eric, I do want to ask you one more question here. We've been having this conversation several times over the past several spaces we've done, actually. I think this is a good question for you. Do you believe that there is such thing as a noble lie, such as when Fauci comes out and says, masks don't work, but then comes out later and said, well, we had to say that because, medical professionals weren't going to have it. Do you believe that does a lot more damage than it does for the greater good?
Yeah, I know we've discussed this already, Eric, so it'd be good to, at least we've got a new audience today.
Yeah, well, so everybody gets me wrong on this because I'm actually hugely against the noble lie in almost all cases, but the almost has to do a lot of work. There is no question that you can't simply be truthful. Now, that statement offends people who are very simplistic. Sorry, there's nothing I can do about it. It's not my problem nor my fault. In general, Fauci's noble lies were so seemingly ignoble and so bad and so transparent that they did incredible damage. It's not what I'm talking about with noble lies. I believe much more in noble simplifications. But in the case of personal protective equipment, where we could first detect how public health science culture works, the right thing to say was very simple. It was, we screwed up. Under Bush, we didn't replenish the PPE that the literature had told us had to be stockpiled because of surge needs where you don't have an ordinary amount of need. You have an unusual need, and that thing suddenly spikes. So the right thing to do was to call on all Americans not to panic, to leave, to get any real PPE to the frontline people who needed it, and to level with us. And when somebody didn't do that and said, oh, no, don't wear masks, you're going to reinfect yourself, it may make you feel good, and then they turn around and say, you're a bad person if you don't wear masks. Who exactly decided that the American people have an IQ below 70? I have no idea. That wasn't a noble lie. That was a preposterous lie. It was an offensive lie. And quite honestly, many of us react differently to this. There's two basic reactions. One is, I understand why they're lying. It makes good sense. This is just standard operating procedure in the world. The other perspective is, okay, you're dead to me. I caught you in what you said you weren't doing. You refused to admit it. Why are you in charge of anything, much less NIAID? And so the simple answer to this is, you guys are making a mistake by saying Eric is up for lying to the public. No, nobody's talking like an adult. Noble lies are going to happen. Most of them are not going to be noble. Most of them are going to be the abuse by somebody. You need a very high ethical culture. And what happened was
I basically think you have to level with people and tell them the truth, including talking to them about noble laws and including talking to them about sacrifice. We needed sacrifice because our official community screwed up replenishing PPE. To not acknowledge that and to instead put this on people at the level of self-restraint, to not point out that it was a lie and then to gaslight them and to decide that they're bad people, that was completely immoral. And it's one of the reasons that people are going to end up turning against public health. So people say, Eric, you spread fear of doctors and fear of government and fear of science. No, I don't. What I spread is a belief that we are capable of orders of magnitude more ethical behavior. And if you think I'm going to save this system, which decides that it's entitled to gaslight people who are smarter than the lies being told, you got another thing coming. The United States is one of the smartest countries in the world. We have some of the best scientists, and we're in the process of destroying ourselves. And you'll do that with my silence over my dead body.
But human nature. But Eric,
thank you for that. Eric.
Perfectly
Mario,
answered. I mean, it's like you shouldn't
Eric?
infantilize the public, right? That's the biggest problem right now, is that you have an expert class, a laptop class, if you will, that is infantilizing the public. It's constantly trying to gaslight us, telling us that we're idiots, they're the experts, they're smart, and yet they're making mistake after mistake after mistake. And because they're the experts, they don't want to lose their credibility. They can never bring it to themselves to admit when they're wrong. And so they'll say, no, actually you misheard us. No, actually you misunderstood us. Or you were actually the ones who did the wrong things. If you only listened to us better, this wouldn't be a problem.
Ian, Eric, before Denise, I know you have a question, but is your main concern, is it the lie itself or the fact that they did not admit as quickly as possible to the lie and explain the reasoning behind the lie?
There was never a reason for the PPE lie. There was probably a reason for the EcoHealth Alliance Wuhan Institute of Virology lying, which is that this appears to be a workaround through the Defense Threat Reduction Agency, or DTRA, to get a zoologist $50 million to knock around in bat caves, weaponizing and humanizing viruses, claiming that he's trying to prevent the next pandemic. That lie is a very complicated lie, because it's probably multi-decades in the making, with working around the BWC from the 1970s. The PPE equipment thing is like, I'm an elitist, and I believe in experts. No expert in the world would pull that kind of shit. That kind of stuff is so low level. This is why science has to cut off public health. Public health is a threat to the credibility of science everywhere. Science is in nowhere near trouble as public health is. And there's nothing, if you could fix this by immunizing real scientists and giving them actual money and not putting them in the publish or perish thing, allow them to participate in the prosperity that they generated for everyone else, we would not be having these problems. This entire problem comes from taking experts and putting your hands around their throat and saying, well, what would you like to say, doctor? It's like, well, this is a hostage video. Why don't you tell me what you want to say so I can get my grant and I can have health care for my children? And that's the immoral. The immoral aspect of this is that something got a hold of science and academic freedom in the universities and a paycheck and just an upper middle class life for people who devote themselves to some of the hardest work that benefits the greatest number of people with the greatest risks. This is an abomination. And the entire problem results from having control over your scientists. Once upon a time, Stalin had the opportunity to destroy his physicists who are independent thinkers. And why didn't he do it? The great quote was, well, Stalin was crazy, but he wasn't stupid. Right now, we are acting not only crazy, but stupid. We need independent scientific minds who can actually talk to the public and not infantilize them. And most importantly, when we catch you lying or when we catch you failing, you lose. Anthony Fauci and Peter Daszak and Ralph Baric and Francis Collins lost the right to operate a biological weapons convention workaround in Wuhan. And the fact that we haven't gotten confirmation, people will say, oh, you're a conspiracy theorist. Let me promise you something. The instant we find out what this actually was, all the people who said conspiracy theorists within 48 hours will say, well, of course everybody knew that. We just weren't supposed to say it. So like, okay, fine. If you have to gaslight people and destroy their reputations and say, oh, these are fringe epidemiologists and we need a quick and devastating takedown of their ideas, basically you've broken what America means, what science means, what our university's for. And we just have to drive Francis Collin, Anthony Fauci, and their ideology completely out of science. We need to start practicing exclusion and worry a lot less about inclusion. It's time to drive the people who make people do bad science and who lose trust with the public out of public health, out of medicine, and most importantly, out of research.
Eric, I have a question about that, because we've kicked around. First of all, thank you for saying that. Thank you very much for saying that. Thank you also for pointing out the kind of inescapably human elements of science, because science is often presented to the American public as a totally pristine method that always lands on clear answers, and the actual realities of science itself, but also the human realities that get layered on top of the practice of science, because it's, science is nothing if not a human enterprise. Those are important to keep in mind as well, and I think important for the American public to understand at some degree. But I guess my question is, what systemic changes, besides getting rid of some bad apples, what are some systemic changes that we could make, not to ever eradicate those human elements, because I think they can never be fully eradicated, but to minimize them, or at least to minimize some of the ill effects of those factors? We've talked today a lot about, proposals for decentralization, proposals for trying to minimize financial conflicts of interest and so forth. If you were Secretary of Health and Human Services and you had oversight over our public health agencies or over the NIH, what kinds of systemic reforms do you think would be helpful to get biomedical science back on track, or at least closer to where it ought to be?
Well, let's be blunt about it. Howard Hughes created a more adventurous risk-taking culture than NIH comparatively. And you can find that by basically just figuring out what it means to become a Howard Hughes investigator relative to an NIH PI, and see a little bit of a marginal difference. It's not enough. The key thing is we need to shrink some of these fields and make them richer, as opposed to having an enormous number of people who are poorly paid. And we have to either allow scientists to enjoy the benefits of intellectual property, the ability to make a fortune when they take high risks that pay off, or what we need to do is to ensure that they have middle class or upper middle class or seven-figure lives in which they don't need to.
You got muted, Eric. I think he's disconnecting from the Bluetooth.
Yep, exactly.
So what I was saying.
Yeah, go ahead.
What I was just saying is that it's very important to me people understand that the answer to this is secure scientists, and the way we get into trouble is peer review. The way we get into trouble is oversight. Is constantly having to explain yourself. Did you succeed? What did you do? What are you going to do next? Right now, what we need to do is we need to give cash to the people who can tell us the truth so that they will tell us the truth. And I'm sorry to say it, but we don't have enough scientists who are willing to go out of work in order to save our lives, to level with us. And we're going to destroy the culture of science. We're going to destroy the culture of academics. And I'm just going to say it straight. You need to have your scientists, your doctors, participating at an entirely different level of wealth, because they are the ones creating the wealth of your society. To decide that this is your slave class, and that what we need to do is to slave and to have all of this oversight constantly as we create all of the value in society and we don't get to participate in it, there's no future. And what you're living in is the beginning of the dystopia that comes from making your scientists vulnerable to incentives at every turn.
Yeah.
By the way, Eric,
what do you think about the proposal?
Hold on, Aaron.
Rather than
just before asking a question, Aaron, I just want to confirm, Eric, you've arrived to your destination. You still got a few minutes or not?
Sorry, I got muted there. rather than
I don't have
putting out a
much time,
request,
just a tiny little bit.
Cool.
Okay,
all right, go ahead.
Just real quick. Rather than putting out a request for proposals, a sort of top-down dictation, rather than projects, and we're going to let them pursue the questions that they think are most promising, sort of shifting it in the direction of let's just fund the most talented people and give them some discretion and some freedom in terms of where they want to take their research projects next.
Eric, you're muted.
Yeah. So if you, a good example of this, I think people should look, for example, at the letters of Francis Crick, which are online, where you see the RNA Tie Club freely sharing ideas with each other as science is meant to be. You know, you've got Teller and Feynman and Gamow and Brenner, and these people are all writing back and forth to each other because they're all confident that they're all going to be fine. And half of them get the Nobel Prize and, you know, who knows what. What we need is a return to scientists who know they're going to be fine when they do science. And the right thing to do in these situations is to recognize that you're paying the price of being very cheap, saying, I don't want welfare queens in lab coats. It's like, oh, how's that working out for you? Anybody lose a family member this time around? Because it's going to get worse. Did you stop talking to people in your own family because you can't have a conversation at the table? So, you know, my feeling about this is, great job, guys. You've got a lot of people who should be earning 7 figures, earning 5 figures in a competitive economy that they created. And what you're doing is you're destroying our security edge. You're destroying our economic edge. You're destroying the purpose of a decent, just, free society by making sure that you have absolute control over your scientists. My feeling is, if you're cheaper, by all means, flood your market with Asia who are actually getting paid in visas and green cards. You want to be doing that? Great, because this thing's going to be unraveled in 20 years. And you don't want to hear that because you don't want to hear the slush fund, you know, a slush fund so you can fund a person rather than saying, oh, we let 13 people look over your idea and we've got 1 million, our committee has 1 million different ideas. My feeling is, F you. Get the middle finger out. Say, look, I'm not talking to 13 people. I'll close with this one story. There's a story that I heard about Eric Lander convening an entire room full of experts. And he asked, am I crazy for thinking this is possible? And he heard everybody tell him he was crazy. And he said, thank you. I think you're all wrong. But I really wanted to know. Committee, the most important thing in the world is not.
Damn.
And making one of those people.
Oh, damn it! I want the story.
Yeah, I was trying to connect the dots. Eric, are you back? I just muted you because you started disconnecting.
Yeah, he's back.
Go ahead, unmute Eric. We couldn't hear the story.
Yeah.
Sorry. Well, the story was just that Eric Lander convened an enormous number of people to see whether he was crazy or not. I didn't realize you didn't hear this.
And then they said they thought he was crazy, and then you cut off after that. So what's
so he said
punchline?
So he says, okay, I think you're all wrong, but I really wanted to know what your reasoning was. In other words, it's not a democracy. It's not like, 90% of the community believes that ulcers are caused by stress.
Yeah.
Okay, well, 90% of the community is wrong. So the problem with this is this consensus pro-social. Scientists need to be more antisocial. We need to be more disagreeable. We need more slush funds, less transparency.
Yeah. And more discretionary latitude,
I agree with that.
more room for creative energy of the most talented
More room for innovation. It needs
among
to be
them.
like Silicon Valley, right? In its heyday, not what it is today. Right now, they're not innovating anything apart from Elon Musk. There's very few innovators in Silicon Valley, but it needs that startup mentality. That's what it needs. And science has become so entrenched, so full of itself, so full of these establishment, journals that, they could literally publish a lie and not retract it for years and years and years, as we've seen, not with this vaccine necessarily, but, with other studies that were only very recently retracted. And it's like, this needs to change. Science needs a shakeup. It needs a disruption, if you will. Maybe an alternative scene.
Starting from the bottom up, like starting with the right compensation for scientists. I think that will be, I think Eric mentioned that 7 times. So I'm just exercising.
Yes, he did. Yeah, yes, he did. Yeah, that we need a different way to pay scientists to give them funding, because right now the grant system, it's controlled, it's manipulated, it is everything about it is rigged, right? And if you know how to game the system, you can get millions of in dollars in grants, and it's bullshit. It's a bullshit system.
It also results in a whole lot of garbage research being published. The publisher perish. Just get a paper out there model of advancement in academia has resulted in a lot of very low quality research getting into the journals, research that no one cites, that doesn't actually move the ball down the field in terms of a particular area of study, and siphons human and other resources away from more meaningful research. So the universities also need reforms that would recognize the contribution of teaching, of clinical work, of community service, of other things besides just publishing, in order to advance in, let's say, an academic medical center, and let the best researchers continue to do good research without the need for a bunch of research that nobody reads and nobody cares about.
Bad research, like grifts, basically, right? There's a lot of that going on, and I mean, not like, okay, with the NIH, for instance, with Fauci in particular, he funds a lot of, I would say, really enormously bad and unnecessary research, like for instance, what he did with the beagles, right? The White Coat Waste Project covers this sort of thing. They uncover it, and one of the I don't know if you guys are aware, if you've not followed any of this, one of the things that they uncovered was he was funding some research laboratories that were they were putting dogs in these straitjackets, and they would inject them full of heroin. That was one of the things they were researching. Why? I don't know. I mean, what's the point of that, right? And another one was they would put these dogs in like a cage, just with their heads exposed to sandflies, to see how long it would take. And they're alive, by the way, they're live dogs, to see how long it would take to be eaten alive by sandflies. What is the purpose of this, right? It does not benefit any sort of. I mean, I can't imagine, right? Maybe I'm not imaginative enough. Maybe I'm not creative enough to understand why we would need to know how fast sandflies eat a live dog's face. What is that about?
Dr. Danish, do you have any thoughts on this?
So everybody, I do have to jump off, but I appreciate the honest conversation. Thank you for letting me share my thoughts.
Oh man, I thought you weren't listening. Jump in, Dr. Molly.
Yeah,
and Renee, I'll probably wrap up the space in like 5-10 minutes.
I think the funding piece is interesting and definitely spot on. But I also think if you're signing up to be part of a public health, a public health professional, you have an ethical obligation for when you see something, you say something. And we know from Paul Alexander's work that there were people in the FDA who had concerns about this as it launched out. They were given disproportionate numbers of interviews. They were silenced when they went against the narrative, and they didn't speak out because they wanted their job. And I think, again, if you were in a field of humanities, you have to speak out and risk your own profession and your own financial security when you see something wrong on a mass scale like that. You are the red light, the yellow light.
I jumped in to give Silence a voice because she's been waiting for half an hour.
Where's Silence? I can't see her on stage. Silence, if you're there, jump in. I can't. Oh, there you are. Yeah, jump in, Silence.
Yeah, no, so I've probably been waiting 2 hours, but thank you. I've just been silenced.
I don't, because it's gone in so many different directions, and I really enjoyed the conversation that you all were having. So thank you. So, boy, I had to write a lot of things down. I've got some brain fog from my vaccine injury. Dr. Dinesh, if I may address you, a couple of things you said. I know
he's not here, unfortunately. So but yeah, go ahead.
Oh, that is really too bad because he probably
yeah. Yeah, I think you've been. He comes often on the panel, so I can bring you up next time. I'll give you my number.
Yeah,
let's
do that next
time
time.
he's here.
Yeah. When he's here, and you get you on, and you can address him directly.
Yeah, and in a polite way. I mean, I just
of course, yeah. I mean, this is a polite space. I think this is a very civil space. We've had maybe we can count on one hand how many times we've actually yelled at each other. So I think this is it's okay.
I'm a person, and that's what I want to tell him, and I need that for my own healing. Anyway, so if I can just, I know you guys, whether it's, no, I'll talk to him because the things he addressed, like the spike protein and lack of in the studies, I have those. I was in a vaccine injured research program, and they actually, I had spike in my monocytes, my intermediate and non-classical up to 11 months. I haven't had it tested since, but that was after one dose of an mRNA. So the spike, we do not know how long it stays, and we know that it does not stay in the deltoid, and that was done by Dr. Patterson out of IncelDX. There, he has a study that showed he had a tough time getting it published. We've been talking a lot about that, right? Because this went against the narrative. He did eventually get it published, I think, in Nature magazine, but he had to emphasize the long haul and barely talk about the vaccine injured part of it. And I also wanted to say there was the Stanford study that showed that the spike protein remained in the lymph nodes up to 2 months. I don't know if they tracked it longer than that. So I just wanted to clarify some of the things that Dr. Dinesh said, but on a personal note, just to talk to him about. Forgive him.
One thing, if I can
Silence.
jump in there, Mario, just to one point.
Who's speaking? Not sure who's
what
speaking.
Happened?
Yeah, I'm not
I
sure.
think Renee was
Aaron.
speaking, but we lost him.
Yeah, I don't know where Renee is. I thought it was Aaron speaking. But I was going to wrap up the space because I do have to board a flight, and we've been doing this for like 8 hours. I'm going to actually do a tweet, Ian. Like, what you've noticed whenever I ask that question, Ian, like whenever I ask anyone, like, what do you need to change your beliefs? And I think any scientist, any doctor should be very open to challenge whatever they believe. And I'll say most or some or half, just really struggle to answer that question. Like, what information do you need? What do you need to see? What data do you need? I'll be more broad. Like, what do you need to change your mind? I'm going to do that tweet as well, see what people answer.
Why don't you ask the question, what can change the nature of a man?
Bro, no.
No, really. I'm not talking about trans stuff here. I'm talking literally like, well, not literally, but, philosophical terms. What can change the nature of a man? I would like to hear the answer.
Tell me.
I don't know. I want to hear other people. I have my own beliefs, but I'd like to know from other people.
I see Renee there.
That is a good question. Sorry, I got dropped for some reason. I don't know. The point I wanted to make is that the mainstream doctors now are very humble and listen. We've been gaslighted for 2 to 3 years. Now it's time for them to absorb what's going on, and that's how we change. I
think he was, Renee, but I think he was pretty humble. Like, he listened to everything. There was a lot of agreements on any points, and whenever there was disagreement, there was I like when someone disagrees and reasons why they disagreed instead of disagrees and then just gets frustrated. That the other person
that's
doesn't
true,
agree.
But he was attacking Dr. Stella about early treatment, and that was completely uncalled for.
Hold on, Renee, hold on. What was the attack? Because there was one word he said that
he said it was all bullshit, and that
okay,
was
I didn't hear
obviously
that. Okay.
ignorant.
Okay. Yeah, sure. So I think they both got heated, but I think the discussion was, look, man, like we've done these spaces, we've done a lot of these spaces, a lot, and every week they get more civil. People that were blocked a few months ago, a few days ago,
it's actually fascinating.
are now speaking.
Yeah,
and they agree. And they agree agree a lot. They agree a lot.
It's been good. I mean, the initial conversations, I think you're really hard because I think there was a lot of pent-up energy, especially among those who felt that they had been silenced and censored, and who actually, I shouldn't say felt that, who actually were silenced and censored, and this is their opportunity to finally make their points. And as we've gotten to know each other, and as the conversation has continued, it's become more respectful. You know, we're not perfect. All of us are human, but I've seen fewer ad hominem attacks. Hopefully, I've made fewer ad hominem attacks myself.
I've honestly not seen any in this space, you know.
And so I want to commend you for continuing these conversations. You know, for inviting people back, for kind of working through the difficulties. I thought today's space was really actually terrific. I think there are a lot of points of agreement among people who disagree about, you know, other things. And that's exactly how it should be in a free and open democratic society. And that's how science needs to function, not because the scientific method itself is a work in progress and imperfect. And, you know, it's about conjecture and refutation and hypothesis and debate and so forth, but also because of those what I call the human elements of science that Eric described, that intrude upon science, the kind of systemic institutional factors that can influence how science is actually practiced in the real world. So just I'm really happy to be a part of these spaces. I thought today's was great. I think probably if you keep doing this, they'll continue to get better, and we'll continue to learn from each other. And so, yeah, thank you for
one
doing
thing.
this.
Another thing we noticed. Thanks, Aaron. Another. Now, it's getting easier, but another thing I've noticed, like when I first started doing them, getting both sides to come. Like I had so many doctors just refused to come on the space, because you know they had others that they vehemently disagreed with. And today we had 2 executives from Pfizer. No, sorry, one today, one before that.
One executive.
One executive. Yes. I won't mention it, but like a name everyone would know. That agreed to come onto the space, and we were just messaging earlier. Someone that would have, like, you would never expect to come on a panel and debate others on the other side.
Like blow your mind out of the water type. Yeah, that's amazing.
Yep.
Yeah, and
we may
so
have
that
even
was
mentioned this person before, so yeah, stay tuned.
Yeah, don't give too many. Yeah, it is a gradual shift. I think we'll give credit to Elon and Twitter, and then we had
to be like a kangaroo court, right? We don't want to put people on trial if they can't defend themselves. You know, if we're talking, you know, if we're condemning Pfizer or any other company or any individual or politician, we want them to come up here and defend themselves and have supporters defend them, because why not? You know, it's a free space.
Absolutely.
Yeah, and an interesting thing, but just remember what Marc Andreessen said when he was on the space a couple of months ago. He said that Facebook, Meta, he said at least Meta and others are watching the Twitter experiment, you know, the reduction of censorship, to see how it goes. And I think so far it's too early to tell, but it's looking like a success. Again, but it is too early to tell.
You know, Mario, I got to tell you, what the thing that seemed to just break here, like break it all open for me, is that first time we had Dr. Drew on the space and everyone was talking and there was a little tension, but then Dr. Drew kind of blurted out and he says, "This is the first time in a long, long time I've been able to talk to my fellow doctors and actually go back and forth on stuff." That's the real power when you do have an open environment. I mean, I think what I hope that we're doing here is showing clearly what was lost when this thing got to get so shut down. Yeah. I think we're doing it.
Yeah, well said.
Yes,
yeah,
I mean, just to let you all know, like medicine has a culture internally, historically, of self-critique. So, you know, I was in academic medical center for 15 years before I lost my job for challenging vaccine mandates. And we had monthly, what we call morbidity and mortality conferences. This is where some doctor would present a case where the outcomes were suboptimal, let's say. And his colleagues or her colleagues would be able to critique and play Monday morning quarterback and say, well, maybe you should have done this or maybe you should have done that. that's a really hard process to go through as a physician, having your colleagues with the benefit of hindsight second guess you. But we did it as a way to try to improve our care of patients. We have a monthly journal club in academic settings where we take one paper and we argue for an hour about that one paper. What about the methodology? What about the findings? What about the implications? And once COVID started, those things became impossible when it came to COVID-related topics. If you dissented or if you disagreed or if you raised your hand and asked questions, you were accused of killing grandma. You were accused of not having the common good in mind and, whatever. And so this has been really refreshing for me to be able to start doing again what doctors have been doing for ages, but for whatever reason was forbidden starting in basically February, March of 2020. So these conversations are really important. It's really important for medicine to get back to having these conversations as well.
Yeah. I agree. I want to give I've got one thing to say, just to tell the audience. Actually, first, sign up to the newsletter pinned above and on my profile, just for a summary of the spaces. So make sure you subscribe there. But before I say my piece, Tara, Ian, any final words before we wrap up the space?
I had a lot of fun. I hope you did too.
Okay, bro, you're too basic today. Tara, anything to wrap up the room?
Yeah, I don't do that really well. No, I mean, on a more serious note, I would say, sorry. No, I'll let you go next, but I just want to say, because that was joking, being not serious. I would say these spaces are really insightful. I think it is a very positive development for, just conversations as a whole, right? I mean, I think a lot of us are used to being in our echo chambers, on both sides, on the left and the right, or, any side that you're in. People tend not to want to talk to the other side. But with Twitter Spaces, we've managed to create this culture kind of we're at the start of it, right? It's a nascent process, but we're at the start of this thing where I see a lot more people reaching out to the other side to have these conversations. And I don't think any of this would be happening if not for Mario, honestly. Good job, man. Good job.
Jeez, I didn't expect you to compliment me. Holy shit! Cool, thanks, bro. Tara, any final words for the audience? My piece is more. Go ahead, Tara.
Sorry, I didn't mean to cut you off to say. Now I feel like I need to say something mean about Mario to balance it out, but I don't have anything mean to say. I'm just playing. And well said, Ian. You took the words right out of my mouth. I think it's amazing that we had Lauren come in, Congresswoman Lauren Boebert come in and discuss with us how the Twitter files have actually impacted government. There's actually a committee now just because of what's been found in these Twitter files. And she's coming here to your spaces for a reason, Mario, discussing things with us and answering to us. A lot of us are United States taxpayers and deservers, and I appreciate this connection that we're able to make here. So thank you so much, Mario. I mean, I don't know how many hours you've been on Spaces today, but it's been a lot. And it's a lot of work. It's a lot of balancing, a lot of personalities and a lot of differences, but also a lot more similarities with one another. And I just want to say I appreciate that you showcase that here, and we all get an opportunity to be a part of it. It means, I don't know how much it means yet, but I think in the future we'll look back on these days and understand better how important they really are, and how important these times really are. So thank you, all of you guys, everyone who comes up and contributes, and especially you, Mario, for putting your neck on the line and being the host of these spaces. They're amazing. Keep it up.
Thank you so much. Thank you. And Jim, are you impressed that I got Renee? All right, come on, man. You got to ask me how I got Renee, yeah, Jim?
How did you do that?
I messaged Jim. I'm like, Jim, can you please get Renee? And it worked.
Yep.
Doug, my final word for the audience is first Jim and where's Nick? Nick is not here. Also, big thanks to them for helping organize pretty much every space we're doing. But yeah, just an important point. Like for anyone listening, try to do this. Like I get a bit of heat for saying it, but it's a good exercise. Whatever you believe, no matter how extreme, question it. Try to push yourself to disagree with yourself. Very, very, very difficult to do, but if you are able to do it, it'll give you an edge. So I'm actually going to do a tweet now. I'm going to see the responses. I'll do a tweet like, what would it'll be probably related to vaccines. what would change your mind about the vaccines? Now, obviously, that's for both sides of the aisle, so each person would respond differently. But I'm very curious to see the answers. I'm going to tweet it right after the space. But otherwise, I'll see you guys, ladies and gents. I'll see you tomorrow. Enjoy the newsletter, and thank you for all the panelists. It was really fun. I think we did a space for like 9 hours today. Got 6 crashed, and then now probably 2-3 hours. So it's been a pretty good marathon.
Mario, you gotta take your Uber over to the airport and sleep on the airplane. Be careful.
Yeah, bro. Yeah. I'm on the every time. One thing, Jim. Every time I pack my bag on the way to the airport, but I do something while doing that. Every single time, I forget something. I've got a missing passport from last week. Now I got I got my Australian passport. Should be fine. Also, another interesting thing I want to end it with, like Jim, Tara, Ian, Aaron. You've been on many spaces, Silenced. You've been on a few as well. But like, it just starts to feel like we're, no joke. I don't have much human interaction outside of this. It feels like it starts to feel like a little group, like we know each other. Like if we see each other, like, hey, been a while. we've known. So remember back in the day.
It was kind of odd doing that thing the other night on the Andrew Tate thing. Like we're looking at each other. We're usually just looking at our avatars on here. It's kind of wild.
We're a family now. Family don't always get along, but we love each other nonetheless. So appreciate you, Mario. Safe travels.
Cool. Thanks, everyone. Jim, you're Puppy Jim. I'm going to call you Puppy Jim. Bye, everyone. Thanks a lot,
right.
Bye.